ASA has to be up to 8 class. So the same information is written in 3 places. The ASA need to be 1 ASA for 1000 and C need to be 8 class pass. So please do not trust on experts like me. We can do mistake, trust on evidence. We have to practice evidence-based medicine. So there is 1 ASA for 1000 and C need to be 8 class pass. Now, one controversial question is about vaccination. This is the photo directly from the guideline by Ministry of Health. कि what is vaccine sensitivity to HIT? सबसे ज्यादा जो sensitive vaccine है HIT के लिए वो है BCG. BCG after reconstitution is most sensitive. Second most sensitive is OPV and rotavirus. तो basically जो live vaccine है, live vaccines को most sensitive to HIT है और least sensitive है pentavalent Hep B और PCV. Now vaccine sensitive to freezing जो मोस्ट सेंसिटिव है वो हेप बी पीसीवी है. तो इससे वो क्वेश्चन कैसे क्रिएट करते हैं कि सपोज यू हैव एन आइस लाइन रेफ्रिजरेटर एट योर पीएचसी. नाउ इन द आइस लाइन रेफ्रिजरेटर which vaccine you will keep at the base, which vaccine you will keep at the top. So at the top we will keep those vaccine which are sensitive to freezing. क्योंकि अगर हेप बी पीसीवी को हमने नीचे रखा तो नीचे रखने से उनकी कुल्फी जम जाएगी, वो यूजलेस हो जाएंगे. Hep B PCV are more sensitive to freezing, so we cannot keep it in the down part where the temperature is much lower. We have to keep them upside. And base will have the live vaccines, because live vaccines need cold temperature throughout. But remember, vaccine sensitive to freezing, most sensitive is Hep B PCV and least sensitive is tetanus. Least sensitive is tetanus. Okay, that's why we can keep tetanus vaccine in most of the shops and all, because it is least sensitive to freezing. Even if the temperature is gone in the fridge, TT will maintain itself. So this freezing part is very simple to understand. If you have an ice line refrigerator, in the top part you have in the ice line refrigerator Hep B PCV, and in the bottom part you have the live vaccine. So you should also know the classification of vaccine to answer many questions from this. And there is total, if you see, before starting this topic, I want to clarify this thing, that you should remember live vaccine for sure. A lot of question come that which of the following vaccine cannot be given to HIV patient, not given to a child who have nephrotic syndrome and is on steroid, not given to pregnant female, है ना? So it is, of course, all those clinical question can only be answered when you have this knowledge that if there is any live vaccine in HIV patient, pregnant female, or in any kind of immunocompromised person, we cannot give such vaccine. So to remember the live vaccine, first knowledge should be that BCG, MMR, these two are live. Okay, and that's why if you have opened these two vaccine, you have to reject these two vaccine within 4 hours of opening. जैसे खोला, अगर if you will not reject it in 4 hours, it can lead to anaphylactic reactions also. So, and you remember BCG, reconstituted BCG is most sensitive to HIT. So if you keep it in open for more than 4 hours, it can cause some anaphylactic reaction. So most sensitive to HIT is BCG, least sensitive to HIT is pentavalent Hep B PCV. Okay, so that's why you have to remember this thing, you have to reject it quickly. Now, other than these two, we should know that all the oral vaccine is always live. Because oral vaccine has to go in the intestine and multiply there, so they have to be live. And what are the oral vaccine? We have rotavirus, typho oral, they both are live, and OPV is also live. Of course, OPV is also live. Then the last two is yellow fever and varicella. These two are also live. And yellow fever is only live vaccine which in very emergency condition can be given in pregnancy. Only one live vaccine, but very rarely it can be given in pregnancy. And if you give vaccine of yellow fever once, it will give immunity after 10 days and immunity will remain lifelong. And varicella have Okka strain. So You must have seen that performance of Sakir also. Sa villa villa, sa villa villa. It's time to Africa, waka waka. Hey, how was that performance? I'm not saying hot or cold. That was live performance. Now, this varicella vaccine with Oka strain is also live. So varicella, yellow fever, 2 oral, typho oral rota, and 2 important BCG-MR. These 6 live vaccine you have to remember. Remaining 5, they are both live and killed. And this 5 can be remembered by the mnemonic CP pe IJO. Come to CP. CP is Connaught Place in Delhi, Center Point in Aligarh. And when in our time you have to call someone on date, you used to say ki come to CP. So what is CP pe IJO? C for cholera. And because they are both live and killed, so usually the question do not ask from these 5. They ask from this 6 because they are only live. And these 5 are live killed both. What is that? C for cholera, P for plague. Second P is of course polio. Polio have both live and killed. Then influenza. Influenza live vaccine is the only vaccine which is given by nasal route. Nasal route only influenza live vaccine. And J for JE. They keep asking this question that how we give JE, which side we give JE, 3 times asked question. So remember, in India, the strain of JE which we give is live strain and the name is SA 14 2 bar, 14 2. And this live vaccine of JE is given by subcutaneous route. Now, measles vaccine MR is also given by subcutaneous route. Now they ask which side we give JE, which side we give MR. So M for MMR, M for mother love. And we all know mother love is always right. So MR goes in right side subcutaneous and JE go in left side subcutaneous. And we give live strain in India. Okay. So these are very important part. Now let's go to read about first the health system of India. And in this part, they first ask which work ASA do, which work ASA do not do. So if you know that these are the 4 work which ASA and Anganwadi don't do, then you can easily answer what they can do. आपको ये पता है कि आशा आंगनवाड़ी क्या नहीं कर सकती हैं, तो आप आसानी से बता दोगे कि क्या क्या वो कर सकती है ना. तो what 4 work they cannot do? First work they cannot do is they cannot give vaccine. They cannot give vaccine but paid for every vaccination. Why? Because they work as motivator. They go to the house and motivate mother and mother-in-law for vaccination. So they are paid for every vaccination, but they are not paid for 3 vaccines, which are BCG, OPV, Hep B. Why they are not paid for OPV 0 dose? So why they are not paid for these 3? Because these 3 are given at birth. और बर्थ के तो माँ और सासू माँ दोनों अस्पताल में है, तो आशा किसको मोटिवेट करेगी? ससुर जी को, है ना. There is no one at home at birth to motivate because mother and mother-in-law both in the hospital. So she will not get paid for these 3 vaccines, but she will paid for all other vaccine because she work as motivator. Second work which they don't do is theoretically they don't conduct delivery also. Okay, this is the work of A&M or nurse. Third thing is because they are not conducting delivery, so they don't measure birth weight. Okay, because it is happening in hospital, so hospital staff will do it. And most importantly, they both don't make malaria slide. So who make malaria slide? This question they ask, this is made by multi-purpose worker. And this multi-purpose worker make it by active surveillance. What is this active and passive surveillance? See, अगर आप जा रहे हो खोजने केसेस को और केसेस छुपे हुए हैं कम्युनिटी में, तो when the health team will go and search for hidden cases, we are doing something actively, we call it active surveillance. और जब पेशेंट खुद से अस्पताल आ जाए और अस्पताल आके रिपोर्ट करे, तो यहां हमने कुछ नहीं किया, इसलिए हम इसको कहते हैं पैसिव सर्विलेंस. दिस क्वेश्चन हैज केम इन नीट एग्जाम that there is a cancer ward patient who is reported to cancer ward. So if you are reported in cancer ward, this reporting happened because you came by yourself. So this is passive surveillance. Passive surveillance is for all those cases who get themselves notified. So passive surveillance is for notified case. active surveillance is for hidden case. And if you mix active plus passive surveillance, it becomes sentinel surveillance. So sentinel surveillance is for all cases. What is the best surveillance? Best surveillance is sentinel surveillance. Okay. And in all the program, like HIV also, malaria also, TB also, we do sentinel surveillance. We send someone also for searching cases, and we have reporting of notified cases also from passive surveillance. But here MPW is doing active surveillance, because MPW is going and making 2 malaria blood smear from every case of fever, and he have to roam around in the village once in 14 days. And when he make 2 malaria smear, the one will be thin, one will be thick. A lot of question come from this part, because it is the intersection of both PSM and microbiology. When they make thin smear, in thin smear you can appreciate 2 type of plasmodium. One plasmodium which can have in the RBC banana shaped gametocyte or headphone shaped gametocyte. If you find banana or headphone shaped gametocyte, it is Plasmodium falciparum. And if you found the gametocytes in which there are pore softeners dots like thing, this is Plasmodium vivax. And how this thin smear is being made, you can make it by acridine orange also, but the gold standard staining is Gayamja staining, by which we make this stain, and by thin smear we confirm that which species is it. Okay. Now one more method of doing active case detection is by using rapid diagnostic test kit of malaria. From this, NEET has asked this question, that if you have histidine rich protein kit RDT, so this histidine rich protein RDT kit for malaria will detect falciparum or will it detect vivax or will it detect both? तो देखो, जब किसी को falciparum होता है तो falciparum से kidney can get damaged, brain can get damaged, there is cerebral malaria and other problem complication can occur, and patient can die and become history. So when there is falciparum, it only detect histidine, because only in falciparum patient become history. Like that you can remember. Histidine only for falciparum. And then if there is optimal kit, this optimal kit have lactate dehydrogenase enzyme, and this can detect both. Okay, this is for both falciparum and vivax. So these are some really high-eyed things which I wanted to discuss. That's why I took it here. One thing which we ignore and they asked recently is, in Anganwadi, when we give the meal, what is the calorie which we give and what is the protein which we give? And it's actually very simple to remember, because when it comes to protein, there are 3 groups of people who are getting benefit, and the protein given to them is 15, 20, 25. 15, 20, 25. So protein is so easy to remember, 50, 20, 25. Then the kilocalorie is 500, 600, and it should be 700. But here we keep malnourished children. So we give them 100 extra and 800 kilocalorie. 500, 600, 800, 15, 20, 25. And as I said, what we keep in the lowermost part? In the lowermost part, we have those people, those children who are malnourished. Okay. And of course, I hope you know the definition of malnourished. We will discuss it in non-communicable disease part also. So malnourished children will get 25 gram protein per day, 800 kilocalorie. Then all the females who come to Anganwadi, they will get 20 gram protein and 600 kilocalorie energy. And all the normal children who are coming to Anganwadi, the normal children are getting least protein and calorie, 15 and 500. So you can very easily remember 15, 20, 25, 500, 600, 800, normal children, female, and then finally we have the malnourished children. Okay. So this is for Anganwadi, one more high-eyed thing which I wanted to tell you. Now, if you look at National Rural Health Mission, one major big change has happened here. Now this sub-center and PHC, this together is known as Ayushman Arogya Mandir. Previously, this was known as Health and Wellness Center. But now in the new government, we have labeled a hospital as Mandir. which is very wrong ethically, and this is part of propaganda. And what is the difference between propaganda and health belief? We will discuss that part also. So do remember, this sub-center and PHC is now known as Ayushman Arogya Mandir. And this is part of Ayushman Bharat, of course. But earlier, of course, you have one sub-center and one PHC. Sub-center was at 3,000, 5,000. PHC was at 20,000, 30,000. And this was the older sub-center and PHC thing. So less likely to come, but anything can come. And ASA is for 1,000. Then after PHC, there is CHC, which is roughly at 1 lakh. 1 lakh plus minus 20,000. That means 80,000 to 1 lakh in hilly area and 1 lakh to 1.2 lakh in plain area. Because in plain area, people live close to each other. So we always have bigger population norm for plain area. Like, what is the population norm? 5,000 sub-center, 30,000 PHC, and 1 lakh to 1.2 lakh CHC. At least remember for plain area, 5,000, 30,000, and 1 to 1.2 lakh. And then you can remember the other part, which will be always lesser than plain area, 3,000, 20,000, and 80,000 to 1 lakh. So then this CHC report to medical college. So earlier this sub-center PHC was primary level. Now Ayushman Arogya Mandir is primary level. CHC, district hospital, they are secondary level. And medical college is known as tertiary level of healthcare facility. So this is rural health mission, but more questions are coming from urban health mission part. In the urban health mission, remember the first thing is Mahila Arogya Samiti, MAS. Have you seen that movie? Yes. Tufan Utha De, MAS. So similarly, this MAS, Mahila Arogya Samiti, what is this? They are group of female who hold monthly meeting and they report to Usha. Who is Usha? Sister of ASA in urban area. So this Mahila Arogya Samiti is at 50 to 200 houses. And Government of India think each house has 5 members. So 50 to 200 house and each house 5 members. That means Mahila Arogya Samiti will be at how much population? 250 to 1,000 can be the population of female, which is can be the population of urban area people who is being taken care by Mahila Arogya Samiti. तो उषा से नीचे होती है महिला आरोग्य समिति, है ना. और जैसे मैंने बताया कि मास जो है वो 50 to 100 हाउसेस पे होगा. थोड़ा सा एक स्लाइड करेक्शन कर लीजिए. 50 to 100 हाउसेस पे होगा. 50 to 100 हाउसेस यानी 50 into 5 250 और 5 into 100 500. तो यानी ये अच्छा हुआ. दिस मिस्टेक विल मेक यू रिमेंबर इट बेटर नाउ बिकॉज data can be misplaced. So always trust evidence. Evidence is Mahila Arogya Samiti is 250 to 500 population. And 250 to 500 means how much house? House will be divided by 5, 50 to 100 house. So 50 to 100 house or 250 to 500 is the population for Mahila Arogya Samiti. Now the second thing is this Mahila Arogya Samiti report to Usha. And the question has came from Usha already. Usha is at 1,000 to 2,500 population. तो 250 से 500 पे होगी महिला आरोग्य समिति और 1000 से 2500 पे उषा. So roughly if you take it is around 2000, but don't take 2000. The correct answer is 1000 to 2500. Now urban A&M is at 10,000 population. अर्बन पीएचसी इज एट 50,000 पॉपुलेशन. और ये भी सवाल आ चुका है कि अर्बन पीएचसी कितने पर है? 50,000 पे. उषा कितने पर है? उषा है 1000 से 2,500 से 2,500 पर. देन अर्बन सीएचसी इज फॉर 2.5 lakh population, but in metropolitan city urban CHC can be at 5 lakh population and they report to medical college. So now the question is how to remember this population now. It's not so tough. देखो, if you start from lower side, urban CHC 2.5 lakh. अब इसको 5 से डिवाइड करो. It will get urban PHC 50,000. अब इसको 5 से डिवाइड करो. You will get urban A&M 10,000. अब इसको 5 से डिवाइड करो. you will get Usha 2000, but 2000 एग्जैक्ट नहीं है, it is 1000 to 2500. ओके, तो देखो just you keep dividing by 5 and you can remember it. Start with urban CHC 2.5 lakh, then divide by 5, then divide by 5. 50,000 is urban PHC, 10,000 is urban ANM, and Usha is 1,000 to 2,500. Last thing is, if you divide this also with 5, 2,000 by 5 is roughly is 400. So mass is at 250 to 500, and in between it is coming 250 to 500 is Mahila Arogya Samiti. So this urban area structure you should know. Now, what are the questions that they have asked from this part? Let's see that. First thing is, if you are a medical officer and you are visiting a sub-center, how many pregnancies should be present in ANM register at any time of the year? If you do a sudden visit, how many pregnancies should be there? So when we talk about sub-center, we think of 5,000 population. And here birth rate is not given. So we assume birth rate, if not given, we can assume it as 20 birth per 1,000 population. So in such question, the first thing which you have to calculate is, what is the live birth in a year? Live birth in a year, and this is a direct numerical which is also given in PARC textbook. Only this one numerical is completely explained in PARC. So that's why they have asked it in 2 exams already. That how many live births, sometimes they only ask step 1. What is the live birth in a year? तो देखो 1000 लोगों पे इंडिया में 20 बच्चे पैदा होते हैं. अब 1000 पे 20 पैदा हो रहे हैं, तो सब सेंटर में जहां 5000 लोग हैं वहां पर कितने बच्चे पैदा होंगे? 1000 में 20 हैं, तो 5000 में कितने होंगे? 20 into 5, 100 बच्चे पैदा होंगे. Because there are 20 birth out of 1000 population. So in 5000 population of sub-center, how many birth will occur? Simple thing, you have to multiply birth rate with 5 and you will get live birth in a year. तो एक साल में 100 बच्चे पैदा होंगे. Now, how much is the pregnancy in a year? Does all pregnancy go till live birth? No. Some 10% pregnancy get wasted also. Not every pregnancy go till delivery. Some can have abortion, some can have stillbirth. So when they ask number of pregnancy in a year, first we write live birth, then we add 10% of live birth. This 10% of live birth is known as pregnancy wastage factor. This is the pregnancy which got wasted in abortion and stillbirth. So we add 10%. So what is our live birth? 100. And 10% of 100 is 10. So how many pregnancy in a year? 110 pregnancy should be there at the sub-center in a year. So live birth should be 100, 20 into 5, and pregnancy in a year should be 110. But does pregnancy remain for 1 year in register? देखो सीधी सी बात है, पहले ट्राइमेस्टर में 12 वीक पर फर्स्ट एएनसी विजिट उससे पहले होना चाहिए. तो 3 महीने तक रिपोर्टिंग नहीं हुई, 4 महीने से रिपोर्टिंग हुई, 9 महीने तक नाम रजिस्टर में रहा, यानी रजिस्टर में नाम सिर्फ 6 महीने तक रहा. तो 1 साल में होते हैं 12 महीने और 6 महीने नाम रजिस्टर में रहा है, यानी जो भी साल भर की प्रेगनेंसी है उसकी आधी प्रेगनेंसी हमेशा रजिस्टर में होनी चाहिए, क्योंकि साल भर में 12 महीने होते हैं और प्रेगनेंसी है केवल 6 महीने के लिए. तो यानी जो साल भर की प्रेगनेंसी है 110, उसकी आधी 55 प्रेगनेंसी कम से कम रजिस्टर में होनी चाहिए. What I was saying in Hindi is that if you are finding pregnancy should present at any time in the register, so at any time there should be half of yearly pregnancy which is present. Now half, why it is yearly pregnancy by 2? Why it is half of pregnancy? Because in a year there are 12 months and pregnancy remain only for 6 months in the register. Why pregnancy remain only for 6 months in the register? Because in the first 3 months the reporting is usually not there. So from 4th month till 9th month there are 6 months. So for 6 months pregnancy name will be in the register, and in a year there are 12 months. So if we want to get what remain in register for 6 months at any time, then we have to divide yearly pregnancy by 2. So this is the 3 step by which you have to do this numerical. And if they ask pregnancy at any time, answer will be 55. Now, one more question came from this topic is, this time they gave the birth rate is 25 per thousand. So if birth rate is given 25 per thousand, they are asking find the number of pregnancy in a year. So if you are looking this video in recorded form, please pause it and calculate it yourself. What are the pregnancy in a year which should be there? First thing is, birth rate is 25. So how much is live birth in a year? This example will make it clear. Live birth in a year is birth rate multiplied by 5. Simple. Why 5? Because subcenter has 5,000 people and birth rate we calculate per thousand. So our birth rate is 25. 25 into 5, 125. 125 is live birth in a year, and they are not asking live birth in a year. They are asking pregnancy in a year. So what is pregnancy in a year? As I said, pregnancy in a year is live birth plus 10% of live birth. This 10% of live birth is pregnancy wastage factor. Now in our story, live birth is 125. And what is 10% of 125? 12.5. Now, can you have any child with 0.5 delivery? No, no. So it will roughly become 138. And this is the pregnancy in a year. Pregnancy in a year is 138. But sometimes some students who are 69 lovers, they say the answer can be 69. They are not wrong. They just went one step ahead. If they ask pregnancy at any time, then answer will be 69 because it will be half of yearly pregnancy. But here they are not asking pregnancy at any time. They are just asking pregnancy in a year. So it will be 138. Okay. Now, next question is, in need 2024, they have asked, which is not done in newborn care. Of course, bath with warm water, you do it in less than 1 week. Around 1 week, we do it. Imagine a child is just born and you are giving him bath. He will abuse you very badly. Hai na? So, of course not. Which is not a target of NSSK? This is very interesting question. See, NSSK is Navjat Shishu Suraksha Karyakram. So, when you talk about NSSK, basically you are thinking of protecting neonate. Navjat means neonate. Neonate means who are less than 28 days of birth. So, in Navjat Shishu Suraksha Karyakram, there are 4 targets which can be remembered like a story. जैसे बच्चा पैदा होता है, हम पहले तो उसकी नाड़ काटते हैं, clean cut. We use 5C, and as soon as the delivery occur, we first cut the umbilical cord with 5C. What is 5C? Clean hand, clean surface, clean cut, clean cord, clean stump. Okay, and with this 5C, we try to prevent infection. This is the first thing. So first thing which we do after childbirth is prevention of infection. After this, we put him in the warmer and rub him. So after prevention of infection, we prevent hypothermia. And if the child is crying by now, after rubbing him, if the child started crying, then we will just ask the mother to do exclusive breastfeeding. Do not give anything other than colostrum in the beginning, and for 6 months only mother milk. But if suppose baby do not cry, then what we do? Then we do neonatal resuscitation, and we try to save the baby by doing our efforts. So this is the 4 target. You can remember it like a story. What are the 4 target of NSSK? Prevention of infection, prevention of hypothermia, breastfeeding, and if not crying, then neonatal resuscitation. These are the 4 targets. So now, which is not a target of NSSK out of this? Early exclusive breastfeeding, yes, it is a target. Hypothermia, resuscitation, yes, it is a target. But free investigation of newborn is not done. Actually, free investigation for newborn and mother during pregnancy until 42 days after delivery, this is provided every day of the month under JSSK. JSSK is Janani Shishu Suraksha Karyakram. Janani means mother, Shishu means newborn. So for mother and newborn both, we have free investigation under JSSK, and JSSK also gives 2 things free. It gives free ambulance and free food, and it also gives all kind of treatment free under JSSK. So this is under JSSK, rest 3 target are NSSK. This is also a PYQ of MCA exam, do remember. Now, in NEET, they have asked this question, which is not a target of baby-friendly hospital initiative. So baby-friendly hospital initiative do not focus on prevention of infection. Now you will say, sir, why? Because this is WHO guideline for breastfeeding. And WHO guideline is mainly based off US, UK doctors' recommendation. And in US, UK, of course, infection is not a big problem. Second thing, WHO think that if the child is breastfeeding, breastfeeding will save the child from infection. Okay, so prevention of infection is not a target. In developed country, if the mother is discharging early from hospital, we consider it as a good sign. So early discharge, prevention of hypothermia, breastfeeding on demand, these all are target, but not the first one. Then, which is not present in urban area, we see there is urban ASA at 1,000 to 2.5 thousand, urban PHC 50,000, urban CHC 2.5 lakh, but there was no sub center. Okay, so sub center is missing. That's why there is Amma clinic in Tamil Nadu and Mohalla clinic in Delhi, which was opened for sub center, which is not there. Now, which is not correct for urban CHC? Of course, urban CHC is at 2.5 to 5 lakh, and 5 urban PHC do come under one urban CHC, and it is 30 bed in city, 100 bed in metropolitan. But we cannot open urban CHC near district hospital. This is not correct. Actually, urban CHC near district hospital can be open, and sometimes they can be open even in the same campus. Government say that less serious patient will go to urban CHC, more serious patient will go to district hospital. So they can be open in the same campus. Urban CHC cannot be present. This is a wrong statement, not correct. Not present, not correct. That means they can be present. Urban CHC can be open near medical college. Chalo, now after doing the health system, let's read the health programs which they asked from here. So first is SUMAN. SUMAN stands for Safe Motherhood Aswasan. That means Safe Motherhood Assurance. Okay. So in SUMAN, the target is we should not say no to mother in government hospital. They say zero denial to mother in government hospital is the target of SUMAN. They forget to write if available, है ना? So SUMAN एक umbrella program है और इसकी छतरी के नीचे 5 program आते हैं, है ना? So what are the 5 program which come under it? We will read one by one. First is JSY, Janani Suraksha Yojana. Now in the Janani Suraksha Yojana, previously there was only one work, that money was given after institutional delivery, and this money is given to mother also, and it is given to ASA or USHA also. Money after hospital delivery was the only main work of JSY initially, because it is mother safety program, so was giving money after delivery. But now there are 5 other work also. Okay, there are 5 more work which come under JSY, under the recent JSY. First thing under the recent JSY is, of course, there is Village Nutrition Day. Okay, this Village Nutrition Day has been asked. It is celebrated twice in a month or once in a month, like that. So Village Nutrition Day is celebrated once a month, and this is known as Mamta Divas in some area. And it is Mamta Divas, but still it is more celebrated in Gujarat village area. And so Modi is celebrating Mamta Divas. There is some affair going between them. Meloni is just a decoy, not the real thing. Okay. So Village Nutrition Day is once a month. This is one thing under Mamta Divas. Second thing under JSY is there is detection of high risk cases and reporting of high risk cases referral also. So screening for high risk cases and reporting, screening and reporting of high risk cases during ANC visit. Okay, so how this reporting of high risk cases occur? This reporting of high risk cases is done under a software which come by the name of Anmol. तो अनमोल का एक लोगो वाला क्वेश्चन भी आ चुका है, हरी माँ हरा बच्चा. There will be green mother, green child under Anmol. And what is Anmol? ANM online. So this Anmol is a tablet based software, and on this tablet based software ANM make data entry. Okay, it's tablet based software for ANM data entry. So when this tablet was released, all the ANM all over India, they have the same question कि हुजूर माई बाप दीनानाथ बहुत दयालु हैं कि आपने सॉफ्टवेयर दिया, लेकिन डाले कहाँ, हार्डवेयर बा तो देवे नहीं किए, है ना. All over India the ANM said कि government you are so kind, you gave the software, but where to put it? You have not given the tablet, not given the hardware. So the government said it will come, wait, है ना. So this is Anmol, which has the tablet based software for ANM data entry, okay, and Village Nutrition Day is second thing under it. Now the third thing is we call it by the name of Vande Mataram scheme. Have you heard of it? Vande Mataram scheme means private doctors, if they put a logo over their PHC that we are under Vande Mataram scheme, they can distribute all the things which ASA distribute, like condom, OCP, iron calcium tablet, malaria drugs and all. Even private ops gynae doctor can distribute if they have this Vande Mataram logo over their OPD. Private ops and gynae distribute ASA material, है ना? Whatever is the ASA have the things, they can also distribute for free if they have this Vande Mataram scheme. This is the third part. The fourth thing under it is safe abortion services. Okay. The fifth thing under it is maternal death review. Okay. So now, how will you remember this sixth thing under JSY, and in exam pressure, how will you recall it? So to remember this sixth thing, you can create a story like this, that there was a dark night, एक अंधेरी रात थी, बारिश हो रही थी, and there was a guy by the name of Deepak. He came to me and I was carrying a candle in my hand. He blew that candle and then he did something with me and I became pregnant. Okay. So after pregnancy, first thing is my nutrition, which is taken care by Village Nutrition Day once a month. Second thing you need to do is screen me for some hypertension or something. And if I found high risk, you will report under Anmol. Third thing which he did, he was a very caring person, but he don't wanted to inform the villager. So he took me to a private ops-gynae person and he get me iron calcium tablet under Vande Mataram. But one night I found he is blowing other people candle also. I got hurted and I went for safe abortion services, in which if I die, then my maternal death review will also occur under JSY. And if I survive and delivered, then I will get the money under JSY. Okay. So these are the 6 things under JSY. I hope you will remember it with this story. Now, what are the money which we give under JSY? How much money we give? So the money we give depend whether the mother is coming from low performing state or mother is coming from high performing state. So you have to know what are low performing state. Low performing states are, of course, the first name is United States of Bihar, from where I also come. So Bihar is leading India in terms of infant and maternal death. United States we are. And after Bihar, we have our brother Jharkhand. Then we have our neighbor UP and MP and their brother of UP, Uttarakhand, brother of MP, my favorite state, Chhattisgarh. So this 6 can easily be remembered, Bihar, UP, MP and their brother. And the 4 can be remembered by the mnemonic Roja. Roja jane man, tu hi mera dil. R for Rajasthan, O for Odisha, J for Jammu and Kashmir, and A for Assam. So these 10 states are low performing, and of course low performing should get more money. So they get 1400 in rural areas, and in urban areas they get only 1000 rupees. Mother, focus on mother, 1400, 1000. Then in high performing they get half of 1400, 700, and half of 1000 should be 500, but mother never get less than ASA, so is 600. So remember this 4 number only, 1400 and 1000 for this 10 states, low performing states, and 700, 600 for remaining high performing states. Now, एक बात याद रखना, क्योंकि आशा गांव में है तो हमेशा उसको ज्यादा मिलेगा 600, और उषा शहर में है तो उसको ट्रांसपोर्ट वगैरह में दिक्कत कम है 400. USA have less transport problems, so less money 400. ASA is in rural area, so more money 600. And ASA USA money is same. Whether they are from low performing states or high performing states, it doesn't matter. Same 600, 400. So from this topic, one question came in NEET exam that a mother delivered in urban MP. Let's say she delivered in Indore city, very beautiful city. So because she delivered in urban MP, how much money will you give to ASA USA first? Urban USA. USA means 400. And how much money you will give to mother? So MP is low performing and urban MP means 1000 and 400. This is again a table directly from Park textbook, so don't doubt this table. I have the evidence. And do remember, if she asked urban MP in the exam, answer will be 1000 and 400. If they ask rural MP, answer will be 1400 and 600. Of course, I hope you will understand. So by this you can answer. Do revise this table and remember it. It's very easy. Now, कुछ comment थे ना उसमें दिखाओ दो. Are you saying something? चलो. Next, if this 600 rupees ASA get, she get 300 for transportation and 300 rupees for assisting the mother to come to hospital, accompanying the mother. Okay. Similarly, 400, then it is 200, 200 divided. And in high performing, she get it only till 2 delivery, this incentive. So this is the money under JSY. Now the second program I told you now is JSSY. So what do you mean by S? S means Shishu. Shishu means child who keep on doing Shishu. That is Shishu. So because the color of Shishu or urine is yellow, so you will see the logo of JSSY is also yellow. Yellow logo because of the Shishu doing Shishu. And it is caring for child and mother both. Under JSSY, we have 3 benefit in government hospital, which I just revised. What are the 3 benefit? We have free investigation, treatment, everything which is can be given, it is free. Investigation, treatment, C-section, blood, everything which is needed in government hospital is free. Plus it is also, which is also free, ambulance is also free. So this ambulance and investigation, these are free for pregnant female. This is free for those mother who have delivered in 42 days. Mother within 42 days of delivery. And this is also free for less than 1 year children, that means infant. If you go to any hospital all over India, you will find ambulance and all the treatment for mother and child free. This is under the real program JSSY, Janani, Shishu, Suraksha Yojana. Third thing which is free is, of course, free food. Free food for mother and child will not eat anything right now. So free food is for mother and 1 attendant. And this food which we give, this is given for 3 days. If it is normal delivery, we give the food for 3 days. And if it is C-section, we give the food for 7 days. So C-section 7 days, normal delivery 3-day food. So this is JSSY. Now, the third program is प्रधानमंत्री सुरक्षित मातृत्व अभियान. और ऐसा प्रोग्राम दुनिया में ना कभी देखा गया, ना कभी देखा जाएगा. इस प्रोग्राम में सरकार ने क्या कहा कि हर महीने के 9वें दिन को सभी एएनसी चेकअप, इन्वेस्टिगेशन और मेडिसिन फ्री है. PMSMA stand for Prime Minister's Safe Motherhood Mission, सुरक्षित मातृत्व अभियान mission. And this is the most magical program because the government gave on 9th free ANC checkup, medicines and all in government hospital. And suppose my Deepak is busy in blowing some other candle on 9th, and he was busy on 9th, he did not took me on 9th. Then he can take me on 10th, 11th any day. अभी तो हमने पढ़ा कि JSSY में महीने के हर दिन सारी जांच और सुविधाएं महिला के लिए, प्रेग्नेंट फीमेल के लिए मुफ्त है. तो 9 तारीख को वही चीज सरकार ने मुफ्त दिया जो पहले से ही मुफ्त था हर महीने के हर दिन में. On 9th, government is giving free NC checkup investigation, which is already free under JSSY on any day of the month. So what the government gave on 9th? Baba ji ka tullu. They actually gave nothing. They gave something free, which is free on every day of the month. That's why it is the most magical program, PMSMA. Second thing under PMSMA they said is that private ops gynae doctor, they can give voluntary ANC checkup on 9th in government hospital. and they do actually come with their many visiting card, 100, 200. And to all the poor patients who are in the government hospital, they give their visiting card and ask them to come to their private clinic. So this is the second part of PMSMA. The third part is they classified pregnancy: red for high risk, blue for pregnancy with preeclampsia, yellow for pregnancy with comorbidity like hypothyroidism, TB, diabetes, and green for normal delivery. So remember, which color is for preeclampsia? Blue. Which color is for hypothyroidism? Hypothyroidism, it's yellow. So this classification of pregnancy, and on 9th free ANC checkup and investigation is under PMSMA. The fourth program is Laksh. Laksh in Hindi means goal. And remember this point, goal is not constrained by time. 4 time asked question. Objective, target, they all are limited by time, but goal not constrained by time. And under Laksh, what we focus? We focus that we should improve the facility of labor room, maternity ward, and maternity OT. Improvement of labor room, maternity ward, and maternity OT. Okay, so this is the target, ward and OT. Because it all come under Suman, Surakshit Matritva Assurance, and safe motherhood assurance. So we are focusing on motherhood quality improvement by Laksh. Laksh will work in hospital improvement. And Dakshata is a Hindi word which means highly skilled. Highly skilled. So what the government is doing in Dakshata? They are doing something which has never been done. They will give training. Training to doctor and nurses for decreasing the delivery related complication which occur to mother and also to infant, neonate. So what are the 5 things under Suman? Very simple to remember. JSY for mother, 6 benefit. JSSY for mother and child, 3 free thing. Then PMSMA, भाई और बहनों किस दिन ले जाओगे माओ को अस्पताल? Which day you will take the mother to hospital? On 9th of every month, PMSMA. Then there is Laksh for maternity OT and labor room improvement, and Dakshata for training. So these are the 5 things which come under Suman. Now, let's do this question. Suppose there is a poor female like me, and she is pregnant and I don't have money to go to hospital for delivery. So now which program will help me? JSY, JSSY, PMSMA, Laksh. Of course, Laksh will not help. In JSY, money come after delivery. And here the mother do not have money to go to hospital for delivery. So which program will help her? JSSY, because only JSSY is giving ambulance also along with free food and free delivery. So which will help this mother? JSSY. Now, this is Vande Mataram program which I said ki private ops gynae doctor can keep all the IFA and STD kit and Nischay kit and they can treat pregnant female. So now they are talking about this 2 word here which we should focus. One is Nischay kit. What is Nischay? Nischay is a Hindi word which means to be sure of, pakka karna. So Nischay kit is UPT kit by ASA. I think we will discuss it later on also. UPT kit by ASA is Nischay. And there is one program, Nikchay. Nikchay. So, how will you remember these 2 things different? See, Nik means no. Chay ka matlab hota hai loss of body. And in which disease there is loss of body, patient become malnourished, TB. So, Nikchay means no TB. And Nischay is UPT kit. So, what we do in Nikchay is, in Nikchay, there is an app-based reporting, WhatsApp-based reporting also by both private and government doctor. They both report TB cases. And they report TB cases by web-enabled system. Okay, so they can easily report TB cases now under Nikchay. Now, how to remember these 2? See, one of the student, in Philippines, he said to me that, sir, out of Nischay and Nikchay, in which S is coming first? If both are given in option, S is coming first here. S is coming very late here. And he said S stand for sex. And if sex occur without condom, it might need UPT kit by ASA. So I said, bro, you are thinking so much. Do you have problem in Hindi? He said, no, sir, my Hindi is fine. But I was thinking about sex when you are telling this topic, and so I thought this mnemonic. I said, very good. So remember, Nishchay, UPT kit, as compass sex and UPT kit, Nikchay for reporting of TB cases. But one more program is Nikchay Poshan. Nikchay means TB. And to decrease the TB, we have to give some money so that they can do some supplementary nutrition. Previously, this money was 500 per month. Now this money is 1000 rupees per month. So this 1000 rupees per month for TB patient food is given under Nikchay Poshan. Remember, it's 1000 rupees per month. So in Vande Mataram, we have this Nishchay kit. So Nishchay, Nikchay Poshan, I hope you will remember. Now there is also one discussion of STD kit. This is one question which is come in the dermatology also, and in gynae also, and in PSM also, STD kit. This sexually transmitted disease kit is distributed by which organization? So they have once given this logo based question, which organization logo is this? And all the students, they answer Red Cross. No, Red Cross will be something like this. This will be Red Cross. And this is the logo of Suraksha Clinic. And what does Suraksha Clinic distribute? Suraksha Clinic distribute STD kit. So this is Suraksha Clinic logo. And they have asked Suraksha Clinic and Mobile Medical Unit. They are example of public-private partnership. So who give medicine to Suraksha Clinic? So remember, Suraksha Clinic or Mobile Medical Unit also, medicine always only from government, because government can procure medicine at 3%, 5% cost. So medicine always come from only government. Building and ambulance can be government or private both. Now in the STD kit, they have added a new thing, kit 8. What is kit 8? Kit 8 is brown. Brown is for anorectal discharge. Okay, पिछवाड़े के लिए anorectal discharge. अब देखो, if you look at all the classifications of triage also, reverse triage also, these are prepared by US, UK people, and they are a bit racist from inside. So they always keep black as the last category. That's why black was the 7 kit. But now, and black is for inguinal bubo, inguinal lymph node swelling. But now, rather than black people, they are more scared from us brown people. So now they have put brown as much lower than black. So black and brown, BB, are below. And if you see, first one is gray, second one is green. So GG is in the beginning, and black, and they are more scared of brown, so brown is at the last part. Now how will you remember gray, green separately? See, my ma'am, very favorite ma'am, Bari Dalni ma'am in AIMS New Delhi, when we were doing PG, she was a professor there, and she used to say that nothing in the world is black or white. Everything is gray. So if someone has done something wrong with you, your ex-girlfriend, ex-boyfriend, your parent, your teacher, then forgive them, because they are also human, they are also gray. And if you have done something wrong with anyone, forgive yourself also, because you are also gray, you can do some mistake. So if you will forgive everyone, your preparation energy will increase, you will be more happy. So everything is in gray. Similarly, BJP government, Congress government, all are gray. So don't get emotional on all these things and focus on study. So gray is the first kit, because gray is the most common color of the people also, like that you can remember. And gray is for cervical discharge and urethral discharge. So cervical and urethral discharge have this gray. And they, of course, I hope you know, this green is for vaginal discharge. So in NEET 2023, they asked this question, that a female come with cervical erosion and vaginal discharge. So if there is cervical erosion and vaginal discharge, in which category she will go? So if there is cervical erosion and vaginal discharge both, cervical, will it go in gray or green? What do you think? What is your answer? Please give in the comment box. What is your answer? Gray or green? What is the answer? See, cervical erosion indicates cervicitis. And cervicitis is inflammation of cervix, so it will go under gray. This will go under gray, because even if the infection is in cervix, of course the fluid will come out through vagina only, na? So mainly it is cervical infection, so you will give gray kit. Okay, and then there is green for vaginal. After this, the middle three can be remembered by WBR, white, blue, red. Now, why you should just like WBC, WBR. This white is also given for bacterial ulcer, genital ulcer, and blue is also given for bacterial genital ulcer. But why there are different for same bacterial ulcer? Why they are different? Because some patient we can treat with penicillin, some patient are anaphylactic with penicillin. So if you can treat with penicillin, it is white. If you cannot treat with penicillin, you use doxycycline, it will become blue. So white, blue both for bacterial genital ulcer. But last, red. Red is for herpetic genital ulcer, and here we treat with acyclovir 800 mg 3 times a day for 5 days. Okay, so WBR is for genital ulcer. Now a very common question is female come with lower backache. So if anyone is coming with lower backache, it means it is pelvic inflammatory disease. And if it is pelvic inflammatory disease, then we give kit 6. Most commonly given kit is kit 6. Kit 6 is yellow. It is not only for PID, but yellow is also for low abdominal pain. Low abdominal pain also, low back pain also. Low back and abdominal pain. Because if there is pain in lower back and abdominal, it means infection had go to pouch of Douglas, the most retroperitoneal structure. That's why it is causing pain in lower back and lower abdomen. And therefore, the treatment which we give for yellow color discharge is metronidazole, doxycycline. Both we give twice a day for 14-day long treatment. If you treat for 5 days, it will always be incomplete treatment. So this is the 7 kit, STD kit. Do not forget, very easy. Remember, brown new category is for anorectal discharge. Chalo, now let's read about one more program, recent program, Pradhan Mantri Matru means mother, Matru Vandana worship program. See the feeling of government. Government is doing worship of mother. Worship. How they do worship of mother? Full emotional. They give 2,000 rupees at first registration, 12 week of pregnancy. First tell me, have you seen money being delivered before delivery in any state of India? No, in none of the state money is delivered before delivery. In Telangana and Jharkhand, they have given money to mothers, but it was before election, not before delivery. Hai na? So before delivery, 2,000 rupees at 12 week, 2,000 rupees at 6 months, 4,000 rupees below before delivery. And last 2,000 rupees is given at 6 week vaccination after delivery. Total how much money? 6,000 rupees. So whenever I teach this topic, a student asks, sir, where this money is given before delivery? Nowhere we have seen it getting before delivery. I said, bro, tell me one thing. For worship, for Vandana, do you need money or do you need feeling? They all say, yes, sir, we need feeling. So that's why government is giving full feeling, no money. That's why this program is having a logo also in which mother and child both are incomplete, half mother, half child, because the program itself is also incomplete. So we will see all this mother-child logo also, and we will revise all this program which we just discussed, and you will see there is an incomplete mother-child when it comes to Pradhan Mantri Matru Vandana Yojana. Let me show you the logo directly. Yes, this is the logo of Pradhan Mantri Matru Vandana Yojana, mother worship, in which previously government was giving 5,000. But then government thought, if anyway फेंक ही रहे हैं तो बड़ा फेंकते हैं, we are throwing, so let's throw 1,000 rupees more. Now it is 6,000. Matru Vandana, see, half mother, half child. Then in the program where you see yellow mother, yellow child, this has been asked in NEET 2024. This is JSSY or JSSK, same thing. Because Y is Yojana, K is Karyakram, Yojana, Karyakram are same thing. So JSSY, JSSK 3, in which 3 benefits are given: ambulance, food and all free things in the hospital for mother and child. This is JSSK yellow color. Half mother, half child, PM Matru Vandana Yojana. Because there are total 7 logo with mother and child. So if we revise this, our whole this revision of program will be done. Okay, so focus here. Matru Vandana, half mother, half child. Yellow color mother child, JSSY. Black mother, black child, Laksh. Remember, improvement of facility in labor room, maternity ward and delivery room, and maternity OT. Chalo, Laksh. Then this white color mother, white color child, As soon as you see white color, you will think foreigner. So this is foreigner program, WHO. Okay, WHO program, which is this baby friendly hospital initiative. Remember, baby friendly hospital initiative, do not focus on prevention of infection, and that is BFHI. Then if there is blue color mother, blue color child, it's not blue film, it's UNICEF program, which focus on mother and child. And UNICEF was the organization which fund seed and manure of applied nutrition program also. UNICEF gave fund for seed and manure of applied nutrition program. This question has been asked in NEET exam. I am expecting it to repeat in your exam. Seed and manure of applied nutrition program. So UNICEF thought that if we can give seed and fertilizer to government school, they can have the green vegetable in their midday meal in Anganwadi. But do fruit vegetable will survive in school? बच्चे भतिया ही तोड़ के खा लेंगे. And even if it will survive, who will eat? Student or teacher? Of course, teacher. So this program never worked. But do remember who funds seed and manure of applied nutrition program? UNICEF. And UNICEF work for mother and child. Now दिखाओ तो. Any comment? बहुत सारे. Okay, so it got closed, bro. Close हो गया. So blue color mother, blue color child is UNICEF. Then we are, I think, green color mother, green color child. Remember Anmol. What is Anmol? A&M online, tablet based software for A&M. And we have discussed it. So a lot of you are here and you are smiling and enjoying. So thank you so much, dear friend. And let's enjoy the study, because whatever we do with enjoyment, we remember it longer. And we have to finish also PSM. So I hope you will enjoy and remember everything which we discussed. So this is tablet based software for data entry, by A&M. This is different thing. Now this red color mother, red color child, this is Anganwadi. ऐसा नहीं लग रहा है कि होलिका प्रहलाद को जलाने ले जा रही है. It's look like some mother is burning the kid, but this is Anganwadi. And Anganwadi come under ICDS. What is ICDS? Integrated Child Development Scheme. So this Anganwadi and ICDS, these are funded by Care Foundation. Care Foundation give fund to these two. How will you remember it? देखो सबसे ज़्यादा केयर की जरूरत किसको है? Who need the most care? Small children. So Care is funding their nutrition of small children, Anganwadi and ICDS program. Okay, चलो. So I hope all माँ बहन हो चुका है. Mother child has been discussed. Let's revise it. Red color mother, red color child, Anganwadi. Let me show you the logo. Red color mother child, Anganwadi. Then blue color mother child, UNICEF. But green color mother child, Anmol. Blue color mother child, आएगा. Blue color mother child, UNICEF. Then black color mother child, black is Laksh. White is BFHI. So white is BFHI, black is Laksh. Then yellow is JSSY. And incomplete mother child is Pradhan Mantri Matru Vandana Yojana. So incomplete is done. Yellow JSSY, green Anmol, black Laksh, white BFHI, red ICDS and Anganwadi, है ना? और कोई बच गया? Yellow, green, blue, white, red. हाँ, blue रह गया. Blue UNICEF. Because here it was B for black and black was for Laksh. So total 1, 2, 3, 4, 5, 6, and this 7 program has mother and child. I hope we revised it and you will remember it. Now, let's go to our, after mother child, we should definitely discuss Anemia Mukt Bharat program. For last 4 years, in no matter which exam you will give, there are questions from Anemia Mukt Bharat. And Anemia Mukt Bharat come under Poshan. So we have to discuss this program, Poshan. And Poshan have full form: P for Prime Minister, O for overarching, S for scheme, H for holistic, N for nutrition. So it's actually Poshan. There is no A here. They put A just for rhyming, because if you remove A, it will become Poshan. So it's a scheme for nutrition. And under Poshan, there are 5 programs come. Very easy to remember. 2 program has Poshan written behind it. Nikshay Poshan and PM Poshan. and 3 program are with A, Anganwadi, Adolescent, Anemia Mukt Bharat. So Anganwadi we have discussed. In adolescent program in India is known as RKSK, Rashtriya K for Kishore Swasthya Karyakram. And if they gave you the logo of adolescent program, Kishore Swasthya Karyakram, they will give kite in the logo. Government think कि adolescent ही पेंचे लड़ाते हैं ना, adolescent age when you were in between 10 to 19 years, that is adolescent. That is the time when you play kite, है ना, tangle your thread with other people like that, है ना. So they say RKSK will have kite, and Anemia Mukt Bharat will have a red blood cell in it as a logo. So let's discuss this program. But before that, in the Poshan Abhiyan, there are 3 targets. Low birth weight children should be less than 2%. Stunting 2%. Underweight or undernourished, that also should be 2%. How will you remember it? To remember it, you can use the mnemonic LUSTY. This was a student in Mumbai, he suggested me. LUSTY, he said. LUSTY means target is low birth weight, U for underweight or undernourished, and S for stunting. All 3 should reduce by 2%. So which type of portion you want? You want a portion which make you lusty, है ना? Low birth weight, underweight, stunting, all should reduce by 2%. It should reduce your lust. अरे वाह, very philosophical angle, है ना? The foods should make us less lusty, 2% less lusty. Low birth weight, underweight, stunting. Now, there is also one question on this thing, that which target is not included in Global Hunger Index. So in Global Hunger Index also, there are 3 targets, which can be remembered by the mnemonic fuck US. You can also forgive US if you are in philosophical angle, but fuck will stuck more in your mind. Fuck US means, F means under 5 mortality rate. And US is the same US as we have in Lusty. Remember, in Lusty, US means underweight and stunting. Here also underweight, stunting. Undernourished, stunting. And L was for low birth weight. Remember? So low birth weight, low birth weight, underweight, stunting was in Poshan Abhiyan. And here it is under 5 mortality, undernourished and stunting. So these 3, undernourished, stunting and under 5, are the target of Global Hunger Index. Under 5 for fuck, undernourished for U, and S for stunting. So it is FUS, LUS. LUS is in Poshan Abhiyan, Lusty 2% reduction, and fuck US is in Global Hunger Index. So Global Hunger Index do not focus on IMR. Infant death is not a target of Global Hunger Index. Infant mortality is not a target of Sustainable Development Goal. Okay, it is not in SDG also. But what is the target of IMR which we want to achieve in India? So they will never ask, people will come and tell you update, recent IMR, recent MMR. In last 20 years, they have never asked the recent IMR and recent MMR. They never ask the recent. They only ask what is the target one time. So the target of IMR in India is we need less than 30 per 1000 infant death. And the target of maternal death in India is less than 70 per lakh. And this is the same target of maternal mortality ratio, which is also in Sustainable Development Goal. So Sustainable Development Goal and India both have the same target. MMR should be less than 70, IMR should be less than 30. And what is the target of total fertility rate for India? Total fertility rate means total live birth per female. तो क्या लगता है, एक मां को भारत में कितने बच्चे पैदा करने चाहिए? क्या टोटल लाइव बर्थ पर फीमेल होना चाहिए 1, 2, 1, 2, 2.1 और 3? What do you think is the target TFR? Target TFR is 2.1. यानी हर एक मां को भारत में 2 और 0.1 बच्चे पैदा करने चाहिए. अब बोलोगे ये 0.1 कैसे आया? You will say कि how sir 2.1? Because TFR is never, we calculate it for one female, but we always calculate it for a population. So I have produced 2 children. Let's say suppose Nikhil produced 3 children, and you produced 1 children, someone produced 5 children. So when you take the average should come 2.1. Why 2.1? Because out of 2.1, some children will die. And finally, it will come to 2 child per couple. So if we want 2 child per couple, TFR target is 2.1. And according to the latest National Family Health Survey data of 6, which came, what is India TFR? What is India TFR? India TFR has become 1.9. So we are producing less children than what is needed to replace us. So you can produce as many children you want. So these 3 target they have asked, and they have not asked. So do remember the target. Okay. One more thing I want to make clear here is, when they talk about maternal mortality ratio and rate, NEET exam and FMG exam both have asked questions from this definition, ratio and rate. So देखो, rate means numerator is a part of denominator. We write maternal death above in both rate and ratio. Numerator is same maternal death, and we only call those maternal death as mother. मां को तभी मरा हुआ कहते हैं जब वो डिलीवरी रिलेटेड कारणों से मरे, डिलीवरी के 42 दिन के अंदर. इफ मदर डाइड विद इन 42 days and she died due to delivery related reason, due to pregnancy related reason. So if she died due to delivery related reason and she died within 42 days of delivery, then we call such death as maternal death. So if a mother died due to accident, due to drowning, electric shock, these are not maternal death. Okay. So we write maternal death in both of them numerator. Rate ratio both multiplied by 1 lakh, 10 to the power 5, 10 to the power 5. Only difference is, in ratio, we write in the denominator live birth. And in rate, we write in the denominator female between 15 to 49 years. Okay. So I hope you will remember this definition separately. देखो, ratio, just like sex ratio. When we write sex ratio, we write female by male into 1000. And ratio means numerator is not a part of denominator. एक बात बताओ, क्या माँ बच्चे से आई है? नहीं ना, बच्चा माँ से आ सकता है. माँ और बच्चे अलग अलग है. वैसे ही जैसे फीमेल और मेल सेक्स रेशियो में अलग अलग है, तो जब दोनों अलग अलग होते हैं तो रेशियो यूज करते हैं. और जब ऊपर वाला हिस्सा नीचे में से ही पैदा हुआ होता है, न्यूमरेटर डिनोमिनेटर से ही आता है, तब उसको रेट कहते हैं. जैसे कुछ माएं जो मर रही हैं वो वही माँ हैं जो फीमेल में से कुछ माँ बनी होंगी, मरी होंगी. तो इसीलिए फीमेल में से माँ आई है तो रेट है, और दोनों अलग अलग है तो रेशियो है. What I'm saying is, if they are different, like here sex ratio female and male are different, mother and live birth are different, we use ratio. But if numerator is coming from denominator, we use rate. For example, mother who are dying are coming from the female population, so it is a rate, because numerator is a part of denominator, we call it rate there. Okay, so I hope rate ratio you will remember separately. The target for ratio is less than 70 per lakh. This target is for sustainable development goal also, for India also. Always remember this difference. Okay, chalo. Now, so let's go back and discuss the Poshan Abhiyan in bit detail. First thing is, under Poshan, the most important program is Anemia Mukt Bharat, and the target for Poshan was to reduce low birth weight, undernourished and stunting all by 2%. But this question has came already in MCI exam, that what is the target of Anemia Mukt Bharat? Target is to reduce anemia each year by 3%. So for Poshan, it is 2%. For Anemia Mukt Bharat, 3%. This is the difference. And Anemia Mukt Bharat follows 6 into 6 into 6 strategy. कुल मिला के बहुत ही छक्का प्रोग्राम है. It's a very sixer type of program, and it followed 6 into 6 into 6 strategy. Now, what is this 6 into 6 into 6? First 6 are 6 people who will get benefit. Second 6 are 6 intervention, 6 method by which we will help them. And last 6 is 6 institutional mechanism. So this question has already been asked, that which is not under 6 into 6 into 6. So remember it, you can remember it as BII, beneficiary, people who will be benefited. इंटरवेंशन, इंस्टीट्यूशनल मैकेनिज्म, लाभार्थी जिस तरह से फायदा मिलेगा और जिस तरीके से हम सिस्टम बनाएंगे वो तीनों है इसमें, BII. So main thing is they ask again and again from iron folic acid. And if it is 6 months to 5-year children, we give daily 220 milligram iron plus 100 microgram folic acid. And they are too small, very small children. So for them, whatever the dose we have, we divide them into half and half and we lower the dose and give it bi-weekly. हफ्ते में 2 बार इनको सिरप पिलाते हैं. Bi-weekly, we give 1 ml IFA syrup. In that 1 ml IFA syrup, we will have this 20 milligram iron, 100 microgram folic acid. तो देखो कितना आसान है याद करना. आप खुद ही देखो ना, 5 साल है, 5 year, 20 into 5, 100. And because they are small children, we give it bi-weekly. अब इसके बाद 3 हैं. First is pink color, pink children, 5 to 9-year children, pink color, pink children. Okay. And in them, 5 to 9, what is the difference between 5 to 9? 9 minus 5, 4. So we give 45 milligram iron and 400 microgram folic acid. Again, 4 and 4, 4 and 4, 45, 400. Simple. Then remember, when did you watch your first blue film in your life? When did you watch your first blue film? When you were between 10 to 19 years. So in 10 to 19 years, when we watch blue film first time, that is the time when you get blue tablet. In the blue tablet, what is the dose? Dose is 60 milligram iron plus 500 microgram folic acid. Even if you forget all the thing of the table, do not forget adolescent. They ask adolescent 3-4 times already. देखो कितना आसान है याद करना. इसके बाद सभी को सेम डोज मिलता है, 60 आयरन, 500 माइक्रोग्राम फॉलिक एसिड. तो बाकी सब के लिए सेम है. आपको बस 3 डोज याद रखने हैं. 20 100, 45 400, 60 500. Only 3 doses you have to remember. 20 100 bi-weekly, and then pink, blue, red. Red color tablet is for female, adult female who get hot red when they are angry. So this, like my wife, so this 3 is PBR, pink, blue, red. PBR can be remembered like PVR. You go to watch movie in PVR, na? So as we go in PVR, movie is released once a week or twice a week. Of course, movie in PVR is released once a week. So similarly, this 3 tablet, pink, blue, red, they all are given once a week. This 3 thing, PBR, just like PVR, is once a week. Okay, but of course, in pregnant female, lactating female, the color of the tablet remain red. But do we give them tablet once a week? Once a week, if you will give, they will throw it at your face. So in them, we give tablet daily. We give it daily for 180 days before delivery and 180 days after delivery also. Okay, so that's why it is pregnant, lactating female both. So can you remember this table? Answer is yes, it's very simple. 20, 100, 45, 400, 60, 500. The rest all get 60, 500. Now let's do some question from this topic also. We will talk about other benefits, but let's first read about everything with iron, with anemia, because gynae, PSM both ask question from anemia. First question, if a pregnant female has hemoglobin of 9 and she is at 20-week period of gestation, how you will treat her? So remember this cutoff 13, 12, 11. If HB is less than 13 in adult male, less than 12 in adult female, and less than 11 in pregnant female, then we call it anemia. This is according to WHO. But in pregnancy, again, if it is 9 to 11, we call it mild anemia. So this patient has come with mild anemia to you. Now, what is the treatment of mild anemia which you will give? They are asking. So usually when I ask question, what is your answer? How in Anemia Mukt Bharat, how you will treat it? Will you give 6500 once a day? Mostly student answer yes, once a day, because in Anemia Mukt Bharat, in pregnancy we give tablet once a day. But That once a day tablet we give only if female do not have any problem. Once a day we give if HB is more than 11 in pregnancy. If it is more than 11, we give once a week. But if it is between 9 to 11, we give the same iron tablet twice a day. Twice a day. Once a day if it is normal, but 2 tablets a day if she has mild anemia. Now, if her hemoglobin is between 7 to 9, we call it moderate anemia. And moderate anemia, how we treat moderate anemia, that I have asked in the next question. Okay. So let's go to the next. But before going to the next, who do we give once a week tablet, 60 and 500? Once a week we give in adult female. In adult female, in red tablet, once a week red tablet we give in adult female, and blue tablet in adolescent girl and adolescent boy also. Okay. Chalo. So 100 and 500 were old doses. And in gynae and PSM, anywhere if anemia asks, always you will write what is the treatment of anemia. The treatment of anemia is 60 milligram plus 500 microgram twice a day if hemoglobin is between 9 to 11. Okay, same dose you will write. Now, one more thing is, iron folic acid tablet is started after first trimester. Because in first trimester, I hope you all know, only folic acid is given. So when IFA started at 12 or 14 week, you can say. This question has also came. 12 or 14 week we can start IFA of pregnancy. Why 12 or 14? Because sometime they count ovulation phase sometime, because ovulation occur at 2 week duration in the period. So sometimes they write 12 or 14, but 12 week is the best answer. If one question asks, best is 12 weeks. So when do you start IFA? 12 week, not before that. Okay. Because before that we give only folic acid. Now let's come to the next case where hemoglobin is 8. And as I said, if the hemoglobin is between 7 to 9, you call it moderate anemia. So see, in this question they are asking treatment for moderate anemia. What is the treatment for moderate anemia? Treatment for moderate anemia is injection iron dextrose or injection ferric carboxymaltose. These two things we can give, but we give this thing if iron tablet is not working. In the first time when mother come early, let's say mother come at 20 week. So at 20 week, first we will give 2 tablets of IFA per day. But when we give 2 tablets of IFA per day, usually in 1 month, her hemoglobin should rise by 1. So if she is at 8 at 20 week and you give 2 tablets IFA, at 24 week, her hemoglobin should become 9. If it is not increasing like this, and it is late like 34, then you can directly give injection iron dextrose or ferric carboxymaltose. So moderate anemia we treat like this: ferric carboxymaltose and iron dextrose. But if it is severe anemia, we do blood transfusion. So blood transfusion is done when hemoglobin is less than 7. Then we do blood transfusion. Okay. So this is anemia management. So suppose you are the medical officer in charge of a PHC. Which thing you will distribute in your area? Only iron tablet or iron plus folic acid plus vitamin B12 plus vitamin C, everything? Answer is everything you will distribute. And try to give extra tablets also, because you are in government hospital. And how much money does Indian government give on health? This question has been asked already in MCI exam. WHO say that India should give 5% GDP on health. But this is the question asked. How much WHO say? 5%. But how much Indian government give on health? Indian government is giving 1.05% on health. And this is not about BJP or Congress. All the government since 1990 till 2026, this time, the health expenditure is same 1%. And out of that 1% of GDP, around 25% go back to government, saying that we are unable to use it. So use it. Okay, give as much medicine, give multivitamin also. Okay, you are in government, give everything. Chalo, now let's go back to discuss Anemia Mukt Bharat. One more thing. I told that there are 6 interventions. First is iron folic acid. So what are the remaining 5 interventions? Second intervention, not benefit is not good. You should use the word intervention. Okay. Second intervention is albendazole tablet. for prevention of worm infestation, not for treatment. Because when we give albendazole for treatment, we give it 1 tablet today, second tablet after 14 day. ओके तो मान लो आपके पास कोई माँ आई और आके बोली कि डॉक्टर साहब मेरा बेटा पैंट में हाथ डाल के छेदा खुजलाते रहता है पिछवाड़े का, है ना. He put hand in the pant and keep itching the asshole. Nikhil who is looking, is he putting hand outside or inside? I am putting it outside only, bro. Come on, I don't have worm in my ass, है ना. Although it look like, but it's not there. So when she come with symptom that yes, there is anal itching or there is worm in stool and feces, then you have to give treatment. And for the treatment, you give 1 tablet today and second tablet after 14 day. So we give it today and after 14 day for treatment. And here we are doing just prevention. Prevention we give it twice in a year. And if the age is less than 2 years, then we give only 200 milligram. 200 milligram means 5 ml or half bottle. And if age is more than 2 years, we give 400 milligram. 400 milligram is 10 ml or full bottle. तो माँ को बोलेंगे रात में full बाटली, है ना. In the night, give full bottle 10 ml for prevention twice in a year. When do we give it twice in a year? First, we give it on 10th of February. This 10th of February is National Deworming Day, and it has been already asked in MCI exam. So how will you remember 10 February, 10 August is the 2 day? How will you remember? 4 days before Valentine Day. What comes 4 days before Valentine Day? Hug day? No, it's teddy day. So what will you give to the boy or girl, your teddy, when you will meet 4 days before Valentine? 1 tablet of albendazole. And the boy or girl will ask you, hey, you are giving me tablet, what is your planning? What do you want me to do? You will say, this is to kill your worm. है ना, तेरे कीड़े मारने के लिए. So remember, on Teddy Day, 4 days before Valentine Day, National Deworming Day, and then 10th of August, we give it. Now, the third benefit is we do behavior change communication, BCC, and delayed cord clamping. BCC means the logo of Anemia Mukt Bharat is solid body, smart mind. So we will say to the child that if you want to beat all other children of your street, take iron tablet and he will take it. Because every child dream of hitting all other children of the street. And every mother dream that their child should come first in the class. So we will, if the mother is not eating iron, we can change her behavior by saying that if you take this tablet, your child will come first in the class. So solid body, smart mind is the logo because this can change the behavior. So behavior change communication is third benefit with delayed cord clamping. Fourth, fifth, sixth can be remembered by double FF. 2 बार FF कर दिया, है ना, double FF. What is D? D means digital hemoglobin measurement, and we also track high risk pregnancy. Which tool will use for tracking? Yes, tracking is by Anmol, tablet based software for ANN. So DFF, digital hemoglobin measurement, is fourth benefit. First F means fortification of food with iron. We will ask the mother to have more green leafy vegetable and all. And last F is focus on other cause of anemia as well, particularly malaria, filariasis, and thalassemia. So how will you remember all the 6 benefits? Very simple. One is IFA. Second is albendazole, which we give on 10 February and 10 August. Mainly 10 February is the National Deworming Day. Then we have the third benefit BCC, and 4, 5, 6 is DFF. Digital hemoglobin measurement and delayed cord clamping. Food fortification with green leafy vegetable and iron sources. And F means focus on other cause of anemia as well. So these are the 6 benefit, and they are given in 6 people, 6 beneficiary. So I hope you will remember Anemia Mukt Bharat and Gynae, PSM, all area you will do. Now let's come to the most important topic, Ayushman Bharat actually. Because I am expecting one question definitely from Ayushman Bharat. What is this have done? Recently, Ayushman Bharat also include a school health program. Previously, school health was not there, but now school health is under it. And when we talk about the school health program, why school health program is included in Ayushman Bharat? Because on Tuesday of every week in the school, they are going to celebrate Health and Wellness Day. So how will you remember it? And previously Health and Wellness Center was under Ayushman Bharat, which is now known as Ayushman Arogya Mandir. So they include school health also under Ayushman Bharat. So on Tuesday, they will celebrate Health and Wellness Day. Why? Again, because Tuesday is Hanuman Jayanti. It will help in propaganda, hai na? Associated with that thing. You can remember Tuesday. And they will train student in meditation and yoga on this day. Because yoga se sab hoga, hai na? Yoga will do the things. So school health program is also under Ayushman Bharat. This is the third thing under it. What are the remaining two things under Ayushman Bharat? Now it is 3 component. Previously it was only 2. So previously the first component was Health and Wellness Center. Second was PMJ, Pradhan Mantri Jan Arogya Yojana. Jai Ho PM Ki. Now Health and Wellness Center is no more and it has become Arogya Mandir. Arogya Mandir. I will show you the logo of this Arogya Mandir and recent programs also. And I have already recorded a YouTube video on recent program. You can watch that also. Plus I can show the video in this session also after some time. So what is this Ayushman Arogya Mandir is doing? What is this Ayushman Arogya Mandir is doing? This Ayushman Arogya Mandir has going to have 8 benefits actually, but in the logo of Ayushman Arogya Mandir, they have written about some 5-6 special things. What are the things which they have written? Very simple to remember. 3 are regarding BP sugar problem in old age. First, what we do for BP sugar, we will do screening for non-communicable disease and medicine delivery, deliver medicine at Ayushman Arogya Mandir. This is one thing. Second thing, we will tell them how they can prevent themselves from these all things. Health education will be given, but they have written the word not education, they have written the word awareness. Health awareness will be given. And third thing is they will get yoga and meditation. So 3 things is related with this old age BP sugar problem. Then 2 things are related with mother and child. So one is mother and child health. That means mother can come for delivery and child come for cough, cold and other problems. Second thing is immunization services, vaccination. So total, if we go logo wise, there is 5 things which is done under Ayushman Arogya Mandir. And Park textbook have written that 8 facility will be there. How to remember? Very simple. Mental, dental, mental and dental. ENT and ophthal we always read together. Mental, dental, ENT, ophthal 4 are done. Then for old age, geriatric health and palliative care. Palliative care means post-cancer pain relief. Sometimes it is not in medical college. Government will say that we will make it reach till Ayushman Arogya Mandir. So old age geriatric palliative care will be there. Trauma, without X-ray, ultrasound, LFT, RFT, thyroid profile facility at Arogya Mandir, we will directly manage trauma. And last is health promotion like yoga, because yoga se sab hoga. So how to remember this 8? I am adding some word in between to make it emotional so that you remember it. Okay, very simple. Dental, mental, ENT, ophthal 4 done. 2 are with old age, geriatric health care and palliative care. And 2 last is trauma and yoga. Okay, trauma and yoga. So total 8 benefit, but these 5 things are in the logo. They can ask which of the following is not a benefit under Ayushman Arogya Mandir. I hope you can answer. Now, in the Ayushman Arogya Mandir, they have put a new person as a post. The name of the post is CHO, Community Health Officer. Okay, so this Community Health Officer is for motivating villager for yoga and meditation. It is for health promotion. So what are the people who are going to be there at Ayushman Arogya Mandir? At Ayushman Arogya Mandir, there will be 1 male health worker, 1 female health worker, 1 ASA, and most important, 1 CHO. They will definitely be there at Ayushman Arogya Mandir. Sometime if it is replacing PHC, there can also be an Ayush doctor and an MBBS doctor. Okay, sometime. Now let's focus on the main insurance program PMJ. So if you see, and they can ask, and I will show you the logo of Ayushman Bharat. The logo of Ayushman Bharat has 5 leaf. Why 5 leaf? Because such same 5 leaf are also in marijuana plant. So what the government is saying, smoke and get high? No, they are saying 5 lakh rupees, 5 lakh rupees. Remember this always. In PMJ, how much money is given? 5 lakh. It's not money given. It's 5 lakh insurance for health, है ना, 5 lakh health insurance. And this health insurance is useful when you get admitted on hospital bed. After that, it will work. And this insurance is for BPL family or economically weaker section. This is for economically weaker section family, EWS family, 5 lakh insurance. And this insurance is for the whole family for whole year. 5 lakh per family per year. Now, a new thing they have done in PMJ or Ayushman Bharat, and that is known as PM Vayo Vandana Yojana. Oh, again there is Vandana. Vandana means worship. And you know how much PM like to do worship, hai na? So this is Vayo. Vayo means old age. Old age, Vandana means worship. I have written already. Vandana means worship and Yojana. Vayo Vandana Yojana. What is this Vayo Vandana Yojana? Government is saying that all more than 70-year people, population will also get PMJ card. Will also get PMJ. What is PMJ is giving? PMJ is giving 5 lakh health insurance. 5 lakh insurance is also for all old age people. Okay. So this new thing has also added in Ayushman Bharat. So what are the 3 things in Ayushman Bharat? One is PMJ. Second is Ayushman Arogya Mandir, which is same as Health and Wellness Center. And third thing is School Health Program. All these 3 things come under Ayushman Bharat. And this question has come, who fund Ayushman Bharat? Is it funded by central government or state government? Usually we all think Ayushman Bharat is only funded by BJP. No. Ayushman Bharat has, and not only Ayushman Bharat, ESI scheme, which is Employee State Insurance Scheme, and Food Safety Standard Authority of India, FSSAI. These 3 things are both center and state funded. This is both under center and state. All these 3 things, ESI, Ayushman Bharat and FSSAI. In Ayushman Bharat, 60 to 70% come from central government and 30 to 40% come from state government. In ESI, 1/8 come from state government, 1/8 of insurance premium come from state government, and 7/8 come from central government. So who mainly fund this scheme? Mainly funded by central government, because 7/8 central government, 1/8 state government, but also have some funding from center state both. Similarly, Food Safety Standard Authority of India funded by both. Okay, so that is the reason why all the non-BJP state like Tamil Nadu, Kerala, they are not applying Ayushman Bharat, because even if they will give the 30%, 40% fund, credit will go to BJP. And all the political party are only working for credit. So they cannot let it go. That's why they will not apply it. Now, what is Indradhanush scheme? This is an old program. It's no more. It was Mission Indradhanush. Indradhanush means rainbow. So it was for initially for 7 vaccines, which was very easy to remember. 3 are BCG, OPV, Hep B, which are given at birth, for which ASA do not get payment. 3 are DPT, and last is measles. So these 7 vaccines initially was under Mission Indradhanush, but now it is intensified Mission Indradhanush 5.0, and it cover all the vaccine of national program. So now it cover everything. Then the confusion come in Ujwala, Ujawala, and you must have heard of Ujala, Ujawala like this. So how will you remove this confusion? Very simple. If you focus here, there is a jaw in Ujawala. And what is the role of jaw? Jaw catches food and bring it to stomach. So similarly, Ujawala, if any child is being trafficked, Ujawala will catch the child and bring it to the home. So it prevents child trafficking and help in their rehabilitation. Prevent child trafficking and help in rehabilitation. For this work, from India, Kailash Satyarthi have received Nobel Peace Prize for this work of preventing child trafficking and helping in rehabilitation. And she shared the Nobel Peace Prize, Kailash Satyarthi shared it with Malala Yousafzai, the girl who took a bullet in her head for female education and still survived. So leave something on nature also. Don't take too much stress. Even if there will be a bullet in your head, still you can survive. So there is some nature energy. Have faith, leave it to the nature energy. So Ujala is for job work, preventing child trafficking. Ujala is just LED light distributed by government for brightness. So this is something which is not being asked, never being asked. But they can ask Ujwala. So what is Ujwala? Before this LPG cylinder crisis, Ujwala was giving free LPG cylinder with one-time gas. And this free LPG cylinder with one-time gas is for which people? BPL or economically weaker section. This was for BPL family. Economically weaker section Ayushman Bharat, BPL Ujwala cylinder. And similarly, Ambani also gave free Jio SIM card with one-time recharge. But was it for helping people or to earn money from that? And so this program is also helping BPL and earning money from them, both at the same time, just like Ambani. Now, this PM portion is something which replaced midday meal. So now in midday meal, they used to give half of protein and 1/3 of calorie. More protein, less calorie. Why? Because calorie they can get from rice at their home, but protein they don't get. So more protein, less calorie. And now a new thing government has done is they have integrated Anganwadi with government school. So now Anganwadi and government school are together. That's why in PM portion, they are giving food not just to school children. PM portion include school and preschool, both children. School plus preschool. They include both the children. Preschool means Anganwadi. Because now school and Anganwadi are together. Why they are together? Because previously some student used to join Anganwadi for food, but they used to drop out before joining school. So to prevent this dropout, Anganwadi and school are together and they both get PM portion meal with half protein, 1/3 calorie. So this was portion program. Now let's see some more logos. This is Kausal Bharat. You can see pen and screwdriver together so that if you don't get job by using pen, use screwdriver. This Skill Bharat is giving low interest loan. And this low interest loan along with training to start business. Low interest loan and training is there in Skill India, Kausal Bharat. This is a bird, Atmanirbhar Bharat, self-dependent bird with wing but still not flying. This is Atmanirbhar Bharat, and here also we give low interest loan. So in a way, government is earning from these schemes also, low interest loan. But along with low interest loan, to make the India Atmanirbhar, we will decrease import. So decrease import and low interest loan under Atmanirbhar Bharat. This is Sankalank. Even people who speak Hindi, they don't know the Hindi meaning of Sankalank. Sankalank means compilation, not compilation video. Compilation means adding all the data. So if you have this logo with a small tail, this is the logo of 8th program. But if you make the tail big, then this become the program of Sankalak. What is Sankalak? Compilation of National AIDS Registry data. This National AIDS data is actually full bullshit data, and they are compiling it from 2017 to 20, and they say this is a new program. We will call it as Sankalak. So NACO is this, but red color is NACO. But if they give you this ribbon thing with pink color, suppose this is pink color. Pink color is for breast cancer. And if they give it in telecolor, you know what is telecolor? Telecolor means green and blue is telecolor. I will show you the logo, green and blue, both. So this telecolor is for cervical cancer vaccination. So remember, 4-5 ribbon is there, pink, red, telecolor for cervical cancer vaccination. Which vaccine for cervical cancer has been launched? Sarvarec. We will discuss about cervical cancer vaccine also in upcoming vaccination part. So this is TB program logo. TB harega, desh jeetega. And under this TB program logo, by which year India will eliminate TB? India will eliminate TB by 2025. But world said 2030. So 2025 has passed. This is Nikshay program, remember, by which through mobile we can report TB cases. So Niksha is for reporting TB cases. Poshan is that nutrition program logo. I hope you will remember the tree Poshan. And under Poshan, this is for Niksha. Niksha, what we do? In Niksha, we have web-enabled reporting of TB patient from government and private both. And remember the Niksha logo that was with this phone. So this is Niksha, this is Poshan. Then we have this 2-week awareness program for Poshan. We call it Poshan Abhiyan. The Abhiyan word means mission. So there is one small thing, Poshan mission, under which for 2 weeks, government will go from door to door and will tell people कि खाओ बे खाते काहे नहीं हो, eat dear, why are you not eating? Because sometimes people forget to eat, so the government will go and tell them to eat what is nutritious food, what they will make them healthy, like those information they will give under Poshan Abhiyan awareness program. And Anemia Mukt Bharat, we have already discussed. This is the UPT kit Nischay by ASA. This is the logo of Anemia Mukt Bharat. These are the 6 interventions, 6 mechanism, 6 beneficiaries, 6 into 6 of Anemia Mukt Bharat. This is the logo of Pichkari. Sorry, Kilkari. Kilkari, not Pichkari. What is Kilkari? Kilkari is the first cry of the child. So under Kilkari, what will be there? There will be recorded messages on phone for child care. So female will listen to these messages and she will take care of the child. All pediatrician go for oil massage, no use. So Kilkari will have recorded messages for child care. Anyway, you can see this child and mother is separate and the child diaper is full. Almost a Pichkari is about to come. So this diaper thing is there separate. That means child care. Okay, you can remember the logo. In all mother-child logo, mother and child were together. Here they are separate. This is Kilkari. This is the logo of BIS, Bureau of Indian Standard. You will see this logo in future when you will gift many silk sari and gold jewelry to your relatives and friends. Because mark my word, all of you are going to be super rich in your future. And money is going to be with all you because you are doctor. So BIS is the logo for that thing. This Arogya Sukh Sampadam is the logo for Ministry of Health and Family Welfare, not for Ayushman Ministry. It is Health and Family Welfare logo. This is the very interesting logo. Black is the dead and green is the life coming out. So within how many days we should register birth and death? We should register birth and death within 21 days. This is Birth and Death Registration Act. And where do we register birth and death? Birth and death was registered at PHC in rural area and marriage are registered at sub center in rural area. Okay, but now both of them are known as Ayushman Arogya Mandir. So this blue color circle is for diabetes awareness. Okay, then this is the logo of ESI scheme, which is we will read in occupational health, and which come under government, state and central ministry both. This is Matruvandana, which mother-child logo we have already seen all. So this is the logo for quitting cigarette. If you want to quit smoking, give a missed call on this number. If you give missed call, government will call you again and again till you quit mobile phone. And that's why it's M cessation. Mobile cessation, it's for cigarette cessation. And anyway, quitting cigarette is very easy. I myself has quit more than 55 times already. So it's very easy to quit. This is M cessation for quitting cigarette. This is Anmol reporting, and this is Mobile Academy ASA training on phone. This is Mobile Academy. ASA will get recorded messages on phone. She will listen to call and she will get trained. Okay, all doctors, you go for oil massage. So ASA training on phone. This is Mobile Academy. Okay, now Anganwadi we have discussed, and health in your hand. आपका हाथ, आपका स्वास्थ्य. क्या मतलब है इसका? क्या कहना चाह रहा है? Health in your hand. It means don't smoke, don't drink. Health is in your hand. Okay. And this is the logo of NPCDCS program. So this question has already asked in MCI, which of the following disease do not come under NPCDCS? So it's very simple to understand. CDCS. First C is for, let's say, cancer. D is for diabetes. Second C is for cardiovascular disease. And S is for stroke. So 4 disease CDCS cardiovascular disease, cancer, stroke, and diabetes. So there is one more program, which logo I will show you. No, logo is not here. India Newborn Action Program. Under this program, you can see a child sleeping on a bed like this. So in the INAP program, mainly we try to improve facility in for newborn children. And for this, we give 1 bed at PHC, 6 bed at CHC, 12 bed at district hospital. So how to remember it? See, first we have PHC as primary level, CHC secondary, and in the secondary, district hospital is also secondary but bigger than CHC. So PHC, CHC, district hospital, 1, 6, 12. This you can remember. Now first we will give care at PHC. Then if not, care will not work, we will try to stabilize the child at CHC. But if child is not specialized, we will give special care at district hospital. So how will you remember it? Very simple. PHC, CHC, district hospital, 1, 6, 12. Care, stabilization, special care. Okay, like this you can remember. Let's revise it. 1, 6, 12. Care, stabilization, special care. PHC, CHC, district hospital. Okay, this is INAP program. Now, this is Chirayu. Chirayu means longevity. This is Rashtriya Bal Swasthya Karyakram. Bal means how will you take care of your bal? Not that bal, this bal. Bal is the children. Hai? So bal means children, and in this program, Rashtriya Bal Swasthya Karyakram, we will read, we screen children for 4D. And then if needed, we refer them to District Early Intervention Center. We will talk about it. Then this is, as I said, if they say kite, kite is adolescent program, RKSK. This is, whose hand is this? PM Modi hand. One hand from front, one hand from back also, both side support. On which days Modi is giving his hand support? Yes, bhaiyo aur behno, on 9th day of every month, take mother for ANC checkup. This is that program, PM SMA, Surakshit Matritva Abhiyan, mission to save motherhood. So this is 9th of every month, PM SMA. This was old program of Congress, Rashtriya Swasthya Bima Yojana, which is the father of PMJ Ayushman Bharat, but now it's no more. Let's remove. This is the logo of PMJ, 5 green leaf. Remember how much money? 5 lakh insurance for which family? Economically weaker section. Okay. This is one more program, Rashtriya Vayosri, old age people. We used to give caliper and all those things. If they belong to BPL category, we can give them caliper and all. This is Vayosri. Vayosri means old age people. Vayo means old age. Okay. This is the logo which came in NEET exam, and a student said, sir, in this program we can have Congress and BJP both together. See, there is Congress and BJP. This is the program for National Leprosy Eradication Program. Because you will be surprised and happy to know, India has already eliminated leprosy in 2005. We eliminated it way back. Why? Because the criteria for elimination of leprosy is less than 1 case per 10,000, and currently population of India is so big that we have only 0.66 case per 10,000. So this criteria they also ask less than 1 per 10,000. That's why due to this criteria we have eliminated leprosy. So what are the diseases which India has eliminated? On this a question has already came that there was a disease which used to occur in the Wadmer and Jaisalmer district of Rajasthan, which has 30-40% area which are dry. So in these area, there was a special worm, Guinea worm, we call it as Dranunculosis. So the question which came on this topic was, there used to be Bawdis. You know what is Bawdi? Bawdi are well, but well with stairs. So in Badmer, Jaisalmer district, which have some dry areas, such type of deep well cemented are there. And when in the summer season water remain only in the lower part, then this worm, Guinea worm, grow in that water and it penetrate the skin of the leg and enter inside. Then when it has to put egg again, it used to come out. So when it come out, if you put a stick there, you can hold it and you can keep rolling the stick and it will come out. So this was Dranunculosis disease, which was asked in MCA exam and it has eliminated from India. Second disease which India has eliminated recently is trachoma. Trachoma is gone. Neonatal tetanus we have eliminated in 2016. You need not remember the time. Neonatal tetanus. Neonatal tetanus is gone. Then of course, we have no wild polio case since 2011. So polio you can say is gone. Smallpox is not just eliminated, it's eradicated. So that is definitely gone. So we have all these diseases which are eliminated from India. Okay. Measles we are trying to eliminate in future. Okay. Now, this was the only child happy with an injection, Mission Indradhanush, for 7 disease. And now we have intensified Mission Indradhanush 5.0 for all disease. So Mission Indradhanush is no more. We have intensified Mission Indradhanush for all disease. This is IDSP program, Integrated Disease Surveillance, where we report cases from rural area to upper area, and outbreaks should be reported within 24 hours. Within 24 hours, we should report an outbreak. Okay. This is a very important question of step surveillance. If I ask you that India has more high risk case of diabetes or Brazil, what will you say? No, you cannot say India because you don't know who have more high risk cases of diabetes. So if you want to compare the high risk population for NCD, we will take 5,000 people from India randomly, 5,000 people from Brazil randomly, and we will send ASA or other people to their home, and they will ask 3 level of question. First question they will ask is about their psychological factors. So can we call psychological as behavioral? Of course, yes, because psychology means behavior science. So first question is psychological and behavioral. So we will go to their home and we will ask कि क्या तुम दारू पीते हो, क्या तुम सुट्टा पीते हो, तुम गांजा क्यों नहीं फूकते हो, है ना? We will ask about smoking, we will ask about alcohol, we will ask about their exercise, because these all diet, exercise, these all are psychological thing. Now after asking psychological question, we get physical. We ask physical question, है ना? So what are these physical factors which we ask? फिजिकल हो जाएंगे, और फिजिकल फैक्टर में क्या लेंगे? पहले तो BMI, we will ask the age, because age more than 65 years is an independent risk factor, and we will also ask BP. So BP, BMI, age. And last thing we try to ask is about the hormonal factor. So can you call hormonal as biological? Yes, because they depend on our biology. So in the hormonal or biological factor, we will ask about 3 things: random blood sugar, LFT, and lipid profile. No, it's not LFT. Thyroid profile, lipid profile. There is no LFT. So RBS, I'm 100% sure about it. Don't doubt it. I have a mnemonic also which will prove that there was no confusion here. So what are the 3 things? Lipid profile, what is happening? ऐसे छुओ, हाँ, ऐसे छुओ, हाँ, ठीक है. Lipid profile and thyroid profile. Lipid profile and thyroid profile is done only in developed country. These are rarely done in India. But in India, they have asked this question also: which test is done at sub-center? Random blood sugar is done at sub-center. Which test ASA do by home visit? Random blood sugar. Because villager wake up at 3-4 a.m. in the morning. I don't know why. So it's difficult to do fasting blood sugar in them. So these are the tests done, and these are the factor. 2 questions has came from here, one in NEET, one in MCI. In NEET, they ask which factor is not included. Which factor not included? In step surveillance, which factor we don't ask? The option was, don't we ask behavioral factor, therapeutic factor, biological factor, or psychological factor? So which factor not included? Therapeutic factor not included. But actually therapeutic factor means based on which we start treatment, and we have the thyroid profile based on which we can start treatment. But why we have written therapeutic factor not included? Because the purpose of step surveillance is to compare high risk people. We just want to know whether you are in high risk or not. We don't want to start treatment here. So therapeutic factor, remember, not included. How will you remember the factor which are included? You can use the mnemonic BPH. अगर बिनाइन पैरोक्सिस्मल हाइपरप्लेजिया दे दिया तो अभी भूल जाओगे. निमोनिक है 2 बम पे एक हाथ, दो बम पे one hand, one hand on two bum. What are the two B? First B is biological, second B is behavioral, 2B, 2P physical and psychological, and 1H hormonal. So these are the factors, do bum pe one hand. And in the MCI exam, they ask which test is not included. So LFT, RFT, they are not included. How will you remember which test not included? For that, one student suggested me this mnemonic, sir. We can remember it by the mnemonic BTR love. Okay, so I said, explain, dear. He said, why not, sir? See, B stand for two things, BP and BMI. T is for thyroid profile. R is for random blood sugar. And L is for lipid profile. BTR love is for the test. And do bump one hand is for the factors. This is step surveillance. I hope you will remember and revise. Beti Bachao, Beti Padhao is for awareness only. Awareness of increasing female education and decreasing feticide. They have asked this 3 questions from Niti Aayog already. It has the shape of this Ashok Stambh. First question is, what is the full form of Niti Aayog? So Niti Aayog full form is National Institute, of course, for Transforming India. Have you written the full form? No. National Institute for Transforming India. Transforming. So the second question, so remember it's Transforming India. Transforming India. The full form, transforming. Second question they asked, which organization it replaced? So in India from 1950 till 2014, there was National Planning Commission. And in National Planning Commission, it has all corrupt people of Congress in it. So when BJP came into power, BJP people say, hey, all you corrupt people of Congress, go away. Now our corrupt people will work. And they replaced Planning Commission with Niti Aayog. So which organization they replaced? Planning Commission they replaced. Full form, Transforming India. Now the third question have came, what is the work of Niti Aayog? So one work which Niti Aayog do is, Niti Aayog give ranking to state. Of course, Niti Aayog main work is, it is a think tank which give technical advice to government that how we can sell government properties to private people and how we can increase private partnership. So that is the main work of Niti Aayog. But other than that, it also give ranking to state based on performance of healthcare. And mostly this ranking and prize they give to those states which are run by their own government. So it's like father giving prize to their own son. So that's what Niti Aayog has one more work. It gives ranking based on their health indicator and all. But remember, Niti Aayog do not deal with referral service complex or government health system directly. It just gives them the ranking and try to increase private partnership in government organization. So this is very important question, Niti Aayog. Now from the life cycle, they have asked this question that in hydrated cyst disease, in the life cycle of hydrated cyst, where do you have the sexual stage? Because the organism in which you have the sexual stage, that is the main host. So who is the main host of hydrated cyst? Is it dog, sheep, human or soil? So you can see in the cycle, in the adult form is in the dog. And what is the symptom of adult? Adult do sex. Adult do sex. So who is the sexual stage main host? Main host is also known as definitive host. So main host is dog. Dog is the main host of hydrated cyst. Actually, if you see, there are 3 diseases in which human is not the main host. In all other, sex of parasite occur in human. But in 3 diseases, sex of parasite do not occur in human. We are facultative host. What are those? First is hydrated cyst. Hydrated cyst, sex occur in dog. Main host is dog. Second is this toxoplasmosis. In toxoplasmosis, main host is cat. Cat is the main host. And human is the facultative host. Similarly, if you look at Plasmodium life cycle, malaria life cycle, in Plasmodium, In which organism sex occur? Mosquito sex occur. So who is the main host of malaria also? Mosquito. So in 3 disease, hydrated cyst, toxoplasmosis, plasmodium, human are facultative or intermediate host. We have asexual life cycle of malaria in our RBC. Sexual part in mosquito, dog and cat in these 3 disease. Okay. Then they very commonly ask this life cycle. They will give choohe ka mooth, rat urine, and they will ask which life cycle they are talking about. So if you found rat urine, it's definitely going to be leptospirosis. And because leptospirosis is by rat, so when in Kerala district, leptospirosis occurred during Kerala flood, government of Kerala, they distributed doxycycline for chemoprophylaxis to protect that who are at risk. But along with doxycycline, they distributed rat killer zinc phosphide. So one very good app they have written that they distributed malathion. Malathion is to kill mosquito. Here we have to kill rat. So what we give it doxycycline, zinc phosphide, not malathion. Okay, so this is leptospirosis. But remember, in leptospirosis, 2 things. There will be conjunctival suffusion. जैसे गांजा फूक करके आंखें एकदम भक लाल हो जाती है ना, भकुआ जाते हो, वैसे ही इसमें भी leptospirosis can have the same redness type of thing which occur after smoking weed or something. So conjunctival suffusion is there. Plus there is calf muscle pain. If you found calf muscle pain, conjunctival suffusion, it's leptospirosis. This question has also came in NEET exam. Okay, so this is leptospirosis. Then life cycle of JE they keep asking again and again. Do remember, if they ask the question, who is the reservoir of JE? Reservoir means that organism which store JE in non-rainy season. जो बरसात में स्टोर रखते हैं वो रिजर्वायर नहीं है. रिजर्वायर मतलब जब बारिश नहीं हो रहा है तब जेई वायरस किसके अंदर रहता है. तो इन नॉन रेनी सीजन जेई वायरस इज इन आर्डिड बर्ड. सो हु इज द रिजर्वायर? आर्डिड बर्ड. और आर्डिड बर्ड उसको नॉन रेनी सीजन में मेंटेन करके रख रहा है, इसलिए उसी को मेंटेनेंस होस्ट कहते हैं. तो रिमेंबर, आर्डिड बर्ड और हीरोइन और बगुला, वॉट एवर यू से, दिस इज द रिजर्वायर, दिस इज द मेंटेनेंस होस्ट. सेम. Now in the story enter Culex. Culex is such a talented mosquito कि उड़ती चिड़ैया के बम में काट लेता है. It bite in the bum of flying bird and then through the genital organ it pass the egg to its children. So there is transovarian transmission in Culex. Transovarian transmission means through genital organ and eggs and all, it transfer the JE virus to other Culex. And this Culex, after biting in the bum of bird, bite in the bum of suarwa, pig. And pig is the amplifying host. तो मैं सोचता था कि जेई वायरस के लिए पिग गाता होगा कि मैं तेरा एम्पलीफायर है ना. Pig is the amplifying host for JE virus. And then after biting pig bum, it can bite in the bum of me, human. And suppose me and my wife is sleeping together, of course, and I have Japanese encephalitis, and the mosquito after biting my bum also bite in the bum of my wife. So will it transmit JE from me to my wife? No. That's why human is dead end host. मलेरिया डेंगी मच्छर एक इंसान को काट के दूसरे इंसान को काटेगा तो फैल जाएगा, लेकिन जेई मच्छर क्यूलेक्स के थ्रू एक से दूसरे में नहीं फैलता है, इसलिए इंसान डेड एंड होस्ट है. बिकॉज जेई डू नॉट गो थ्रू मॉस्किटो बाइट फ्रॉम वन ह्यूमन टू अनदर, सो ह्यूमन आर डेड एंड होस्ट इन जेई. Okay, so this is the JE also which we read. We remember human are dead end host, pig are amplifying host, and ardid bird or heroine is maintenance host and reservoir. Both are ardid bird or heroine. Chalo. Now this question has came that in a traveler with fever, loose stool, abdominal pain on 4th day, which test you will do? So see, 4th day means this is first week of typhoid, and in first week of typhoid we do blood culture. I hope you all know the mnemonic BASU. BASU means in first week B for blood culture, in second week we do antibody test. Antibody test is Vidal test, and when you do Vidal test we can get O and H antigen. This O antigen is for recent infection and H is for past infection. So O is more important, H is less important. And if the titer is 1:80 or more than that, only then you call it typhoid positive, not less than 180. So the titer must be 1:80 से ज़्यादा or equal, not less than that. Then in the third week, if the patient came with typhoid, we will do stool culture. In the fourth week, we will do urine. That's why the mnemonic is BASU. And in typhoid, which type of stool come out? हरे मटर के दाने जैसा, हरा मटर का सूप जैसा निकलेगा टट्टी. तो इसको कहते हैं पी सूप latrine. Pea soup is in typhoid, rice water is in cholera. Okay, so I hope you will remember BASU and typhoid. On 5th day of retroorbital pain and bone pain, which test should be done? So if they say retroorbital pain and bone pain, it is which disease? They are talking about dengue. And in dengue, till 4 days of fever, we do NS1 antigen test. Because एंटीजन जो मच्छर के काटने से घुसा है वो 4 दिन तक तो रहेगा, फिर उसका कॉन्सेंट्रेशन डाइल्यूट हो जाएगा. तो बिकॉज एंटीजन विल डाइल्यूट इन 4 days, आफ्टर 4 days देयर इज नो पॉइंट ऑफ डूइंग NS1. सो व्हेन द पेशेंट कम ऑन 5th day, so 5th day we will do IgM antibody test. है ना? First of all IgM get formed, then IgG formed after some weeks or days. So IgM antibody detection is done 5th day and afterward. Till 4 NS1, then IgM. Do remember, 5th day IgM. Now let's talk about some question on malaria drug. If there is a pregnant female and she had Plasmodium vivax infection, which drug you will give to her? So in pregnant female, remember primaquine is something which is contraindicated not only in pregnancy. This is also contraindicated in G6PD deficiency. And it is also contraindicated in infant. So in these three, we don't give primaquine. And for Vivax, what is the drug of choice? Chloroquine plus primaquine. But we cannot give primaquine. So what we give in pregnant female in Vivax? Chloroquine. Why not artesunate? Because artesunate is something which is the drug of choice for falciparum in normal states, not in northeastern states. But artesunate is something which is also contraindicated in first trimester of pregnancy. Artesunate is contraindicated. And here in this question, it has not given which trimester. So anyway, artesunate we do not give. And one of my very close friend Ankur Jan, he gave this mnemonic that in falciparum infection, because we cannot give artesunate in first 3 months, so what we give? We give quinine. So quinine is the drug of choice for pregnant female if she have falciparum. So quinine is pregnant female with falciparum. So Ankur Jain sir said there, he in pregnancy we should keep female like a queen. So which drug we will give to her in pregnancy if falciparum occur? Quinine. And I said ki if you will keep her queen her lifelong, she will also treat you like king. है ना? So treat it like that. But anyway, at least in the first trimester, definitely queen. So quinine. And artesunate we give for falciparum, but not in northeastern state. I hope you know this, that in northeastern states for falciparum, what is the drug of choice? For northeastern state, we give artemether plus lumefantrine. And they have asked what is the dose of these two drugs with each other. When we give artemether plus lumefantrine, the dose ratio is 1:6. 1:6 dose means if you give artemether 40 milligram, lumefantrine has to be 240 milligram, 1:6. This is in northeastern state, and along with this we give primaquine. But in case of falciparum, we give primaquine only on day 2, because falciparum do not hide in liver. Vivax hide in liver. So for Vivax, we have to give primaquine for 14 days, because Vivax cause relapsing fever. बीच बीच में लिवर से निकल के ब्लड में आता है Vivax, और जब भी ब्लड में आता है फीवर बढ़ जाता है. So whenever it come in blood in between, fever rises, that is relapsing fever. So that's why primaquine for 14 days in Vivax. but only for day 2 in case of falciparum. So northeastern states, this is the drug, and for other states, if it is falciparum, we give artesunate combination therapy as drug of choice. And in artesunate combination therapy, main thing is that we give artesunate always 4 mg per kg per day. Okay. So from here, they ask an interesting question in NEET PG exam, although this is a part of malaria thing, but still we can discuss it, that on day 2 of mixed infection means patient have falciparum and vivax both. So on day 2, what is the treatment you give if patient of 50 kg is there? So remember, in the answer, it was NEET PYQ, so we should know. On day 2, we give 2 drugs. In case of mixed infection, we prefer to treat mixed infection like falciparum, क्योंकि mixed infection में falciparum ज़्यादा खतरनाक है, तो हम artesunate से ठीक करते हैं. So we give tablet artesunate, and the dose of tablet artesunate is 4 mg per kg per day. So 4 mg means 50 into 4. So what you will give? Artesunate 50 mg 4 tablet, because 4 into whatever weight. So 4 tablet of 50 mg. Plus on day 2, we give primaquine. But anyway, this is mixed infection, so we have to give primaquine for 14 days. And the dose of primaquine is 0.25 mg per kg per day. So 0.25 है और यहाँ 50 है, 0.25 into 50 12.5 आ जाएगा. देखो कैसे 0.25 यानी 1/4. 50 1/4 of 50 is first 25, then 12.5. So 12.5 means I can write primaquine 2.5 mg 5 tablet. So total will become 12.5. So this was the question, this was the answer. If they repeat the same one, you can answer it. Even if they change a bit, these 2 doses can help you in answering it. 4 mg per kg for artesunate, 0.25 mg per kg for primaquine if it is mixed infection treated like Vivax. Then we give 0.25 mg. Okay, so I hope you will remember it. Next, let's go to TB program. In TB, 24 March is National TB Day, and India, according to it, will eliminate TB by 2025. Now 25 has gone to 27. So tell me, which is easy to reduce in TB? Case is easy to reduce or death? Death we can reduce. Mortality means death. Death we can reduce by making hospital better. So death is easy to reduce. But to reduce the cases, new cases, we have to decrease malnutrition, which is very tough. So the target for death is big. What is the target for death? 90%. And the target for case is small, 80% reduction. देखो, केस को कम करना मुश्किल है, इसलिए केस का टारगेट छोटा है 80%. मौत को ठीक करना आसान है, क्योंकि मौत को हॉस्पिटल ठीक करके हम रोक सकते हैं, इसलिए उसका टारगेट बड़ा है कि हमें मौत को 90% कम करना है, नए केस को 80% कम करना है. The target is we have to reduce new case by 80% and death by 90%. So this same target is for SDG 90-80. Just remember these 2 words, 90-80. Only 2 words you have to focus, 90-80. Death 90, case 80%. And catastrophic expenditure due to TB should be 000. And it's 95 and 90 here, but they do not ask in the TB usually. Catastrophic expenditure का मतलब so much money spent on TB that your socio-economic status become 1 class lower. If you are middle class, you will become lower middle. If you are lower middle, you will become lower class. If you are lower class, चड्डी फट जाएगी, है ना? Your underwear will burst and you will spend so much money. So government said that 0 catastrophic expenditure should be there. So that is 0. Remember, case 80, death 90%. This is the target. And government said कि we will keep 1 TB health visitor per lakh population. This TB health visitor will go in slum area and will collect sputum sample. So this will do active case detection, just like MPW was doing in malaria. Second thing they say is, if there is any patient of HIV, this question has already came in MCI exam. In HIV patient, we don't do CBNAT. We don't do ZN smear. We directly do CBNAT. Directly CBNAT, no ZN smear. So remember, directly CBNAT is done in 5 people. HIV, COVID, diabetes, then PP. What is PP? First P is previously treated. T, if someone is previously treated for TB, they can have drug resistant TB. And CBNAT is the screening of choice if you are screening for drug resistance. Then last P is pediatric TB case. देखो आपको भी पता है कि आप अगर किसी बच्चे को बोलोगे कि थूक दो तो मुंह देगा, मुंह दो तो थूक देगा. If you will ask a child to urinate, he will spit. If you will ask him to spit, he will urinate. So it's very difficult to take sample from pediatric TB cases. Sometimes we have to do gastric lavage to collect 2 ml sputum. So if sputum has collected with so much difficulty, why not directly do CBNAT? So 5 cases where we do directly CBNAT: HIV, diabetes, COVID, PP, pediatric TB, and previously treated. Okay, 5 cases we directly do CBNAT. Remember, for HIV it already being asked. Now, why we are doing directly CBNAT? Because CBNAT not just detect TB bacteria, it also detect rifampicin resistance in 1 hour. So that's why they have asked this question, that what is the screening test of choice for detecting drug resistant TB? So if they say screening test for drug resistant TB, then answer will be CBNAT. Okay, but if they say drug resistant only, then you will answer CBNAT. If they say screening test for TB cases, screening test for TB, 2 things can occur. First thing they can ask is screening test for TB spread. TB spread means TB infection. And second, they can ask is screening test for TB case. Normal TB case in a village you want to know. So if you want to know normal TB case in a village, for normal case we do Janani smear. Because CBNAT is costly, we cannot take CBNAT in the village and do screening of everyone. So if you want to detect normal case, Janani smear. Resistant case, CBNAT. But if you want to detect spread or infection, then you have to do tuberculin test, Montux test. Because Janani smear only talk about disease. Tuberculin or Montux talks about infection. So there are 3 questions in it. Okay, I hope you will remember it separately. For spread, Montux. For case, Janani smear. For resistance, CBNAT. And what is the gold standard for TB diagnosis? Gold standard for TB diagnosis is culture in liquid medium. So if we take 2 sputum sample for diagnosis, they have asked how you label it. You label A as a spot sample. जैसे पेशेंट आएगा बोलोगे कि थूक दो, और फिर उसको एक बड़ा सा बॉटल दोगे, छोटा सा, बोलोगे सुबह बिना ब्रश किए खखार के थूकना और मेरे लिए गिफ्ट रैप करके ले आना, है ना. इन मॉर्निंग विदाउट ब्रशिंग योर टीथ टेक डीप थ्रोट स्पुटम एंड ब्रिंग इट विथ मी बाय लेवलिंग इट B. So early morning B, spot sample A. If anyone positive, we start treatment of TB. But the question which came from true time from this topic is that suppose there is a patient with 2 Janani smear negative. There is 2 Janani smear negative. And X-ray is suggestive of TB. If you look at X-ray, you find TB. So what is the next test you will do? Janani smear is saying no, it's not TB, but X-ray you look like TB. Next test you will definitely do is CBNAT. Never start TB treatment without confirming it by CBNAT. If Janani smear is coming negative, do CBNAT. We can start treatment under clinically confirmed TB, but we don't decide clinically confirmed unless CBNAT is done. So first Janani smear, if Janani smear negative, CBNAT. Do remember. Chalo. Now, if there is drug resistant TB, there are a lot of questions they ask from here. If there is normal TB, first we give HRJD. I hope you know HRJD we give for 2 months. And then we give HRE. World give HR, WHO give HR, but we are more developed, we give 1 extra for 4 months. So total 6 months is the normal. But the question they ask nowadays is from drug resistant TB. So if it is only isoniazid resistant, H is the resistance, so we can give RJD plus levofloxacin, and this we can give for 6 months if it is isoniazid resistant. And in market there is no RJD available, so WHO say you can take HRJD also, no problem. But main question come from MDR. What is the MDR? Whenever I ask a student, say multi-drug resistant, I say that is the full form. What is the definition? Definition of MDR NEET, they have asked it. Definition is at least resistant to isoniazid plus rifampicin both. At least resistant to isoniazid and rifampicin both. Minimum 2 resistance, then we call it MDR. So what is the treatment for MDR treatment that we are giving? This is the question which they are asking again and again. For 6 to 9 months, MDR TB, we can treat by BPAM regime again and again. And in your exam, guarantee one question will come from BPAM. If they will not ask the name of the drug, then they will ask, what is the mechanism of action of these drug? Okay, so B stand for bedaquiline. First know the full form. These 4 drugs we are giving in MDR TB. P for pretomanid. In one recent exam, they asked the mechanism of action of pretomanid. Remember, L is not for levofloxacin. L is for linezolid. They can ask the mechanism of action of linezolid also. And M is for moxifloxacin. So, how does bedaquiline work? Bedaquiline is an ATP synthetase inhibitor. Rest, other mechanism of action, you should try to know it yourself. ATP synthetase inhibitor is bedaquiline, and that's one of the main drugs. Then pretomanid, linezolid, moxifloxacin. Never forget this BPAM new regime. When do you call someone as XDR? XDR means there should be MDR TB plus there should be fluoroquinolone resistant to fluoroquinolone. What is fluoroquinolone? This all floxacin, levofloxacin, moxifloxacin, these all are fluoroquinolone. So their resistance should be there. Plus, along with fluoroquinolone, it should be resistant to second line injectable. And in second line injectable, we have AKC, amikacin, kanamycin, capreomycin. So isoniazid rifampicin resistant plus fluoroquinolone resistant plus AKC resistant, then we say XDR TB. Do India have XDR TB cases? Yes, we are the TB capital of the world. Very frequent cases. Now suppose I am a migrant worker from United States of Bihar and you are my doctor working in, let's say, Tamil Nadu. I wanted to go to Mumbai, but they beaten me badly, so I now come to Tamil Nadu to work. Although hope from Vijay he will maintain the friendship. So now I came to Tamil Nadu and I started my treatment, but within 1 month, I started missing my wife a lot and I ran back. So if someone ran back in less than 4 weeks, we call it as new case. But if I ran away more than 4 weeks, then you call me as previously treated case. So suppose I did not run away in the first month and I about to finish the treatment. My 6 month was about to happen. Just last week was there and I came and I said कि डॉक्टर साहब जाने दो ना बिहार है ना, कुछ जाने दीजिए ना घर, बहुत गुलू गुलू करने का मन है. I want to do some गुपचुप with my Mehraru wife there in Bihar. Let me go. This is last week of treatment remain. Will you stop me or will you let me go? Tell me. Will you stop me or let me go? Suppose you stopped me and I finished my treatment at 6 months and I ran away at 6 months. So Jaden smear is not available, but treatment is complete. So you will label me as treatment completed. Okay. And suppose you stopped me and after 6 months, my report came positive. And I came dancing to, yeah, Dr. Saab, at least something in my life is positive. What does it mean? It means treatment failure. And if suppose you stopped me and I continued my drug for 6 months, and then negative report came and I came with very sad face, Dr. Saab, everything is lull, negative in life. See, the report also came negative. It means patient cured of TB. Okay. So do remember, this is the very simple way, less than 1 month new case, more than 1 month previously treated, 6 month and no result, treatment completed only, 6 month and positive, failure, 6 month and negative, cured. But one last definition is, you called it loss to follow up. Loss to follow up was the earlier name was defaulter, now we call loss to follow up. Loss to follow up means patient not taking treatment for more than 2 months. Not taking ATT for more than 2 months, we call it loss to follow up. And when I ask you will stop me or not, the correct answer is you should never stop me. You should never stop the patient who come with TB. Ask him to give his or her real address, and Aadhaar is not real address. And you will update this real address in Nikchai app. For updating also you will get some money. And if you will update the address, government will make it sure that in Bihar he get the remaining TB drug. So never stop, let them go. That's why we use the word loss to follow up, because if the patient is lost, it's not only patient, but patient plus doctor both responsibility. It's not patient is defaulter, it's loss to follow up if he ran away for more than 2 months. Okay, so this is the important definitions and part of TB program. Now let's talk about HIV. In HIV, first thing is we do one very good HIV sentinel surveillance. And as I discussed already, sentinel include active plus passive. Passive means notified, active means hidden case, and if you mix hidden plus notified, it become total case. Sentinel surveillance is for all cases. So in HIV, how we do sentinel surveillance? For sentinel surveillance, let's say you want to know that in Madhya Pradesh, suppose I want to know in Bihar HIV is increasing or decreasing, or you want to know in MP HIV increasing or decreasing. So what you will do is every year you will go to 250 high risk, 250 bridge people, total 500. You will go, so it is active, and you will also test 400 ANC mother, because ANC mother come by themselves, so it is passive surveillance. So every year you will test 900 people, and suppose this year in Bihar the HIV prevalence is 0.25. Next year it is 0.2. 0.2 from 0.25, it means Bihar HIV is decreasing. So sentinel surveillance only tell us whether HIV is decreasing or increasing. So what does sentinel surveillance tell us? Sentinel surveillance tell about trend of HIV increasing and decreasing. And it also tell which state has more burden of HIV. So sentinel surveillance we do to tell trend and burden, and most of the questions nowadays are coming from sentinel surveillance of HIV these days. So focus on this part. This is the table from which question come. First is about high risk group. What do you think? Do doctors are high risk group for HIV under sentinel surveillance? No. Don't give yourself too much of importance. You have not performed that well. Sex worker come under this group first. You need to improve your performance, then you will come under here. So who are in the high risk group? First people in the high risk group is sex worker like me. Then there is drug user, transgender, male having sex with male. Okay, so 4 people come under high risk group. 2 are sex worker and drug user, 2 are transgender and MSM. Why transgender MSM? Because they go for unprotected anal sex, and unprotected anal sex is more risky than unprotected vaginal intercourse. So they are high risk group. Sex worker, transgender, MSM and drug user. Okay, 4. Please remember 4. Then 2 are bridge population, single migratory worker, long distance truck driver. And single doesn't means married or unmarried. Anyone who is away from wife is single. So I also go to take classes for 5 day, 10 day in different classes, different state also, out of India also, to take classes of PSM. Am I a migratory worker? I don't know why, but whenever I ask, everyone say, yes, sir, you are a migratory worker. And answer is yes. According to that definition, I am single migratory worker there, because I am not going there mostly with my wife. So why they call single migratory worker and long distance truck driver as bridge population? देखो आपने भी देखा होगा कि यूजुअली जो सेक्स वर्कर रहती हैं वो शहर के बाहर रहती है एक एरिया में. Usually sex worker and red hot spot areas, red light areas are outside city. So these some of the migrant worker and truck driver, they go to sex worker who are away from population, do sex with them and without condom and bring HIV back to their normal population. तो कर क्या रहे हैं, शहर के कोने से शहर के बीच में एचआईवी को ला रहे हैं. दे आर ब्रिंगिंग एचआईवी फ्रॉम सेपरेट पार्ट सेक्स वर्कर टू नॉर्मल एएनसी फीमेल. सो दे आर वर्किंग लाइक ए ब्रिज. दैट्स व्हाई दे आर ब्रिज पॉपुलेशन. सो एक ही क्वेश्चन बार बार आता है, which of the following is not included in sentinel surveillance? Total 7 people are included. 4 are high risk: transgender, MSM, drug user, sex worker. 4. Then 2 are bridge, migrant worker, truck driver, and one last is ANC mother. Okay, so there are 5 group, and in ANC and in blood transfusion 5 tests are done. This question has also came. What are the 5 tests in ANC and blood transfusion? Very simple. 3 I hope we need not to tell also. HIV, hepatitis B and hepatitis C. You know these 3: HIV, Hep B, Hep C. Only 2 you have to remember: VDRL and malaria. So 5 tests we do in ANC and blood transfusion. And how we test these people? We test it by opt-in and opt-out strategy. When you test high-risk worker or bridge population, you test it by opt-in. But when you test mother, you test it by opt-out. You understand what is opt-in, opt-out? No? Okay, let me explain. Imagine me as a transgender. Okay, so I am the transgender and you came to me. Why you came to me? To test my blood, है ना? And if you will come to me, first you will ask for permission कि क्या मैं ले लूं? तो I will say कि ले लो, take it, है ना? So I opted in. I gave you my permission na, then you took na. So that's why in high risk and in bridge, we take permission, then we test them. But in mother, they are already included in the panel of test. So they cannot opt in, they can only opt out. Like tell me, can you opt in my class? No, you are already watching it. You can only opt out if you don't like. And if you opt out, can I forcefully stop and make you watch my video? No, no. So the same thing is here with the mother. They are already included in the panel of tests. They cannot opt in. They are already in. They can only opt out. And if they don't want to test, we cannot forcefully test them. So opt-in is for these 2. Remember, 6 people are in, 4 in high risk, 2 in bridge, and 7th ANC mother is opt-out. This is in passive surveillance. Okay. So this is HIV sentinel surveillance, and this is opt-in, opt-out testing. And based on HIV sentinel surveillance, if any state have HIV in high risk group more than 5% and HIV in ANC mother more than 1%, then we call it as high prevalence. But question only come from moderate prevalence state. Who are moderate prevalence? Tell me, which one is easy to reduce? High risk group HIV is easy to reduce or ANC HIV is easy to reduce? See, in high risk, they have risky behavior, so it's difficult to reduce. But in ANC, you can reduce it to less than 1%. And this is our first focus, first target, कि ANC should be less than 1%. So this is where students get confused. That's why they ask this part. Remember, moderate prevalence means ANC less than 1% HIV and high risk group more than 5%. Remember, moderate prevalence means ANC less than 1% HIV and high risk group more than 5%. Then we call it moderate prevalence. Then we have low prevalence and very low prevalence state. If it is both low, it is low prevalence, and if hot spot area is not known, it is very low prevalence. But main thing is moderate, they ask. I hope you will remember. So this is HIV sentinel surveillance. And in HIV, of course, we can know the topics of treatment of HIV and all, but I think in pharma you will read all those parts well. But still, what are the drugs which we give for HIV? Very simple. If you develop HIV, you are a person of limited edition. So the drug which we give is this same 3: lamivudine, tenofovir, dolutegravir. So you are a person of limited edition. So what you get? You get the same 3 thing, LTD: lamivudine, tenofovir, dolutegravir. This is the treatment which we give in adult. Now, after adult, when we talk about children, what we call children with love, we call them lad. माँ का लाड डला बिगड़ गया. And T is tenofovir, T is for tough. So can you give tough drug to children? No. So that's why in place of tenofovir, we give abacavir. Anyway, we call child as abacavir, lad in English, and ladla. So lad means we will give lamivudine, we give dolutegravir. Only thing that will change is tenofovir will change to abacavir. Now, if it come to infant, in infant, again we give lamivudine, but with lamivudine we add zidovudine. तो जिसको भी HIV हुआ उसके तो L लग गए. If you develop HIV, L lamivudine will definitely be given. You will be in limbo, so L will be given. But in infant we give lamivudine plus zidovudine. And infant topic they ask again and again. This lamivudine plus zidovudine is after 6 to 12 week. After 6 to 12 week till 1 year we give. So what we give in the first 6 to 12 week? In the first 6 to 12 week in infant, we give nevirapine. Now this question they are asking again and again. When do we give nevirapine for 6 week? When do we give nevirapine for 12 week? Because nevirapine is hepatotoxic. So we give 2 mg per kg per day only till 6 week or 12 week. We try to give it minimum because it's hepatotoxic. So now, if I am the mother who had HIV due to Deepak, you know, na, in that night day, in that night time, he blew my candle. So, if I am the mother and I am breastfeeding my kid, without breastfeeding, there is 20% risk of going HIV. With breastfeeding, 25% risk. So, the risk is more. And if the risk is more, we should give nevirapine for longer duration, 12 weeks. So, if breastfeeding, if mother is breastfeeding, we will give nevirapine for 12 weeks. And if not breastfeeding, we will give it for 6 weeks only. So do remember, if mother is not breastfeeding, then less time. If breastfeeding, 12 weeks. Start with nevirapine, then after 6 to 12, add lamivudine, zidovudine. Okay, so these drugs they ask, I hope you can easily remember, LTD, LAD, and then lamivudine, zidovudine, nevirapine in first 6 to 12. Chalo, now let's talk about some blindness program part. First thing is, what is the most common cause of low vision or visual impairment? Is it cataract? No. Cataract is the most common cause of blindness. For low vision or visual impairment, most common reason is refractive error, because refractive error can occur in children, young, old, everyone. Second thing is, if they ask most common cause of low vision or blindness in children, if they ask the same thing, most common cause of blindness, but in children, then in children, what will be the answer? Vitamin A deficiency is most common cause of blindness in children. Okay. And this definition of blindness, they keep asking. Remember, it is less than 3 by 60, not less than equal to. Less than 3 by 60 in any one eye. After wearing glass also, if you cannot see from 3 what normal person can see from 60, then you are blind. So less than 3 by 60 is blindness. And this less than 6 by 60 is same as social blindness. This question has also came in MCA exam. Social blindness is less than 3 by 60 and this is WHO blindness. Okay. Now, let's have the classification. We call it low vision. In India, the classification can be remembered by the mnemonic LESMA. LESMA. LESMA means choti ma, or you can have lesbian ma, whatever you say. So LESMA. What is low vision? Less than 6 by 18 till 6 by 60 is low vision. Less than 6 by 60 till 3 by 60 is economical blindness. Because at this time you cannot drive car or machine, so you are economically blind. Less than 3 by 60 till 1 by 60 is social blindness. So why we call it social blindness? Because when I am unable to see from 3 what normal person can see from 60, I can blink an eye on my neighbor thinking it is my wife. है ना, पड़ोसिन को आंख मार दूंगा ये सोच के कि मेरी बंदी है, अगर 3 by 60 से कम दिखेगा तो. And if I blink my neighbor, I will be beaten maybe. maybe, and there can be some happy ending also. But if I am beaten by that, my social relationship will get affected. So this is the problem with social blindness, that if the visual acuity is less than 3 by 60, we are not able to maintain social relationship. Okay. Now, what is manifest blindness? Manifest blindness means less than 1 by 60. And absolute means not vodka. Blindness means batti bujh gayi, light is gone. So that's absolute. So how to remember it? Very simple. 6 by 18, 6 by 60, less than 3 by 60. Now they ask very interesting question from this topic. The question can be something like this. Let me ask it here only so that you can remember it. Visual acuity of a person is 3 by 60 and 6 by 60. This person who have 3 by 60, 6 by 60 belong to which category? Chalo, the option is all in front of you. Definition is in front of you. Will you call him low vision? Will you call him economical blindness, social blindness, or manifest blindness? What will you call him? देखो, पहली बात तो ये, किसकी आंख देखोगे? मां की आंख, मतलब बेटर आई है ना. यू विल सी द बेटर आई हेयर. तो अच्छी आंख कौन है? 3 by 60 और 6 by 60? Which one is better eye? You will see the better eye. Of course, the better eye is 6 by 60. So you only have to focus on 6 by 60. 3 by 60 is useless. Now, where is 6 by 60? Whenever I ask this question, students say, sir, 6 by 60, it will go to economical. No. Economical is when it is less than 6 by 60. समझ रहे हो? जब 6 by 60 से कम होगा, तब है economical. Less than 6 by 60 economical है. Till 6 by 60, it is low vision. Remember, low vision till 6 by 60. तो ये आंसर हो गया low vision. Okay? एक और क्वेश्चन दूं? एक और दूं? हाँ, देता हूं. देखो, 1 by 60 and 3 by 60. Where the patient will go? 1 by 60, 3 by 60. Is it low vision, economical, social, manifest? क्या लिखोगे? Which eye is better? You will look at better eye. Better eye is 3 by 60. This is better eye. And where is 3 by 60? No, it's not under social blindness. Yes, 3 by 60 is economical blindness. So when I say this is economical blindness. Okay, understood or not? I hope it is clear. अगर मैं दे दूं 1 by 60 and no vision. Now which eye you will see? Of course, you will see 1 by 60. And which category it will go? Will it be social, manifest, absolute? It will be social, dear. Because manifest is when it is less than 1 by 60. Till 1 by 60 it is social blindness. Okay, so this is way in opthal PSM both they ask question from here and you can answer it. If you look at the WHO classification, it's same as India. Only one new thing is added: mild low vision. Remaining all are same. Moderate low vision is same as India low vision. Severe low vision is same as economical blindness. And social blindness is same as blindness. That's why they have asked in MCA exam already. Which is equal to blindness? Social blindness. Then it is manifest blindness and absolute blindness. Okay, the last thing. Chalo. Now, let's revise this question. 3 by 60, 6 by 60. Where the patient go? Yes, you will look at better eye 6 by 60 and till by 6 by 60 it's low vision. Okay, yes, correct. Now, there was a target vision 2020, but no one focused on it because in 2020 Corona came and everyone was busy. So at that time the target was 0.3. What is the target in 2026? The target in 2026 is 0.25% blindness. Blindness should be less than 0.25%. Okay, that means out of 1,000, out of 10,000, less than 25 should be blind, like that. Okay, less than 3 in 1,000, so I can say less than 25 in 10,000 should be blind. Okay, chalo. So to achieve this target, both India and world focus on 3 diseases: cataract, refractive error, childhood blindness, because they are everywhere. But world focus on onchocerciasis, which occur only in Africa. And because it do not occur in India, so India do not focus on onchocerciasis. We focused on diabetic retinopathy, glaucoma, and corneal opacity. Okay, so this is old program, very less likely to come, but because it's opthal PSM both, so you can read that part. Now, let's read the leprosy program. But before going to leprosy program, let me ask this question. Who is the head of I program at district level? Who will be the head of I program at district level? Will it be district collector? Will it be medical superintendent MS? Will it be chief medical officer, or will it be head of ophthalmology unit? Who will be the head of I program at district level? So very simple logic. Out of CMO, medical superintendent, opthal unit head, and district collector, who will know the least about I program? The least knowledge will be of district collector. So who will be the head? District collector. Simple logic, yaar. They will make the person with least knowledge as head, so that he cannot use the fund and he will send it back to the government, and then government can use it the way they want. So remember this point, that it's not only I program. Even in disaster management program, disaster and I program, the district level head is always district collector. Okay. Now in leprosy, first thing is, what was the criteria I discussed? Less than one case per 10,000. And according to that criteria, we have eliminated it because India has right now 0.66 case per 10,000. So when we are talking about elimination, this is the target. But when we talk about annual new case detection rate, then we measure it in lakh. Prevalence we measure in 10,000. कितना है HIV? ये 10,000 में. New case 1 लाख में. So prevalence 10,000, new case per lakh. Let me ask you two very interesting, एकदम फाड़ू क्वेश्चन पूछूंगा मैं यहां से, ऐसा कि मेरा ही नहीं बना था. जब मैंने क्वेश्चन बनाया तो मुझे ही नहीं समझ में आया. बहुत ही टफ क्वेश्चन है. इफ यू आर शेरलॉक होम लवर, यू विल लव दिस क्वेश्चन एंड यू विल डू इट. क्वेश्चन ये है कि आशा गांव में घूम घूम के लेप्रेसी का केस खोज रही है कि नहीं, ये किस इंडिकेटर से सबसे अच्छा पता चलेगा? आशा इज डिटेक्टिंग leprosy cases in the village or not? Which indicator will tell it the best? Tell it. कौन सा इंडिकेटर बेस्ट बताएगा? देखो, मान लो आशा ने खोजा 100 लेप्रेसी केस, और 100 लेप्रेसी केस गांव में खोजा, और उस 100 लेप्रेसी केस में से 95 जो थे उनको था ग्रेड 2 डिसेबिलिटी, यानी लेप्रेसी हो करके उनका पांव भी खराब हो चुका था, गल चुका था. तब जाके आशा ने खोजा. तो अगर 95% लोगों का पांव गलने के बाद खोजा है, तो क्या घंटा खोजा है आशा ने? कुछ भी नहीं खोजा है. बेकार काम कर रही है, या तो अंधी है या तो गांव में नहीं जा रही है ना. If the ASA detected 100 new cases, out of which 95% have grade 2 disability, the leg is gone, it means ASA is either not going in the village and searching case, otherwise she could have detected it early enough, or she is blind. Only two options. So how will you know ASA is working or not? By this indicator, percentage of new leprosy case with grade 2 disability. If there is more people with grade 2 disability, it means ASA is not detecting it on time. Okay. Next question is, which is not an impact indicator of leprosy program? किससे leprosy program के बारे में घंटा कुछ नहीं पता चलता है? Which tell nothing about leprosy program? Pause it and try to answer it yourself. Answer is percentage of multibacillary leprosy. देखो, multibacillary leprosy means more than or equal to 6 skin patch. We call it multibacillary leprosy. And multibacillary, paucibacillary are just stage of illness. It has nothing to do with impact of leprosy program. अगर कोई multibacillary लेकर आ रहा है, तो ये तो बस ये मतलब हुआ कि पैच 6 हैं या 6 से ज्यादा तो मल्टी है, 5 या कम तो पॉसी. इससे लेप्रेसी प्रोग्राम के बारे में कुछ नहीं पता चलता है. It's just a stage of illness, multibacillary. It do not tell anything about leprosy program. Okay, so these two confusing question has came from here. I hope you enjoyed this. Now, that's what I was discussing. कि paucibacillary and multibacillary, these are just two stage. तो मान लो आप डर्मेटोलॉजी ले लेते हो आगे चल के, और आपके पास एक मेल आता है, and the mail said कि sir, I have the complaint of leprosy. So you said कि okay, go to the chamber, remove your cloth, I will come and examine. So when you went to the room, you found that patient has removed all the cloth, but not the underwear. चड्डी नहीं खोली मरीज ने. और आप पहुंचे और आपसे पूछा मरीज ने कि डॉक्टर साहब चड्डी भी खोलना पड़ेगा क्या? Should I also have to remove underwear? You said, no, 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 let it remain. Anyway, I have seen many such thing. No unique thing for me. कौन सा तुम बुर्ज खलीफा दिखा दोगे, है ना? What special you will show? Not interested. Let it remain. So you did not remove the chaddi. And suppose in the inguinal area there were 2 more patch. So you found on the body only 4 patch. 2 were hidden. So because of your hesitation, you might wrongly classify him as paucibacillary, and now the treatment which you will give is only for 6 months. But actually he is having 6 patch, 2 here, 4 here. So actually he should get the treatment as multibacillary for 12 months. But due to your hesitation, it's less treatment which you will give. Second thing is, the follow-up which you should do is for 2 years. But in multibacillary, the follow-up is for 5 years. So now there is a risk that leprosy can also spread to the family member just because you hesitated in removing the chaddi. तो बताओ, चड्डी हटाओगे कि नहीं हटाओगे? Will you remove chaddi or not? Answer is yes, remove it. In case of female, of course, you will remove it when there is a female attendant. But with male, there is no respect. Male को कहीं नंगा कर सकते हो ना? You can remove it anywhere. So याद रखना, जिसने की शर्म उसके फूटे कर्म. If you did say, you will cause harm to the patient. So remove the chaddi and remember the classification. 6 months, 12 months, 2 year, 5 year. Now, 2 questions more. When you treat them, which drug side effect cause darkening of skin? If there is a patient of leprosy and after getting leprosy treatment, he developed dark skin or cataract-like change in lens. So, which drug is causing these 2 side effects? These 2 side effects is by which drug? Is it dapsone? Is it clofazimine? Is it rifampicin? Is it steroid? What is the answer? Answer is clofazimine. Clofazimine cause these 2 side effects. Second question which come from here is, what is the drug of choice for lepra reaction? If lepra reaction occur to any patient, the drug of choice is methylprednisolone steroid. Now the question they ask is, when you give methylprednisolone, will you stop the leprosy drug or will you continue it? So we don't stop leprosy drug, we continue multiple drug therapy and add methylprednisolone. This is the 2 questions from pharma part which they ask here. Now, next thing is, what is SPURS? You can see that SPURS is a program which try to increase awareness in the people that vitiligo is different, leprosy is different, and how to detect leprosy, and not to throw leprosy patient from the family after they got positive of leprosy. So basically, it's a program for awareness of leprosy. And who is the mascot of this? Mascot is Sapna. I will show you the logo. Maybe after we will take one break after some time, and then I will show you the logo. In that, there will be 2 ponytail, 2 choti wali Spurs ki Sapna, है ना? Sapna of Spurs program have this 2 ponytail and a school bag. You will see that this is the mascot and it has been asked. So this is Spurs. Second thing in leprosy you should know is, for disability prevention and medical rehabilitation, we give microcellular rubber footwear to the patient. This you should remember, that microcellular rubber footwear we give. But one more question has come from here is that a patient is doing foot cleaning, and this patient image which was given was filariasis patient. So filariasis patient is cleaning the foot. Is it example of disability prevention, medical rehabilitation, or is it primordial, primary, secondary, like that they ask? So remember, if they say filariasis patient foot cleaning, it is making the disability stop from increasing, because if you will not clean it, secondary bacterial infection will occur. So filariasis patient foot cleaning is disability prevention. But suppose there is a patient with diabetic foot or leprosy patient like here, and you cut the leg of the patient. So after leg amputation, you gave one prosthetic leg after leg amputation. So prosthetic leg after, of course, after leg amputation, you will give leg prosthetic, of course. So prosthetic leg after leg amputation will be example of medical rehabilitation. So this is one trick area which they can trick you. Remember, disability prevention and rehabilitation both are known as tertiary level of prevention. Both come under tertiary. But rehabilitation word का मतलब होता है कि मेकिंग पर्सन सेल्फ डिपेंडेंट, आत्मनिर्भर बनाने को कहते हैं rehabilitation. So when you will give the prosthetic leg, you will make the person self dependent. So prosthetic leg will be example of rehabilitation. But when you clean the leg, you are preventing disability, so that is disability prevention. Both are under tertiary, but they are two separate things under tertiary. I hope you will remember and you will not be confused. Okay, if there is any question, you can ask it. Thank you, Jaideep, Dharmik Patel, for smiling and enjoying. Dr. Rihana, Dr. Gaurav, Dr. Sivangi, Peaceful Warrior, Dhaval Dubey. गुरुदेव, वो 13 बच्चे जिन्होंने री नीट के करने जाने दे दी, आप कुछ कहना चाहेंगे सर उनको? नहीं, मैं कुछ नहीं कहना चाहूंगा. चलो, कम हियर. लेट्स नाउ मूव टू नेक्स्ट पॉइंट. ओके, आफ्टर लेप्रेसी प्रोग्राम, but one more thing you should know, how we diagnose leprosy. So for the diagnosis, we look at, best thing is we can take the biopsy and do Janani smear, because due to having mycolic acid in the cell wall, leprosy and TB bacteria are coming Janani smear positive. Acid do not remove their color, so we call them as acid lover bacilli, acid fast bacilli. And when we do Janani smear, they sometimes ask, what are the 3 reagents which we add in Janani smear? You can remember by the mnemonic काल. इस काल में हम तुम करें धमाल, है ना? It's like काल. So C for carbol fuscin, A for acid alcohol, and L for Loeffler's methylene blue. So we put these 3, but only leprosy and TB, due to mycolic acid, they don't get affected by acid. That's why they are acid fast bacilli. So we can do biopsy, that's the best. But if you are in tribal area, forest area, then you can look at 3 symptoms. What are the 3 symptoms for leprosy? First is there can be depigmented patch. Second thing is loss of sensation. तो मान लो आपने किसी बंदे या बंदी को छुआ और पूछा कि कुछ हुआ क्या, और बंदी ने बोला नहीं कुछ नहीं हुआ, तो हो सकता है उसको लेप्रेसी हो. If you touch someone and ask something happened and they said nothing, it means they can have by 85 by into 100. So secondary attack rate means people infected in second round. And just remember, we remove those who are infected in first round because they cannot get infected again. Okay. So this is secondary attack rate. So let's do a question on this topic because they do give numerical from here. Question is, there is a family of 2 parents and 6 children. But remember, whenever they give parent or adult, parent, we consider them as immunized for measles. So to do this question simply, just forget about parent. Just ignore them and you can do it easily. This is a hint without which you will do wrong. So total there are 6 children. One child is immunized. One developed measles from village fair. खेला, गांव के मेला में गया था, मेला में हो गया खेला, एक बच्चा इन्फेक्टेड हो गया, घर आया 3 और को इन्फेक्ट कर दिया. तो सेकेंडरी अटैक रेट क्या होगा पूछा जा रहा है. one child got infected in measles in village fair and 3 got infected in second round. So what is secondary attack rate? Pause the video and please found it, calculate it yourself, please, one time. Okay, so how many are infected in second round? 3 people. How many were total children? 6. Out of the 6, how many are immunized? One child was immunized. Immunized 1. है ना? One child, 6. One child was immunized. And how many got infected in first round? One child got first infected, then 3 more got infected. So this one child infected in first round. I hope you remember the formula of secondary attack rate. Secondary attack rate simply means how many got infected in second round divided by population minus immunized minus those who are infected in first round. So 6 minus 1 minus 1. And we multiply it with 100 to get the answer in percentage. So how much will come? 3 by 4 into 100. And 3 by 4 into 100 is 75%. So the secondary attack rate is 75%. Okay? Don't include parent and calculation will become easy. Simple. Chalo. So secondary attack rate means people who are infected within one incubation period. देखो, पहले एक बच्चा इन्फेक्टेड हुआ, फिर अगले 10 से 14 दिन अगले एक इंक्यूबेशन पीरियड में 3 लोग और इन्फेक्टेड हुए. तो जो 3 लोग इन्फेक्टेड हुए हैं वो एक इंक्यूबेशन पीरियड के अंदर हुए हैं ना, तो इसलिए जो लोग एक इंक्यूबेशन पीरियड में इन्फेक्टेड होते हैं उनको सेकेंडरी अटैक रेट कहते हैं. What I'm trying to say in Hindi is that one child got infected and then within next incubation period 3 more got infected. So those 3 who got infected, they are infected within one incubation period of 10 to 14 days. So they are secondary attack rate, but they are infected within one incubation period. So secondary attack rate are those who are infected in one incubation period. I hope you understood and remember. Within one incubation period, don't write primary. It is within one incubation means from primary case, more people are getting infected. So they always be secondary attack rate. Chalo, now, what is median incubation period? So suppose let's say Nikhil sneezed on me and I develop cough and cold in 2 days. So incubation period, entry of pathogen and first symptom was 2 days. In 2 days I started coughing. And then I am living with a family where 10 people are living together. So suppose after next 2 more days, that means in 4 days, 5 out of 10 member got cough and cold, got infected. यानी हो क्या रहा है, पहले 2 दिन में मेरे अंदर सर्दी खांसी के लक्षण आए तो इंक्यूबेशन पीरियड 2 दिन है. अब 2 दिन और बीता और घर में आधे लोगों को इन्फेक्शन आ गया. तो आधे लोगों में लक्षण आने का जो टाइम होता है उसको मीडियन इंक्यूबेशन पीरियड कहते हैं. द टाइम ऑफ अपीयरेंस ऑफ सिम्टम इन हाफ ऑफ द पॉपुलेशन, this is known as median incubation period. So median incubation period will be 4 days. In 4 days, 5 out of 10 people will get infected. सीधी सी बात. Now, what is generation time being asked 3 times in PYQ? Generation time means entry and appearance of maximum infectivity. तो generally it is found कि जैसे 4 दिन होते होते आधे लोगों में बीमारी फैल गई थी, वैसे ही 4 दिन होते होते जो पहला बंदा है वो इतना इन्फेक्टेड हो चुका है कि एक बार छींकेगा तो 10 लोगों में फैला देगा. तो जितने पहले 2 दिन में लक्षण आए, 2 दिन और लगे और मैं मैक्सिमम इन्फेक्टिव हो गया, इसी को कहते हैं जनरेशन टाइम. तो जनरेशन टाइम भी कितना हुआ, लगभग 4 दिन. व्हाट आई वाज सेइंग इन हिंदी इज in first 2 days I develop symptom. Suppose in next 2 days my infection keep on increasing and I became so infective that with one sneeze I can infect 10 people. So that is generation time. Generation time is entry and maximum infectivity. This is generation time. So you can see roughly generation time is equal to median incubation period. जितने देर में आधे लोगों को लक्षण आते हैं उतने ही दिन में पहला बंदा मैक्सिमम इंफेक्शन फैलाने लग जाता है. By the time half people develop symptom, median incubation period, the first person become maximum infective, that is generation time. So they are mostly the same. Okay. Now, what is serial interval? देखो हम लोग इतनी देर से बात कर रहे हैं एंट्री और फर्स्ट सिम्टम इंक्यूबेशन, एंट्री हाफ पॉपुलेशन सिम्टम मीडियन इंक्यूबेशन, एंट्री मैक्सिमम इन्फेक्टिविटी जनरेशन टाइम. But is there any method by which we know entry time? We can never know the entry time. So what does it mean? All this definition are in air? No, there is one logic here. Suppose Nikhil sneezed on me, I develop cough and cold in 2 days. I sneezed on my wife, she developed it in 2 days. My wife sneezed in on mother, my mother also developed cough and cold in 2 days. So everyone is developing it in 2 days. It means the pathogen entry in me also must have happened 2 days back. अगर हर कोई 2-2 दिन में इन्फेक्शन फैला रहा है कफ कोल्ड का, तो यानी पहले बंदे में भी हम रफली इससे अंदाजा लगा सकते हैं कि 2 दिन पहले कीड़ा घुसा होगा. तो यानी ये जो एक से दूसरे में फैलने का टाइम है, इसको कहते हैं सीरियल इंटरवल. और सीरियल इंटरवल के हेल्प से हम लोग इंक्यूबेशन पीरियड का अंदाजा लगा सकते हैं. द टाइम पीरियड बिटवीन स्प्रेड ऑफ इंफेक्शन फ्रॉम वन पर्सन टू अनदर इज सीरियल इंटरवल. And if everyone is spreading in 2 days, we can estimate from here that pathogen must have entered 2 days back in the first person also. So with the help of serial interval, we can find incubation period. Okay. So I hope you understood it. Let me explain it with a very simple diagram. Suppose this is the point. This is the point when the pathogen entered. Okay. And after entry, first case occur. Then in the family, I infected more people. So entry, and suppose here it's first symptom. So this period is incubation period. And then time of passes from one person to another. This time when I pass it from one to another is serial interval. Okay. Now, by the time I will infect half population, this is the population suppose. So by the time I infect half population, this is median incubation period. By this time, the first person will become maximum infective. So median incubation period is equal to generation time. Half population get infected in the same time when first person become maximum infective. Do remember what is generation time? Gap between entry and maximum infectivity. Multiple time asked question. Okay. So I hope this concept is clear. Now let's talk about diphtheria. In diphtheria, remember this point that when they talk about contact of diphtheria, how to manage contact of diphtheria, they ask. So if any contact of diphtheria case came, patient was there and he or she was living with the patient. So you ask the history. When do you take last diphtheria toxoid? If last diphtheria toxoid taken in 5 years, then we do nothing because already you are immunized, you need not to worry. But if large diphtheria toxoid taken more than 5 years back, if it is taken more than 5 years back, then we need to give diphtheria toxoid here. So we give diphtheria toxoid for immunity. This is the same thing for tetanus. In tetanus also, if it is less than 5 years, even if it is a dirty wound, theory say we only wash it. We don't give tetanus if last 5 years you have taken tetanus. So in surgery, they will tell road traffic injury, give tetanus to everyone. This is the practical knowledge. But in exam, you have to write for tetanus also, in last 5 years, if taken tetanus, no need to do any other thing. And if tetanus was taken more than 5 years, then for clean wound, we give one tetanus toxoid. But suppose someone came bhoola, forgotten history, or unvaccinated person. So if there is forgotten history, then we will give diphtheria toxoid in this patient also. But along with diphtheria toxoid, we can prophylactically also give antibiotic because now he can develop the disease. So prophylactically we can give antibiotic. So this is how we manage contact of diphtheria. Now let's come to the case. The case is this 5-year-old child infected with diphtheria. This is a case of diphtheria. And always remember, case are always managed by toxoid and antibiotic. Toxoid and antibiotic, we always give both the thing in case. And which antibiotic we give? If it is children, in children, antibiotic of choice is azithromycin. And the good news is the same thing is also true for pertussis. So whether it's diphtheria or pertussis, the drug of choice for children is azithromycin, and drug of choice for adult is erythromycin. This question has already been asked in MCI exam, NEET exam 2023, that if there is a child who is having pertussis, what is the drug of choice for pertussis in children? Azithromycin. So in non-communicable disease, whose waist circumference is bigger? Male will have bigger waist circumference or female will have bigger waist circumference? Tell me. The waist circumference, which is measured around umbilicus, is definitely bigger in male. In male, if waist circumference is more than 102 centimeter, or if female it is more than 88 centimeter, then we call it as obesity. Okay, so the difference is of 14 centimeter, 14 centimeter bada hai male ka waist circumference. Okay, but still some class students say it's female waist circumference is bigger. You have forgotten all the song written on thin waist of female. In every language there is song on thin waist of female. But have you heard wah kya jawa mard hai kya patli kamar? Have you heard thin waist of male and any song on that? No. So waist thin, female thicker, male. Now if they ask waist to hip ratio, waist to hip means you are comparing waist circumference with hip circumference. It will be bigger in male or female? Again, group mein message dal do. Again, waist to hip ratio is also bigger in male. And actually, hip circumference is further bigger in female. So this ratio become much less in female. So remember, they ask waist to hip ratio question. If it is more than 1 in male or more than 0.85 in female, then we call it as obesity. So do remember, for obesity, waist to hip ratio is more than 0.85 in female. This they ask again and again. What is the waist to hip ratio of waist to hip circumference ratio in female for obesity? More than 0.85. Then chamdi kiski moti hai? Kamar, whenever they ask question on waist, remember me, male with big waist to hip. But who have bigger skin fold thickness, male or female? No, this time don't remember me or you will think male with hippopotamus skin. This time skin fold thickness is thicker in female. Okay, why? Because female have subcutaneous layer of fat below their skin. That's why female skin is so soft to touch. So how we measured female skin fold thickness? By her pendant caliper. So see, in the caliper also it's her pendant caliper. And what is the best site to measure skin fold thickness? The best site to measure it is triceps. Then we can also measure it as biceps. We can also measure it at anterior superior iliac spine and subscapular area. And then we take average of all four. So if average of all four you have taken and the average of four site is more than 40 mm. If it is more than 40 mm in male or more than 50 mm in female, then we call it as obesity. तो मेल का कितना बड़ा है? इस बार मेल का बड़ा नहीं है, मेल का छोटा है. Female skin fold thickness is bigger by 10 mm. 50 mm for female, 40 mm for male. And mainly they ask which side skin fold thickness not measured. So it is measured at triceps, biceps, ASIS, subscapular area. Rest place it is not measured. Okay. Now let's go to the biostat part. And in the biostat part, first thing is how to do any study. P-value, alpha, beta error question when they ask. So first thing is, before starting any study, we give null hypothesis. And in null hypothesis, the researchers say that new study, new drug is not significantly different than previous drug. Okay, suppose you have found a new weight lowering drug. So in the beginning, you will say my new drug is not different. It is same as old drug, Orlistat. Okay, so this is null hypothesis. But as a researcher, we usually want to reject null hypothesis. It's like, suppose a boy proposed to a girl, and when he proposed to the girl said, I have not seen you from that angle. So what you are not significantly different than my other friend. So what the girl gave to the boy? Null hypothesis. Now will the boy will accept it, or will he want to reject it and show the different angle? Definitely the boy will try to reject it. So similarly, researcher give null hypothesis, but they want to reject it and show that the drug is different. So first they give null hypothesis, then they do the study with the purpose to prove that study is good, and null hypothesis they will reject. So very, very simple thing. Null hypothesis means in the beginning researchers say my drug is null, is lull, is useless. This is the null hypothesis. Then they decide the mistake which will be done in the study. And every study or every exam and every life will have some mistake. And mistakes of a study is of two types: alpha error, beta error. When we say alpha error means false positive. And when we say beta error means false negative. So if in your batch also there must be some boy who think that every girl just see me and fall down and all, है ना, मैं इतनी सुंदर हूँ, मैं क्या करूँ, I am the most beautiful, most intelligent. They are the one who are overestimating themselves. They are doing alpha error. And if some boy or girl in your batch say that no one loves me, कोई मुझे प्यार नहीं करता, no one listen to me, they are underestimating themselves. That is beta error. Let's see the clinical part. In alpha error, so what we do, we say useless thing as useful, saying non-significant as significant. For example, a very good example of this thing is coronal drug trial done by researcher of Baba Ramdev. In coronal drug trial, they have written that most of the participants were asymptomatic without any fever. So patient don't have fever. But in the end of corona trial, they said ki hence prove that coronal treat corona fever. So if nobody had fever, how can it treat corona fever? Of course, they are telling lie. They are doing alpha error. They are saying non-significant coronal drug as significant. So this is alpha error. Okay. And do remember, alpha error is almost same as p-value. So we have to understand this alpha error very well. It is false positive. Like one more good way of remembering alpha error is we say alpha error as p-value, and alpha error p-value both means rejecting null hypothesis even when null hypothesis is true. Even when null hypothesis is true, you have rejected it. So this is one line which they ask again and again, and let me explain it. Suppose someone from your batch came right now to me and he or she want to have a party. So they put a stethoscope on my stomach and I produced a gur 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 sound, and the student said, congratulations, you are pregnant to me. Mark kasam, I am not pregnant. So in my case, in my abdomen, there is nothing significant. Null hypothesis is true. My abdomen is null. There is no pregnancy. But still you came and you rejected null hypothesis and you forcefully said that I am pregnant. So that is alpha error, because you are giving which type of report for my pregnancy? You are giving false positive report. You are saying my non-significant abdomen as significant. So you can remember p-value alpha error with coronal trial, and you can remember it with pregnancy in the teacher also. Two example, and it will always be with you. Now beta error is just opposite. It means underestimation. And a false negative. It means if you have found some significant drug, but still you say it non-significant. Saying significant as non-significant, this is beta error. For example, suppose you found a new drug and you started the trial, but people who are under your trial, after taking your new anti-obesity drug, they started eating more. This case happened with my mother. She started getting Monjorno injection for weight loss and she started eating more. So the same Mongiorno injection for weight loss brought weight loss in my elder sister, but not in my mother, because my mother was not doing any dieting with that weight loss injection. So in her, the result came non-significant, but actually that weight loss injection was doing some effect, it was significant. So whenever you underestimate the drug, then you do beta error. Overestimate false positive alpha error. इसको ऐसे समझ सकते हो, चालू बनना, बेकार की चीज को काम का बोलना, that is alpha error. Whenever you try to act chalu over smart and say useless thing as useful, that is alpha error. And chalu का उल्टा बेवकूफ बनना is beta error. When you say a useful thing as useless, then you underestimate that thing, and that is beta error. Is alpha beta error coming clear to you? Or is there any confusion? I hope it is clear. Now, after deciding alpha beta error, we conduct our study, which can be RCT, cohort case control. And after conducting this study, we get some data. On that data, we applied paired, unpaired, chi-square, different type of test. And finally, we don't apply the test, computer apply the test. We just give command ki on this situation give chi-square test, on this situation apply paired, unpaired. And finally, the result which comes, it comes in terms of p-value, confidence interval, mean relative risk. And based on these 3-4 things, we decide in the final step whether our study was significant or not. So that means on the basis of p-value, confidence interval, we decide a study as significant. So we have to understand what is this p-value. p-value का सीधा मतलब है तुक्के से सही. Significant by chance is p-value. So significant by chance is p-value. For understanding this, let's take a very simple example. On our day of counseling in 1st of August 2006, when my weight was 54 kg, I found that a very good girl, Monica, is looking at me only. And all the butterflies started coming out, and I was very happy the whole day. But in the evening, when I tell it to my room partner, Rahul and Neeraj, they both said, ki, no, Monica was looking at us. You were wrong. And actually on that day, Monica was not looking at any one of us. It was just her look by chance, which we were taking significant, and our butterfly was coming out. So on that day, we were doing some mistake na, some error na. गलती से आई नजर को आपने दिल फरेब समझ लिया और दिल दे बैठे, है ना? A look which came just by chance, you took it significant. So it means you are doing some mistake. And that means p-value is a mistake, is an error. And any error should be minimum. Only then we can trust on the study. Like you are going to give MCA exam, your error should be minimum, na? So if p-value is less than or equal to 5%, p-value is less than or equal to 0.05, then we say that study is significant. And if study is significant, it means null hypothesis is wrong. Because null hypothesis is saying study is useless. Finally, we get study significant. So if a study came significant, we reject null hypothesis. Okay? So remember this point. Whenever you got p-value less than or equal to 0.05, then the result is significant, and result significant means reject null hypothesis. Okay? One more thing I wanted to tell you is that as I was saying, p-value is equal to alpha error. So p-value alpha error both means false positive. Both means false positive. And let me explain this thing. On that counseling day, I was getting a positive signal from Monica. But which type of positive signal was that? It was false positive signal. Her look was non-significant, and I was thinking it as significant. And that is same thing as coronal drug. Coronal drug was non-significant, but researchers said it can treat corona fever, it is significant. So alpha error p-value, they both are the same thing. Like for example, when you came and made me pregnant, by chance, by accident, you got significant result for my pregnancy, but it was by chance. So you gave false positive report for my pregnancy. So that means alpha error p-value both are same. Both means rejecting null hypothesis even when null hypothesis is true. Okay. Now let's do 2-3 questions on this topic. One question is, if p-value is 0.023 or 2.3%, then which is correct? Okay. If p-value is 0.023, which of the 4 is correct? Pause the video, first found the answer and then give me the answer. So the one thing is clear, p-value is less than 0.05. 0.03 means less than 0.05. So mistake is so less, p-value is so less, that definitely we will say study is significant. And if study is significant, what we do with null hypothesis? We reject null hypothesis. So correct option is option B. Now suppose if I change the question and I gave p-value as equal to 0.23 this time. 0.23 means this time the mistake is 23%. So if the mistake is 23%, definitely the study is non-significant. Study is non-significant. And if study is non-significant, what we do with null hypothesis? Null hypothesis is also saying that a study is null, useless, and our result also came it is null. So what we do now? Now we will accept null hypothesis. So if p-value is more than 0.05, study is non-significant, we accept null hypothesis. Less than, then we reject null hypothesis and study is significant. So I hope this concept is clear. If not, feel free to put it in the group and ask it. Chalo. Now, next question is, in a study, p-value is 0.05, but in reality, the drug is not significantly different than the previous drug. So which error is done in the study? समझो इस बात को. First thing is, p-value is coming 0.05. It means p-value is less than 5% or mistake is less than 5%. So the scientist is saying कि my drug is significant. Researchers say drug is significant. So researcher is saying drug is significant. But in reality, drug is not significant. हो क्या रहा है? जबरदस्ती रिसर्चर कह रहा है कि मेरी दवा काम की है, जबकि एक्चुअली में दवा काम की नहीं है. Researcher is forcefully saying that my drug is significant when in reality it is not significant. So which error is happening here? This is the same story as coronal drug trial. And when the coronal researcher are saying that it can treat corona fever, but actually it was done on people without fever. So it can never prove that it can treat fever. So it was example of alpha error, type 1 error. This is type 1 error, alpha error is happening here. Let me explain it again. You came and auscultated my abdomen and said the abdomen is significant. So you are the researcher, the doctor. You said abdomen is significant. But in reality, I am not pregnant. In reality, there is nothing. So which error you are doing? You are giving false positive report for my pregnancy. And you are doing alpha error. The same thing is happening here. Alpha error simply means when you say non-significant drug as significant. Drug was not significant, but you forcefully said as significant. So that is alpha error. And alpha error is type 1 error, but there is two things you have to know. Confidence of study is 1 minus alpha error. And power of study is 1 minus beta error. Let me explain this thing. आपको आपके दोस्त पर कितना कॉन्फिडेंस है, कितना भरोसा है? क्या आपका दोस्त भरोसे वाला है या भरोसे वाला नहीं है? ये डिपेंड करता है कि आपका दोस्त फेंकता कितना है. How much confidence you have on your friend, it depends how much lie your friends say. If your friends say too much lie, alpha error is high, then the confidence will be less. Like can you have confidence on coronal drug trial? No, because alpha error was too high in that. Now, the second thing is power. Power is 1 minus beta error. So, if I ask you that when you will give NEET PG exam, can you come in top 5% student? Answer is yes, you all can come in top 5% student because we all have equal memory. Memory is not the problem. How? How we all have equal memory? Because all of us can remember still the movie which we saw in the childhood. 10-15 year back movie which we have seen, we still remember. So our memory is good. Only thing that differ is our interest in study and our confidence on ourselves. So when I ask, can you come in 5%? Only let's say 20% student raise hand. Yes, we can come in top 5% when we will give NEET PG. So those 20% who raise hand, they decrease their beta error. They are not underestimating themselves. And because their beta error is less, so now they are powerful. Power means ability to say significant as significant. And you all are significant. But who can call themselves as significant? Who decrease their underestimation, who decrease their beta error, power will increase. Okay. So if you want to increase both power and confidence, How can you increase it both? By increasing sample size and by increasing association, you can increase both power and confidence. Let me explain this thing to you. If suppose you found a new anti-obesity drug and you give it to 10,000 people, and all 10,000 people in 1 month they become slim. So 10,000 people had become slim. Your sample size is too big. You can have confidence on this drug. And all of them lose weight in 1 month. So the association is also very strong. Then you can say this drug is useful. The power and confidence on this drug will be high. Okay. So both power and confidence can be high if sample size and association is high. Now this p-value topic is finished, but I still want to ask you one question, which has came in one of the recent INSCT exam also, and it can come repeat in your exam. If p-value is equal to 0.03, what does it means? What does p-value 0.03 mean? Option A, does it mean result significant 3% and non-significant 97% time? Or does it mean result significant 97% and non-significant 3% time? Or does it mean result significant by chance 3%? Or does it mean both A and C? What does p-value 0.03 mean? They can ask the meaning of p-value. And to understand the meaning of p-value, let's understand it with a simple story. In your batch, there must be some boy or girl who have this divine power that when they see some couple, they can guess the future of the couple. And there must be some boy or girl in your friend group like that. So to prove it, they went to the park. This girl, suppose who have the divine power, she went in the park, and in the park there was a couple sitting. She looked at the couple and said 5 minutes, and just at 4 minutes the girl slapped the boy and they break up. So her first couple guess is correct. First guess correct. Now if only one guess is correct, do you think this girl has really some divine power, or do you think her one guess is just correct, so it is correct by chance? What do you think? Does she came significant by chance, or does she have really some power? It's one guess correct, so it's 50-50% chance. 50% she is really significant, 50% tukke se aa gaya, significant by chance, and 50% means 0.5. So one guess correct, you are not trusting on the power. So she went again in the park and saw a second couple, and this time said 2 minutes. And just in 1.5 minutes, that second couple also had a fight and they broke up. So 2 couple guess correct. Now do you think it is really significant? Really significant is increasing. And significant by chance, this decreased to 25% or 0.25. But still, many of you don't trust. So this time she guessed about herself, that we will be good friend, we will be couple till our PG entrance, and as soon as PG will be cleared, I will be different, you will be different, we will have breakup. And exactly like that, on the day of result, their breakup happened. So her 3 guess correct. Now her really significant is increasing, and significant by chance decreased to 0.125. But still some of you do not trust. So she made a 4th guess about me, that this fatty look like an idiot. Idiot people, they last long in relationship. Anyway, we should say good thing about ourselves. So he will have breakup at 80 years, they will die together like that. And her 4 guess is also correct. So if 4 guess correct, now her probability that she is really significant has increased a lot, and significant by chance is decreasing. But still, to make you believe again, she next time again went to the class, and in the class there was a couple sitting in library, and he said 20 minutes, and after 15 minutes they had fight and broke up. So again and again her guess is coming correct. If someone is giving so much correct answer, then you will trust ki, okay, now this lady must have divine power because she is correct again and again. So this part, significant by chance, is p-value. P-value has nothing to do with how much is really significant. But you can understand, if suppose your anti-obesity drug I took and in 1 month I become slim like Disha Patani, Nikhil took and in 1 month he also become Noora Fatehi, and my brother Golu take and he also become in 1 month Tamanna Bhatia, and everyone is losing weight in 1 month quickly, again and again they are becoming slim, then you can have faith that this anti-obesity drug is really working. So similarly, scientists also thought that if some drug is coming correct again and again, then between 0.6, 0.3 at 0.05, we can say that yes, now the drug is significant, because significant by chance is very less and really significant is very high. So remember, when p-value is less, p-value is a mistake. When p-value is less, it means result is more and more significant. But p-value only talk about how much it is significant by chance. So what is correct answer out of this? If p-value is 0.03, it only means one thing, that result is significant by chance 3%. P-value do not tell how much it is significant, non-significant. P-value only tell how much it is significant by chance. And is significant by chance 3% if it is p-value is 3%. Okay, so I hope this p-value concept is clear. Now let's learn this very important concept of quantitative and qualitative data. For example, why this concept is so important? Because if the data is qualitative, we will apply chi-square test on it directly. So if you know qualitative, you can directly apply chi-square test. And if it is quantitative, then we can apply paired, unpaired ANOVA. So one reason for the test we should know it, and in every exam they are asking question from the test. Second, sometimes they directly ask this data is quantitative, qualitative. Like for cholesterol they have asked quantitative, qualitative. So whatever we can continuously measure without any gap, that is quantitative. And of course, you know, cholesterol we can measure. So cholesterol is quantitative. But if I talk about hyperlipidemia, the disease. So hyperlipidemia is just a category. Hyperlipidemia present or absent, it is just category. So that's why all the data, whenever we talk about any disease, every disease is qualitative, because disease are only in category, and the factor which we measure in the disease, they are quantitative. For example, if I say hypertension, what is hypertension? Quantitative, qualitative? You will say, sir, I can measure hypertension. No. What you measure is BP. BP is quantitative, continuous. But hypertension is always mild, moderate, severe, or hypertension present, absent. So hypertension is quantitative. Like if I ask about obesity, you can say, sir, you are mild obese, moderate obese, but you cannot say that, sir, you are 6.9 obese. You cannot measure obesity. What you measure is weight and BMI. What you don't measure is disease like obesity, hypertension, diabetes, anemia. These all are qualitative. So in any question, if we are comparing the disease, we will apply chi-square test. And how we get the disease data? If we talk about disease, then in disease we use the term median or mode. Like median or mode we use here. Second, if I am talking about anemia in the class, I can say 10% of the student have anemia. So when I say anemia, I use the word percentage proportion. So in any question, if you found the word percentage proportion, median mode, you will apply chi-square test because they will be qualitative data. But when I say 10% student have anemia, I can say. But when I am measuring hemoglobin, I can say mean hemoglobin, average hemoglobin of the class is 12. So when I use continuous data, I use mean or average. So mean is used for quantitative, median mode for qualitative, percentage proportion for qualitative, disease is qualitative, and the parameter in the disease is quantitative. I hope you will remember it. Now, This is what is written here, all the thing which I discussed. But one more thing you have to know is that when we talk about qualitative data like all the disease like diabetes, anemia, all of these are qualitative. They will be either nominal or ordinal. Two things. Nominal means name, no order. Like when I talk about sex, you can say done it, not done it, or you can say transgender, male, female, but there is no order between them. They are just three different names. Similarly, religion, blood group, you cannot arrange them into group. You cannot say that A plus is more stronger than B plus blood group. They are just name. So if they are just name, no order, we call it nominal. And what is ordinal? Ordinal means you will arrange them in order. So remember, this question come again and again. Every score, every scale, all scale are ordinal. This is the most important PYQ. They will keep asking question in exam from this point. They will ask Glasgow comma scale is an example of, APGAR score is an example of, child pug criteria is an example of, Kuppuswamy scale is an example of. Any scale, any score, they all are ordinal. Okay. So nominal, ordinal is for qualitative. But when it comes to quantitative, here we use interval or ratio. Remember this thing, ratio have true zero. That means when we talk about ratio are absent at zero. For example, suppose you are measuring blood pressure, your senior asked to measure blood pressure of a patient in emergency. You measure BP and you said, sir, BP is 0. What does it mean? It means patient flied away. And BP cannot be at 0. BP is absent at 0. BP 0 is true. Similarly, can anyone have true 0 weight, 0 height? No, 0 figure? Not a chance. 0 figure is not possible. There must be some figure. So ratio have true 0. Interval are those variables that exist at 0. And only example of interval is temperature. Temperature which we measure in degree Celsius or Fahrenheit. Many of you must have felt 0 degree Celsius in your life. So at 0 degree Celsius, temperature is still there or temperature is gone? Temperature is still there, na? So temperature 0 is not real 0 because at 0 also temperature is there. So temperature is example of interval, rest all are example of ratio. How will you remember it? देखो, हमारे को जिंदगी में कोरोना के अलावा जो भी बड़ी छुट्टी मिली है वो समर या विंटर वैकेशन था. तो हमारे जिंदगी की छुट्टियां इंटरवल किसने दी है? टेम्परेचर ने दी है. All the major interval of our life except corona was winter or summer vacation. So who gave us interval of our life? Temperature gave us interval of our life. So temperature example is interval, and temperature is one thing which exists at 0. So the interval 0 is not true 0. Okay. So this is about quantitative and qualitative data. I hope it is clear. Now, when you know quantitative, qualitative data well, then you can decide which test to apply. We will discuss Kuppuswamy scale, but first discuss this point because in every exam they are asking a question from here. Remember, in any question, if they use qualitative data means if they use any disease name, if they use percentage, if they use median, if they use proportion, if they use any of these things in any question, disease comparison, proportion, percentage, it's qualitative data. And in qualitative, we apply chi-square test, which can also be written as like this chi-square, chi-square. This test we apply if there is 2 group or more than 2 group. But generally for 2 group, we apply chi-square. Some exception can be there. Now, if the data is quantitative, quantitative means something which we can measure, like BP, height, weight. And in the question, they have written the word pre and post data, before and after data, or match data. If you found these words in the question, then you definitely apply paired t-test. और paired t-test का ही दूसरा नाम है dependent t-test. Let me explain it to you. Suppose your new anti-obesity drug which you have found, you are giving 200 people and you are giving old anti-obesity drug orlistat to another 100 people, and you are measuring weight of every 100 people before giving drug also, after giving drug also. So both before giving drug, after giving drug data, they are coming from the same person, na? So this before and after data, these are for the same person, they are paired, they are dependent on the same person. So which test you will apply, paired or dependent test? So whenever in the question you find pre, post, before, after, apply pair t-test. And what do you mean by match data? Match data matlab same data dono side lena. For example, if you are giving your anti-obesity drug to a 40-year male, so old anti-obesity drug is also to 40-year male. If both side has 40-year male, then this data is match data. And if the data is match, pre, post, before, after, we apply pair t-test or dependent t-test. Okay. But if suppose you are not collecting data before, after, you are just measuring the weight after 3 months of treatment, not before, after. So now the data become independent. The two group are independent because weight is not coming before, after from the same person. So now they are independent, and which test we apply? Independent t-test. The other name of independent t-test is unpaired t-test, because now the two group is unpaired. And one more name of unpaired t-test is student t-test. So student t-test, independent t-test, unpaired t-test, we apply this test when there is two group of quantitative data and pre, post, before, after data is not taken. Then we call it independent. And if there is 3 or more group, we apply ANOVA. For example, a full form of ANOVA is analysis of variance. For example, if let's say you are giving anti-obesity drug, new anti-obesity drug to 100 people, old anti-obesity drug orlistat to 100, and 100 people are just doing lifestyle modification. And in all the 3 group, you are measuring the weight after giving medicine, after only, not before, after. So 3 group and only after, and weight is compared, you can apply ANOVA here. So this simple way can help you in decide which test to apply. Let's do some question to make it more clear. And the simple way is qualitative chi-square. Pre, post, before, after match written, paired. 2 group and data only after, unpaired. 3 group and data only after, ANOVA. Like this we can decide easily. Let's have this question which came in MCI exam already. The question was, we are comparing effect of doing yoga on percentage of infection. If JR, SR, intern all will do yoga, in which group percentage of infection will be less? Okay. So remember, in this condition, which test you apply, that's what they are asking. So first thing is, whatever they write after on, this is the thing which we are comparing. This is the outcome variable which we are comparing. So what we are comparing? We are comparing percentage of infection. Now tell me one thing, infection is quantitative or qualitative? Can you measure infection? Can you say that this patient is 2.8 infected? No, never. We cannot measure infection. We can only categorize infection into mild infection, moderate infection, severe infection. So infection is just categorical data. Infection is just qualitative. And if the data is qualitative, which test you will apply out of the 4? Chi-square test, because rest all 3 are for quantitative. Second way to understand is that they have used the word percentage, and I told you percentage, proportion, median, mode, it means the data is qualitative chi-square. Third hint was they have given a bar diagram, and bar chart is also used for qualitative data. So it's definitely qualitative data, and for qualitative data out of 4 we only apply chi-square test. So the answer is chi-square test. Okay. Now, if I am asking effect of yoga on CRP level of JRSR, CRP is inflammatory marker, C-reactive protein, we can measure it. And we are measuring it on 2 group GRSR. So which test you will apply? 2 group, and pre, post, before, after not written. Only 2 group. Which test? Yes, unpaired t-test. Why not ANOVA? Because ANOVA we apply when there is 3 group, and here it is 2 group. Now if they write Effect of yoga on CRP level of JRSR in turn. Now there is 3 group. Now we can apply ANOVA. And if they write effect of yoga on CRP level before and after yoga, before and afterward they used, then you will apply pair T test. Okay. So this is the way to decide between the test, and they asking question from this topic again and again. I hope you will not be wrong. If you need more question on this topic, feel free to ask it in the chat box. We can create more question also on this topic. Okay. Chalo. Now, let's move ahead. And this sometime in the option they write Fisher exact test and jet test also. It's not some important thing to read. They are just in the option, but they are never the answer. So in the exam, if they give these options, they will never be correct because they depend on sample size. Okay. So we need not to go into it before exam time. This is not so important part. Main part was how to decide between those. And one more thing they can ask is from the Kuppuswamy scale. See, remember this thing that all score are ordinal. So there is one more thing, Likert scale. Likert means whenever we want to measure attitude of anyone. Suppose I want to know what is your attitude towards using condom. So some can say that condom is a very good thing. If they have not doing sex, they will say very good thing. Some will say it's good thing. Some will say okay. There is some merit, some demerit. Some will say it's a bad thing, it decreases the pleasure. Some will say very bad thing, I am unable to use it and all. So the 5 graded response, wherever you have 5 graded response for any attitude, this is Likert scale. And when we talk about Kuppuswamy scale or any socioeconomic scale is also always 5 graded. It's lower, middle, upper class. So all socioeconomic scale is also example of Likert scale because it's 5 graded response. Gradually we are becoming poor, or we are getting richer gradually from lower to upper. So when it is graded response, it's Likert scale. Now, in urban area, we use Kuppuswamy scale. In rural area, we use Parikh and BG Prasad. Because the questions which we ask in urban area and rural is different, so the scale is also different. So what are the questions which you ask in Kuppuswamy scale? First question we ask is how many family member is here? So suppose you came to my family, there is 10 member. Then you ask who is the head of household? My mother is the head of household, father is no more, but even when father was there, we can clearly see that my mother was the head of household. So then you will ask, what do you do to my mother? What is the occupation of head of household? What she does? And my mother is a homemaker. So for homemaker, you will give some imaginary number. Imaginary because this number you need not to remember and it's keep on changing. So for homemaker, we give one number, suppose. Then you will ask what is the education of head of household, up to which class you have studied. So my mother is 12th pass. So for 12th pass, you give some number, suppose 4 number. Then after asking occupation, education from my mother, the third question you will ask is, from the whole family, what is the total monthly family income? So if you ask total monthly family income for our family, suppose it came 12 lakh per month. So if it is coming 12 lakh per month, for this also you give some point, suppose you give 17 point. So this is the 3 question we ask: occupation, education, total monthly income. And if you add the total score, 17 plus 1, 18 plus 4, 22 is the total score which we are getting. So if our total score is between 1 to 5, we will be lower class. If our total score is between 6 to 10, we will be lower middle. If our total score is between 11 to 15, we will be middle. If it is between 16 to 24, we will be upper middle class. And if it is more than 25, we are upper class. So in spite of earning 12 lakh per month, still we are only in upper middle class, because upper middle has longest category of 9 digit. Okay, so most of us belong to upper middle. If your father, mother, the head of household is not some scientist, professor, doctor, engineer, then you mostly belong to upper middle. Now, The question which they asked from here is, the question was, which is not asked in Kuppuswamy scale? Which of the following we don't ask in Kuppuswamy scale? Do we don't ask per capita income, income of head of household, education, occupation? What we don't ask? So one thing is sure, we never ask income of head of household. You never ask how much the head of household earn, because usually they don't earn. And it doesn't matter, like my mother is not earning, but we are earning, so it doesn't matter, we don't ask it. Now some student asks, sir, where did we ask per capita income? You ask it indirectly. Per capita income means what is the total monthly family income, and this total monthly family income we divide by family member. It come per capita income. So you already have asked that I had how many family member in the family? 10. And how many family income? 12 lakh per month. So for our family, it will be 1.2 lakh per person per month, our per capita income. Okay. So per capita we ask indirectly, but income of head of household we never ask. So this is Kuppuswamy scale for urban area. Rural we apply BG, Prasad and Parikh scale, which we did not to know detail, because there is a lot of 9-10 question which we ask in BG, Prasad, Parikh. Okay. Now let's come to the next part, measure of central tendency. डेटा के बीच में क्या है ये पता लगाने के लिए मीन मीडियन मोड यूज करते हैं, है ना. टू फाइंड द मिडिल पार्ट ऑफ द नंबर वी यूज आइदर मीन, मीडियन और मोड. मीन simply means average, and mean is most commonly we use mean only. But there is one problem with mean. Mean has this problem that mean get deviated towards big number. ऐसा समझ सकते हो कि mean बड़ा ही mean minded है. Whenever mean get big number, it get deviated towards the big number. Mean get deviated towards big number. So this is one problem with mean. If you put one big number, average of the total will become very big. So if there is a very big number at the end, then we don't use mean, we use median. Because median बीच का है. Median is always in the center. So median never get affected by big number. How you find median? You first arrange all the number, then whatever is the middle number, that is the median. So, and what is mode? Mode means most commonly repeated number. That's why some book they write mode as model. Because just like model keep repeating itself again and again in different TV serial ads and different thing, mode also keep repeating itself. So let's take an example and understand mean, median, mode together. Okay. Example is, let's take this example, 2, 2, 4, 6, 8 and 99. This is the example, 2, 2, 4, 6, 8, 99. So first let's find the mean. How we find the mean? We have this sign of summation, we add all of it, and then we divide it by sample size, which is n. How much is our sample size? 1, 2, 3, 4, 5, 6. 6 is the sample size. And how much total will come if you add 2, 2, 4, 4, 8, 8, 8, 16, 16, 6, 22, 99 and 22 is 121. 121 by 6, it will roughly come 20 point something, 20 or something. Now आप देख सकते हो क्या 20 सेंटर में है? Is 20 in the center? No. 20 get deviated towards 99. 20 is close to 99. So this is the problem with mean. If you put big number, mean will become close to big number. And so mean get deviated towards one corner. So in such case, what you will use? You will use median. What is median here? If you arrange the number, 4 and 6, two number are in the center. So how will you find median? There is no central middle number. If you do not find anything in middle, then you take average of these two. And average of these two will come 5. So 5 will be the median. This question came in NEET 2024 also. They gave a distribution and asked median, but there was no middle number. If there is no middle number, you will take average of middle two number, that will be the median. And what will be the mode here? Because 2 is repeating 2 times. So mode will be 2. And mode can go anywhere. That's why we use mode list. Because mode is just like model, it can go anywhere. So we don't use it commonly. We commonly use mean. But if there is big number, then we use median. For example, whenever we measure incubation period. incubation period sometime in some person is very big. So because it is sometimes very big, so incubation period, how you will measure best? Best measured by median, because in some person it can become very big, and if it is very big, then better to use median. Okay, now let's have an example. Suppose the number is, this example they have given, but the calculation part is wrong, so I expect you to do the calculation yourself, and you can find mean, median, mode very easily. Let's do the question on mean, median, mode. Yes, this is the question on mean, median, mode. The question is that if you have this data 10, 12, 14, 16, 88, so which is the best measure of central tendency here? If the data is 10, 12, 16, 14, 16, 88, what will you use here? Mean, median, or mode? If there is one number which is very big, we cannot use mean, so it's better to use median here. If there is a big number, you will use median. Now the second question which they create here from here is, earlier your distribution was 10, 12, 14, 16, 88. Suppose this 88 was wrongly written and you change 88 to 18. So now the new distribution is 10, 12, 14, 16, 18. So if you change 88 to 18, out of these four, which two statement is correct? It's a multiple choice question. Try to apply the logic and think which two option will be correct out of the four. Which two is correct out of the four? देखो, first of all, middle number in 10, 12, 14, 16, 18, 14 is the middle number. Here is also the middle number. So both have same median. Median do not get affected by big number. Median remains same. Now, if you change one big number to small, average will of course decrease ना. आप खुद भी समझ सकते हो. अगर बड़े नंबर को छोटा कर देंगे तो सारे नंबर का जो एवरेज है वो कम हो जाएगा. If you change big number to small, mean will decrease. So mean will decrease, median will remain same. Answer is C and D both. I hope you can do such question. Now let's read about this next topic is skewness of curve. समझो. Suppose I take your class test right now without teaching you complete biostat. So there is a high chance that many of you will get 30 marks. Suppose 50 students got 30 marks. 30, 30, 30, 30, 30 coming again and again. So if 30 number is coming again and again 50 times, what will you call this point A? Is this mean, median, or mode? What is this A? This is the 30 number which is coming again and again, again and again. And the number which is repeated again and again, maximum number of time, we call it mode. So this A is mode. And remember this point, mode is always on top of curve. Mode is always on top of curve. Just like a model want to maintain top curve, mode is also on top of curve. Like that you can remember. And what is this point B? Remember, median beach ka hai. So B is in middle, it is median, and median is always between mean and mode. And this C must be mean. Mean is always towards skewed end. And so if suppose in your batch, everyone has in Instagram 1,000, 2,000 friends or followers, but one student in your batch has 2 crore followers, very high. So if anyone become very high, this curve will become positive skewed. If anyone is high, it is positive skewed. And why I am calling this curve as positive skewed? Skewed मतलब होता है टेढ़ा, और यहाँ टेढ़ा हिस्सा 30 से 120 यानी बड़े नंबर की ओर है. Skewed is deviated. You can see the skewed part is between 30 to 140. So skewed part is towards big number. And in your life, if you are skewed towards big number, big money, are you positive skewed or negative? Of course, you are positive skewed. So the same concept applies for curve also. If the skewed or stretch part is towards big number, we call such distribution as positive skewed curve or right hand skewed curve. So positive or right hand because skewed part is towards big number. Now, in positive skewed curve here, you can see that our mode was coming around 30. And suppose the mean is coming around, let's say 90. So what will be the median? You have to find the median. This is suppose not known to you. Now, remember this, that if it is a skewed curve, for a skewed curve, we have a formula. What is the formula? Mode is equal to 3 median minus 2 mean. So by using this formula, we can find any one if not known. So here in our example, mode is 30. 30 is equal to 3x minus 180. So 180 will go here. It will be 3x 180 plus 30, 210. So x will be 210 by 3 or x will be 70. So what is the median? Median is 70. Now, we can find median like this, and if you arrange it, we all can simply see it that when we talk about positive skewed curve, in positive skewed curve, of course 90 is bigger than 70, 70 is bigger than 30. 90 was the mean, 70 is the median, and 30 is the mode. So in positive skewed curve, what is the sequence? Mean, median, mode. So either you can mug up this sequence like I used to mug up during my preparation time, or you can simply think that in positive skewed curve, which one is greatest? Mean is greatest. In positive skewed, mean is greatest. You just have to remember this one line. If you remember that in positive skewed, mean is greatest, median बीच का है, so the sequence will automatically become mean, median, mode, because median is always in the center. You just have to remember mean is greatest and sequence will be obvious, mean, median, mode. And if in positive skewed mean is greatest, who will be greatest in negative skewed? In negative skewed, median can never be the greatest. Median is always in the center. So in negative skewed, greatest will be mode. And the sequence of negative skewed curve will become mode, median, mean. So this formula which I write here is in the sequence of negative skewed curve, mode, median, mean. So remember, positive skewed, mean, median, mode, negative skewed, mode, median, mean. This is the sequence. Okay. So let's have a question on this. Let's remember this point, that if the skewed end is towards bigger number, we call it positive skewed or right hand skewed. If a skewed hand is going towards big number, we call it positive or right hand. And let's do a question on this topic now. In a hospital, most of the children are born with an APGAR score of 8. So which type of curve it is they are asking? What is this 8? This 8 is mean, median, or mode. 8 is the number which most of the children are getting. So 8 is coming again and again, again and again. So what is this 8? 8 is the mode. And what is APGAR score? I hope you know now. As soon as the child is born, we start judging the kid and we give him some number based on appearance, pulse rate, grimace, activity. And what does R stand for? They ask. R is not respiratory rate. R is respiratory effort. And how we measure it? If the child is crying, we say respiratory effort is present, 2 marks, not crying, 0 marks. So for APGAR score, maximum someone can get is 10, minimum someone can get is 0. 0 to 10 is the score. And in this 0 to 10, 8 is the mode, and mode is the topmost point of the curve. So we have to draw such a curve where topmost point is at 8 and then this part will be skewed. So you can see in this curve, this is the skewed part, and skewed part is towards lesser number. So if you are skewed towards less number, less money, you are negative skewed now. Same thing is for curve. If a skewed part towards less number, we call it negative skewed curve. So such curve is negative skewed curve. You can answer like this. Okay, this is the curve. And this is appearance, pulse, grimace, activity, respiratory effort, which we measure in APGAR score. This is the curve which I draw. This is negative skewed curve. And I hope you remember, negative skewed sequence is mode, median, mean. Mode, then median, then mean. Okay? Because mean is greatest in positive skewed. So automatically, sequence of positive will be mean, median, mode, and negative will be mode, median, mean. Okay? Now, from this topic, before moving ahead, they ask a very good question which let me discuss. This is a box and whisker plot. This box is between 25% to 75%. And any data which is outside this box, we call this data as outlier. So what is the purpose? Box is this and whisker का मतलब होता है पूंछी, tail. So whisker is this part. So why we use box and whisker plot? It can tell outlier. What is outlier? For example, every 2 to 3 years they do a survey in UK population how much sexual partner you had, and usual answer which come is 2 to 7. But in the same UK population, some hunters whose purpose is only to have sex, they say the data 699 sexual partner, 499 sexual partner. So should we include those hunter data in normal population data? Of course not, because if you include those data, average of population will become 2030 and everyone will think that others are doing, I am not doing. So the whole population will get depressed. So we should remove those hunter data by calling them outlier. So if someone is outside whisker, we call them outlier, and box and whisker can help us to remove the outlier data. So in exam, what they do is they draw a box and whisker plot in this way, perpendicular. And in the box and whisker plot, if I put the bar in the center, it's a normal curve. If I put bar here, it's a normal curve because 50-50% is going on both sides. But what they do is they put bar below or up. Suppose they put bar below. And then they will ask, is it a positive skewed curve or a negative skewed curve? So which type of curve is this? Positive or negative? Please reply in the comment box. What do you think? Is it a positive or negative curve? See here, it is starting from 25% and going to 75 always, 25 lower, 75 above. Suppose this bar is at 40%. So you can clearly see here that this start with 25 and then go towards here. So this part between 40 to 75, we have a skewed part. And of course, 40 to 75 is bigger than 25 to 40. So this skewed part is towards bigger number. And if you have a skewed part towards bigger number, or your life is going towards bigger number, which type of life is this? Positive skewed curve. So if you put bar below, it's positive skewed. And if I draw a box and whisker plot like this, in which I put bar above, I will call it negative skewed curve. So will you remember it? They ask question from this part very interestingly. And to remember it very strongly, there is a hint which a student in Jaipur, he came in the lunchtime and said, Ki, sir, I will tell you a method to remember it forever, but don't take my name anywhere. I said, tell me your secret method. He said, very simple, sir. Take this bar as penis or thought of sex. When the thought of sex is below the belt, under our control, then we can focus in study and our marks will increase. We are positive in our life. But when the penis or thought of sex is every time in the mind, then we cannot focus on study, our marks decrease and we go negative. So danda niche, positive skewed. Danda dimag mein, negative skewed. If the bar is below, positive skewed, bar in the head, negative skewed. So I said very good concept, and I applied the same concept to remember the formula of positive likelihood ratio, negative likelihood ratio. Because this one confused me ever. In both positive negative likelihood ratio, we write sensitivity above and we write specificity below. Always sensitivity above, specificity below. Now, similarly, if you remember that concept of putting bar, in positive skewed curve, danda niche, positive skewed curve, remember? So we put 1 minus below. If you put 1 bar below, positive skewed. And danda in the head, penis or thought of sex in the head all the time, then we don't focus on study, we go negative. So we put 1 minus above, it becomes negative likelihood ratio. Simple. So danda niche, positive skewed. If I draw this curve, danda niche, positive skewed. If I negative skewed, danda upar, negative skewed. है ना? So this negative skewed curve has nothing to do with likelihood ratio, but the same concept you can use to remember both of the thing. Okay? Chalo. Now skewed curve is done. We have to know about measure of dispersion, how to measure the spread of data. And you just need to remember 3 points from measure of dispersion. First point, that measure of dispersion is told by these 5 things: range, mean deviation, variance, standard deviation, and standard error. These 5 things tell about measure of dispersion. And dispersion we don't want, क्योंकि whether it's dispersion or curd, which type of data you like, which type of curd you like, कैसा रायता पसंद है, फैला हुआ या कटोरी वाला? Of course कटोरी वाला, फैला हुआ तो कैसे खाओगे, है ना? Which type of curd you like, in curd or spread on table? Of course in katori, because that will be to the point useful. If it is spread on table, how will you eat? It will be very difficult. So same thing is there for data. We want data or curd which is always to the point. We want less dispersion. Dispersion का मतलब होता है data का फैलना, spread of data. And we don't want data to spread. We want it to be pointed. So these 5 things tell about dispersion. Remember their name: range, mean deviation, variance, standard deviation, standard error. Now, in this topic, you need to know two, three things. First thing you have to know is, when we talk about standard deviation is always equal to under root of variance. And second thing, sometime they can ask you to identify the correct formula of standard deviation. The correct formula of standard deviation is under root sum of mean minus number whole square by n minus 1. This is the formula for standard deviation if sample size is less than 30. In my usual class, I explain all the steps how this formula is derived. But the derivation of this formula is not needed. Only in some INICT exam they ask to identify it. And you can easily identify it if you remember 3 characters of the story. First character is, we decrease sample size minus 1 because this is known as degree of freedom. Like how much free I am to choose from my 5 finger. Out of 5 finger, I can only choose 4. When it is last finger, I have no freedom left. So first is degree of freedom and minus 1. Second concept is, if you do minus plus thing, try to add all of them together, they will cancel each other. So to remove minus sign, we are doing square. And if you do square, our result comes in square. So to remove square, we are doing under root. So these are the 3 characters: under root, square, and n minus 1. This is standard deviation. This standard deviation is something which we use for sample. When I am talking about 3 people, 5 people of this class, we use standard deviation. But when I talk about everyone in the class, we use standard error. So standard error we use for population. Standard deviation I use for sample. This is the main difference between them. Okay. Now, there are 2 questions which came from this topic. So let me explain those 2 questions. It will help me in revising the whole topic for you. The question is, these are the various formula, but you need not to go into detail of it. We can read the theory of formula of standard error, but not other parts. So let me see whether the question is here. No, the question is not here. So let me put this 2 questions. It will help you to understand this part better. The question was, suppose you have 3 number 2, 4, 6. In this 2, 4, 6, what is the standard deviation? देखो, स्टैंडर्ड डिविएशन एक बड़ा सिंपल सा चीज है. आप इसका मिडिल नंबर निकाल लो, एवरेज निकाल लो, मीन निकाल लो, और स्टैंडर्ड डिविएशन का सीधा मतलब बस ये है कि हर एक नंबर मीन से कितना दूर है. जैसे 6 4 से कितना दूर है? 2, तो स्टैंडर्ड डिविएशन है 2. 2 भी 4 से कितना दूर है? 2, तो स्टैंडर्ड डिविएशन है 2. What I'm saying in Hindi is, in 2, 4, 6, if you want to know the standard deviation, first you find the mean or average. And the average of 2, 4, 6 will always be 4. I can tell it without calculation. Why? Because this is symmetrical data distribution, every number is equally away. And when every number is equally away, middle number become mean. So the mean is 4. Okay. You can calculate it also. 2 plus 4 plus 6. It is 6 plus 6, 12. 12 by 3, it will come 4. So mean will come 4. So mean is 4. Standard deviation only tell us how far is each number from the mean. So how far is 2 from 4? 2. How far is 6 from 4? 2. So what is the standard deviation? 2. Standard deviation means how far is each number from middle number. Now the question is, suppose 2, 4, 6 is the distribution and you multiplied every number by 10. If every number is multiplied by 10, what will be the effect on standard deviation? If every number is multiplied by 10, then standard deviation become how much time? Does the standard deviation become 10 square, or does it become under root 10 time, or does it become 10 time, or does it remain same? What is the answer? What do you think is the answer? So first of all, let's do it. Let's multiply 246 with 10. If you multiply 246 with 10, it will become 20, 40, 60. Now think about the answer and give me the answer in the comment box. What do you think? If you multiply 246 with 10, what will be the effect on standard deviation? What will be the effect on standard deviation? Yes, most of you think it will remain same. Javeer and Subham Singh, you both replied very good, correct. Thank you for replying. It looks like it will remain same, but देखो 246 become 20, 40, 60. Now what is the middle number? Middle number is 40, mean is 40. And how far is each number from 40? How far is 20 from 40? 20. How far is 60 from 40? 20. So standard deviation is 20 na, because each number is away from 40 by 20. So previously your standard deviation was 2. Now the standard deviation become 20. So standard deviation become 10 time. Why 10 time? देखो सीधी सी बात है, अगर हर एक नंबर को 10 से मल्टीप्लाई करोगे तो उन नंबर की दूरियां भी 10 गुना हो जाएंगी, और स्टैंडर्ड डिविएशन हमें यही बताता है कि हर नंबर बीच वाले नंबर से कितना दूर है. If you multiply every number by 10, then the dispersion between these number also become 10 time. And standard deviation tell us how far is each number from middle number, so that will become 10 time more. Okay, interesting question, huh? Now let's have one more question on this topic. The question which came from this topic was that percentile means dividing something into 100 part, quartile dividing something into 4 part, and outlier. These three things, percentile, quartile and outlier, tell. What do they tell? Do they tell position or location of data? Do they tell measure of central tendency, or do they tell measure of dispersion? Out of A, B, C, what do quartile, percentile and outlier tell about the data? Measure of central tendency, measure of dispersion, position, location, what do they tell? So first thing, measure of dispersion is written by range. Range means maximum to minimum. Measure of dispersion is by mean deviation. Third thing which tell dispersion is variance, then standard deviation and standard error. These 5 things tell about dispersion. So they do not tell about dispersion. C cannot be correct. Measure of central tendency we just read. Mean, median, mode tell about central tendency. So they also don't tell about central tendency. Actually, percentile and outliers, they tell about position or location of data. How will you remember it? See, very simple. If you got 99.9 percentile, you are a topper now. So percentile is telling your position. Quartile means 25%. You are at 25% position. An outlier means you are very outside from the normal data. Your position is very extreme. And box and whisker plot was helping us to identify outlier. So these things tell position location. Okay. It do not tell central tendency and dispersion. And this time, again, Javeer, Subham, Gaurav, they all replied, and Javeer was definitely correct. And I hope you are understanding these concepts. If any question is not clear when I ask, feel free to write it, and I'm very thankful for you to reply. Thank you. So now, let's understand the last thing, standard error. Dekho, there is two formula of standard error. First formula is standard error is standard deviation by under root of sample size. This formula we use when the data is quantitative, like BP, height, weight, then we use standard deviation by under root n. But if the data is qualitative, then we use the formula standard deviation is under root QP by n or PQ by n. This is for qualitative data. Because qualitative data like anemia and all will be in percentage. So suppose in the class, prevalence of anemia came 10%. 10% student have anemia. So if P is 10%, what is Q? Q is 100 minus 10 or 90%. Suppose the class sample size of your class is 100. So what will be the standard error? The standard error will be under root PQ by N. P is 10, Q is 90, and sample size is 100, and you do under root. So all 0, 0 will cancel out. Finally, you will get under root 9. Under root 9 means 3. So standard error can be calculated by under root PQ by N. We can also calculate it by standard deviation by under root N. These two formula you have to remember. In the end, we will revise all the formula of biostat together. This is not only 5, 6 formula are there. It's not a tough thing. So these are measure of dispersion. Now let's read about standard normal curve and confidence interval. Remember, in a standard normal curve, there are 3 rules. First rule is, if you look at this curve, this has -3, -2, -1, 0, +1, +2, +3. So what is the middle number? 0 is the middle number. So median is 0. What is the topmost point is coming at 0. So topmost point is mode. Mode is also 0. And it's a symmetrical distribution. Symmetrical मतलब हर एक number बराबर दूरी पर है. Because it's symmetrical distribution, every number is equally away. So middle number become mean also. So this is rule 1. Rule 1 says mean is equal to median, median is equal to mode, and all are equal to 0 because all are in the center. Okay. So this is rule 1. Now rule 2 says कि if you look at this curve, in this curve, standard deviation is equal to variance, and they both are equal to area under curve, and all are equal to 1. Sabka malik 1. है ना? So mostly when they ask question from rule 2. Standard deviation, variance, area under curve is 1. And this is a bit debatable. Because right now we read standard deviation is equal to under root of variance. Abhi just right now we read this formula. And here I am saying they both are equal. Why they both are equal? Because if you do under root of 1, under root of 1 is also 1. So only in this special situation they are equal. Otherwise this formula is correct. But for normal curve, because they both are 1, so they are equal. Okay. So do not forget this second rule. Standard deviation, variance, area, all are equal to 1. Third rule is saying, if you look at this white part which I draw, between -1 to +1, definitely this, if the total part is 100%, this white part is more than 50%. Actually, it is 68% value between -1 to +1. Between -2 to +2, we have 95% value, and between -3 to +3, we have 99% value. This is rule 3. कि mean ±1 68% area under curve, mean ±2 95% area under curve, mean ±3 99% area under curve. These are the three rules, and a lot of question come from rule 2. Remember rule 2 for sure. Standard deviation, variance, and area under curve all are 1. Okay. Now let's do a question under of this topic. What is the area under mean plus 1 standard deviation? Which area will come mean plus 1? 0.68, 0.47, 0.34, 0.95. What is the answer? My dear friend, if this is the curve, this is suppose -1 plus 1. Total area is 68. But in the question, I am not asking total area. I am just asking what is the area between mean plus 1. Only this area I am asking. So it is half of 68. And half of 68 is 34%. So if I ask mean plus minus 1, plus minus 1 is 68%. But in the question, it was a trick question. They only asked mean plus 1. So mean plus 1 is half of 68, 34%. Okay. Sometimes they can change the question and they can ask area outside mean plus minus 1 standard deviation. Outside, how much area is there? So see, total area is 100%. Inside area is 68. So if you remove 68 from 100, it will come 32%. So how much area is outside mean plus 1 plus minus 1? 32%. How much area is inside? 68%. But how much area is mean plus 1? Half of 68, 34%. Okay, I hope it is coming clear. So this is a standard normal curve. Now let's talk about confidence interval. Okay, confidence में confidence ही हिल गया. Anyway, spelling is not important. Main thing is what is confidence interval. So confidence interval एक बड़ा ही simple सा चीज है. It is that range within which answer lies. Suppose I ask it suppose from my friend Javeer कि how much you can run, Javeer bro. So Javeer, how much you can run? What is your range of running? Suppose Javeer answered, sir, I am 95% confident that I can run between 4 to 5 kilometer. है ना? 4 to 5 kilometer means 4.5 plus minus 0.5 kilometer. So with this data, 4 to 5 kilometer, one thing is clear that Javeer is fit, he having good stamina. And what is this 95% confidence means? This was Javeer 95% confidence interval. In between 4 to 5 kilometers, somewhere Javeer will stop. So this is the range of value within which somewhere answer will lies. Between 4 to 5 kilometers, somewhere Javeer will stop. So this is confidence interval. Now, the bigger the range of confidence interval, it means data is more spread, and we don't like data which is spread. So the bigger the range of confidence interval, data become less significant. Less significant data become. For example, let me explain this point. Less significant data become with big range of confidence interval, data become less significant. Let me explain this to you. Suppose you ask the same question from me, कि how much you will run, sir? I will say कि I am 95% confident I will run between 100 meter to 5.1 kilometer. So my range is actually 2.6 plus minus 2.5 kilometer. So when my range is 100 meter to 5.1 kilometer, it is not giving you any idea that am I super fit or am I super sick and I'm not able to run at all. So when the range become big, you can see this range is useless. It is not telling anything about me. So this is a big range, and big range is usually useless. Big range is less significant data. Now, okay, we understand that we want data which has less confidence interval. The question is how you can decrease the range of confidence interval, how you can make confidence interval narrow. Why Dr. Javeer is able to say 4 to 5 kilometer? Because Javeer is running in the past again and again, and he had many observation, large sample size. So due to large sample size, Javeer can clearly say that I can run 4 to 5. But in my case, I don't remember when the last time I ran. I just run sometime with my children and all. So my sample size is less. Javeer's sample size is big. If the sample size is big, data become narrow, precise, to the point. So to decrease the range of confidence interval, what we have to do? We have to increase sample size. Both this question has came. If the range is big, we don't like it. And how to make the range small? By increasing sample size. This two statement, I hope you will remember. Okay. If not clear, you can ask me. I will give you more example, but I hope it is clear to you. And 68% confidence interval is mean plus minus 1 standard deviation. 95% confidence interval is mean plus minus 2 standard deviation. Many a time numerical come on this simple formula. So what I was telling you earlier, let me explain with a very simple example, because both the question came in it exam. When I started dating the girl whom I married after 4.5 years of live-in relationship, she used to call me to come at 7. I used to go at girls' hostel to pick her at 6:50. And then from 6:50 to 7:30, I used to wait. And she used to come around 7:25 or something. And then we used to come to my flat to play Ludo. So 6:50 to 7:30 was the range of me waiting for my girlfriend initially. So this was a big range. And it was not a significant data. But after some 10 to 14 days, I realized that she every time come at around 7:25, 7:30 only. So then rather than going at 6:50, I started going at 7:20. And then by 7:30, she would used to come. And then I used to ask for a kiss and we used to go. So with observation, after 10 to 14 days, my range of confidence interval narrow. Initially, the range was big. Okay. So when you have more sample size, range become narrow. And this narrow range is better or more significant data. And how this data become better? By more sample size. More sample size will make the data narrow. Okay. And do remember this formula, 68% is mean plus minus 1, 95% is mean plus minus 2 standard deviation. They use some numerical also on it. So we have done with this part of confidence interval, but do remember confidence interval and standard error, they both are example of inferential statistics. Inferential statistics means we calculate it for a sample and we apply it on the whole population. Inferential means we take it for sample, apply it in the class. For example, suppose I called Nikhil here. Nikhil, come here. And when Nikhil came here, I started touching him like this, opening his button and all. What you will say? Ki, sir, you are gay. So what you are doing? With my one behavior, you guess about my whole life. That is inferential. Inferential means you take data from sample, apply it on the whole population. So that's what confidence interval and standard error are used. We collect data from sample, apply it on the population. This question has also came. Okay, Nikhil, na? I just used you. It's okay, na? He is very happy to be used. So this is the concept. I hope you will remember. Now let's discuss one last thing here. Correlation regression. Very simple thing. Correlation is just the direction of association between two variables. For example, if you look at your marks and hour of study without phone, if you study for more hour without phone, there is a chance that marks can increase. If you are studying with happy mind, it will increase. So they both are in the same direction. We call it positive correlation. But if you look at temperature and size of cloth, with increase in temperature, size of cloth decreases. So it means they are in the opposite direction. We call it negative correlation. Correlation is the direction between them. And these plots which we are drawn with many dots, this type of plot is known as scatter plot. So in any question, if they ask which of the following tell the relationship between two variables, if they ask in any question relationship between two variables, relationship between two variables is always detected by correlation. Relationship question came, you have to answer correlation. Relationship in the question, correlation is the answer. Because correlation tell is, are they in the same direction, positive correlation, or are in the opposite direction, negative correlation. So this is correlation. But okay, correlation tell direction. But sometimes we want to know not just the direction, but also we want to know how strongly two things are correlated. So coefficient of correlation tell direction and strength both, how strongly related and what is their direction. And this coefficient of correlation can only be between -1 to +1. So sometime in exam they give R value plus 1.2. If they give plus 1.2, it is not possible. It's definitely wrong data. Anything more than +1, less than -1 is wrong data. Okay. So let's say here, if the correlation coefficient is between 0.1, 0.3, we say the correlation is weak. 0.4, 0.7, moderate. 0.8 to 1, we call it strong. And if it is plus 1.2, it's wrong data. So in one of the exam, they created this two plot, A and B. In A, the dots are far apart. And in B, the dots are more in the center. They ask out of A and B, which has a strong correlation coefficient. So tell me which type of data we like, the spread or through the point. We always like data which is to the point. So this A has weak correlation. Here the correlation will be something like, let's say 0.3. And here it will be strong correlation, something like plus 0.8. So B plot has a strong correlation because dots are in the center towards an imaginary line, they are more concentrated. So if the dots are closer to imaginary central line, we say this has a strong correlation. Okay. And if suppose the dots are exactly on the central line, if they are exactly on the central line, then R is perfect plus 1. Strongest is this one. C plot is the strongest. Okay. So this is correlation coefficient. If they are exactly on the line, we call it as R perfect correlation. So I think correlation coefficient is clear. If you do the square of correlation coefficient, you get coefficient of determination. Coefficient of determination tell about percentage fluctuation. It tell only percentage fluctuation. So let's say after taking today's class, you went to meet your room partner and you found that there is fog in your room partner room because he is smoking joint with dim light and laptop is open and all. And you have seen earlier he used to smoke 1 to 6 joint, one joint. Now he is smoking 5, 6 joint in the day. So the joint has increased to 5, 6. Definitely marks will decrease. You can try it. If your joint become 5, 6, marks will decrease. So here there is a negative correlation. Joint is increasing, marks is decreasing. Negative correlation. So you tell it to your friend, that friend, there is a strong negative correlation minus 0.8. So decrease your smoking. And if you do square of R, it will come 0.64 minus 0.8 square become plus 0.64 or 64%. This R square is coefficient of determination. And it is telling 64% means if you decrease the joint, marks can increase by 64%. So remember what I said about determination? Determination tell about percentage variation only. So if R square is coming 64, it means when you decrease the joint, marks can increase by 64%. So if you tell like this to your room partner, will he or she will understand? No. She will take one more puff, throw the cloud on your face and will say ki, I am flying somewhere here, you are lying on the ground here. Take one puff, come to my level, then we will talk. And your room partner can say ki, forget all this percentage bullshit. Tell me that if I decrease my joint from 6 to 1, will I get more than 50% or not? Will I pass or not? Tell me directly. So now your room partner want to know exact variation, exact fluctuation. And if someone want to know exact fluctuation, we need a mathematical formula which is in regression. So regression can tell exact variation. No other thing can tell exact variation. Okay. So this is the whole story of the 4 coefficient. Let's do a question on this topic. The question is, if one variable is given, how can you find other variable? If one is given, how can you find other? So simple thing is, out of the 4, what does determination tell? Determination tell percentage variation. So it can not tell about the other variable exactly. What does correlation tell? Correlation tell, coefficient of correlation tell direction and strength of association. So that can also not tell exact variation. But in regression, there is the formula y is equal to bx plus c. So if y is given, you can find x. If 1 is given, you can find y in regression. Regression can give the other variable if 1 is given. Okay? And what does coefficient of variance tell us? What is this coefficient of variance? Coefficient of variance, remember, it compare quality of data or dispersion among data set. Coefficient of variance compare quality of data or dispersion of data set. Okay, this question has also came in NEET exam. What is the role of coefficient of variance? It compare quality or dispersion of data set. Actually, coefficient of variance, if you see, coefficient of variance is written as standard deviation by mean. And if you want in percentage, you can multiply by 100. So in coefficient of variance, standard deviation is here, dispersion is here. And we want dispersion to be less. We want data to the point. So again, remember, if coefficient of variance is less, data is of better quality. तो देखो बिडू लोग, एक बात समझ लो, हमें जिंदगी में बड़ी चीज चाहिए होती है. हमें लगता है बड़ा है तो बेहतर है, लेकिन 2 चीज जो सी से शुरू होती है छोटी होनी चाहिए. जितनी छोटी उतनी अच्छी. कौन 2 चीज है जो सी से शुरू होती है छोटी होनी चाहिए? कॉन्फिडेंस इंटरवल एंड कोएफिशिएंट ऑफ वेरिएंस. ये दोनों चीज जो सी से शुरू होते हैं, lesser, more significant. We want big thing in life, but 2 things which start with C should be smaller. The smaller, the more significant, and they are confidence interval and coefficient of variance. It should be smaller. And what is the use of coefficient variance? It compare quality of data. So let's say you are sitting in my OPD and 2 patients came to you, patient 1 and patient 2, and you ask from both the patient, when does it wake up? कब जग जाता है? कब उठ जाता है? Which OPD you are sitting? You are sitting in sex and marriage counseling OPD, because I'm a trained sexologist. In AIIMS New Delhi, for 3 months, we used to sit in such OPD. And first question we used to ask is about morning erection of your penis. Because if morning erection present, problem is psychological, we can solve. If morning erection absent, then problem can be pathological or severe depression. So when you ask it from 2 patients, first patient said, sir, sometime 4 a.m., sometime 5 a.m., sometime 6 a.m. When the neighbor cock wake up, my also wake up. So, and second patient said, sir, sometime 2 p.m. in night, sometime 6 a.m., sometime 10. So this is 2 patient data. Coefficient of variance can compare it, because coefficient of variance is standard deviation by mean. What is the mean value in 4, 5, 6? Mean is 5. And how far is each number from 5? 1. So standard deviation is 1. Mean is 5. It will be 1 by 5 or 0.2. In second case, when you find coefficient of variance, what is the mean or average? Mean is 6. How I can tell without calculation? Because every number is equally away. और अगर हर एक नंबर बराबर दूरी पर होता है तो बीच का नंबर मीन हो जाता है. If every number is equally away, middle number become mean. And what is standard deviation here? Standard deviation is 4. So 4 by 6 will come 0.6. So here coefficient of variance is big. Here coefficient of variance is small. So which quality data is better? Patient 1 have better quality data always. So if you have to compare quality of data, you will use coefficient of variance. So this one question can help you compare all the 4 coefficients. So do remember this one question. And when you want to know direct association, direct relationship, you will use regression. Okay. So these are the points which we have to read from this part. Now, let's read about different type of studies which we have. So in the epidemiological study part, first is study can broadly be classified into 2 parts. One is when you do some medicine or surgery from your side, we call it interventional or experimental study. and all intervention or experimental study are usually randomized control trial because we take participant in two group randomly. So if you are randomly taking two group and doing some intervention, it is RCT. But there is a new type of question which come from RCT. They ask this question, what is quasi-experimental trial? Quasi-experimental trial means, suppose, let's say, after your MBBS, you thought that I should develop my whole village. And you made some self-help group, started doing some, started some local businesses in the farmer, like they are producing tomato, you are also making them produce the jam, sauce, and make them earn like a industrialist. So you made self-help group and you develop your village. Now you are comparing your village with neighbor village. So this is community trial because you are doing the trial on the whole community. But you choose your village without randomization. You just choose it because you belong to it. So if you are doing a trial without randomization, it is quasi-experimental trial. Quasi-experimental trial means trial without doing randomization. Without randomization, if you do trial, it is quasi-experimental trial. Okay? So experimental trial are interventional study. But the second type of study is observational study. We can call observational study as Dhritarashtra study. Dhritarashtra was a blind character in Mahabharata who just keep used to asking, "Ye kya ho raha hai? Ye kya ho raha hai? What is happening?" He just used to ask, and he never used to do anything. So similarly, in observational study, you don't do anything. You just ask what is happening, what is happening. Now, if you ask it from one patient and you write one patient story, you call it case study. So what is case study? You can say case study is hospital story of one patient. And when I say hospital story of one patient, it means it will have complete detail of the patient. For example, let's say in your batch, suppose Subham Singh took surgery. And after taking surgery, Subham Singh was in surgery emergency and one patient came with penile fracture. So Subham Singh took that patient history, कि भैया कहाँ से कूद रहे थे, what you were doing, how this fracture happened. So first he took history. After taking history, he did Doppler or other investigation. Then he did the surgery, repaired it. And after repair, he said the person, "Go slow, my friend, next time. Don't be so jumpy." And he did it in such a way, good study. And then he gave his study for publication in a journal. So when you give case study for publication, the journal people, they check whether your case study is good or not based on care criteria. Care means case report. So care criteria we use for publication of case study. So suppose your study got approved, care criteria was good, fulfilled, and now you are famous in repairing penile fracture. And now Dr. Subham Singh is being called in Dubai to repair 2 penile fracture there and called in Delhi to repair 6 penile fracture here. Al Habibi bhai. So now this 2 case and 4 case in Dubai and Delhi, he is repairing all 6 and writing hospital story of all 6 cases. Then we call it as case series. So if it is one patient story, it is case study. But when do you call it case series? Case series means there must be one or more than one group of patient. But main thing is they should have common illness. One or more than one group of patient with common illness. If their illness is common, then you can define them in the form of case series. So this is case study, case series. I hope it is clear. Now, whenever we give observational study for publication, for observational study, which criteria has to be fulfilled? Criteria is strobe criteria. Because in the strobe, you can find OB. OB means observational study. Okay. And if you are giving randomized control trial for publication, if you are giving RCT for publication, RCT criteria for publication is known as consort criteria. Consort, because here it is RT. RT is for randomized trial. Okay. This is a new type of question they are asking. I hope you'll remember. Now, Main thing is the classification which I was focusing. First, it can be experimental RCTs or quasi-experimental RCTs and observational. If it is observational, in the first step, we just describe the story. So we call it descriptive study. Case study, case series are just describing it. Then sometimes we can use the data to also analyze the story. Then we call it analytic study. And in analytic, we have case control cohort. Now you can see in this classification, I am writing cross-sectional ecological here also, cross-sectional ecological here also. Why? Because cross-sectional ecological, they have story also and data also. So sometimes they can be used as a story, sometimes they can use as analytic study, sometimes descriptive study. They are in both sides. But main thing you have to remember is case study, case series are descriptive, case control cohort are analytic. Now, what is cross-sectional study? Remember this point. If I ask any question from all of you, like suppose I ask how many of you who are watching my episode are using Tinder, Happen, Bumble or any dating app in their phone. Are you on dating app? Tell me yes or no. So suppose when I ask this question, what I am doing among you? I am doing a survey among you. All survey are cross-sectional study because I ask how many of you use dating app. And usually when I ask it in the class, very few students raise hand or almost no one raise hand. Why? This is the problem with cross-sectional study. We call it apprehension bias. The person start thinking what other will think and they do not raise hand. But I think they should raise hand because suppose you raise hand and the girl or boy sitting next to you also raise it, then the match will be made there only. No need to go on dating site. But apprehension bias means we start thinking what other will think and our response in survey will be wrong. An example of apprehension bias is white coat hypertension. When the patient see doctor in white coat, BP of patient rises. Not because the doctor is hot. Doctor can be hot, but BP is rising because now the patient is thinking where he will put finger in my body, which disease will come out. So this apprehension bias occur in which study? Cross-sectional study. And remember, all survey are cross-sectional study. They keep giving question on this topic again and again. Suppose there is a study done. Example can be Monica study. Monica is actually done in a very long, big area. What they did was they went door to door and they ask कि क्या तुम दारू पीते हो, क्या तुम सुट्टा पीते हो, तुम गांजा क्यों नहीं फूकते हो, do you smoke, do you drink, do you smoke weed and all, and what is your BP, sugar and all. So by asking this question, they came to know the trend and determinant of cardiovascular disease. So they ask the habits and they measure their BP, sugar. So this is like a survey, and the person who named this study, he must be a lover of Monica. He took Moni from monitoring and Ka from cardiovascular and make it Monica trial. So Monica full form has also been asked. That's why I write the full form. And they have asked this question that if you do survey of any time, survey is cross-sectional study. So when I do survey that do you use Tinder or dating app or anything, suppose out of 105 people said yes. So those 5 people are the prevalence. They are the people who have dating app right now in their phone. So what does cross-sectional study tell us about? Cross-sectional study tell us about prevalence. So that's why cross-sectional study is also known as prevalence study. So remember, all survey, all prevalence study are cross-sectional study. One very common example of cross-sectional study is KAP study. What is KAP study? Knowledge, attitude, practice. Like, do you have knowledge about condom? Yes. What is your attitude? Okay. What is your practice? Never use. So this type of survey is also cross-sectional study. And cross-sectional tell the prevalence. What is prevalence? Old plus new case right now, total case right now. This is cross-sectional study. So in cross-sectional, which bias occur? Apprehension bias occur. Now, next type of study is ecological study. And this question has came in recent NEET exam. In any question, if you found that they are correlating something, that is ecological study. What we do in ecological study is very simple. We correlate hospital data with population data. hospital and population data correlate, correlational study. For example, in USA, they did a survey that cases of breast cancer increased in USA with increase in fatty diet. People eat more fatty diet, so breast cancer is more. Now, where they get this data of breast cancer? Breast cancer data came from hospital. So this is hospital data. And where do they get the data of fatty diet? Fatty diet data came from population. So this is population data. And they are just correlating these two. So if they correlate, this is correlational ecological study. So remember one thing, the main difference between cross-sectional and ecological is, in cross-sectional, we ask question from everyone. But in ecological, we do not ask question from anyone. We direct collect population data, match it with hospital, and that's done. So if, remember this point, cross-sectional, ecological, both are done on one population. But in cross-sectional, question from everyone. Ecological, question directly from population. So what is the unit of study of ecological study? Unit of study is population. Okay. Now, in ecological study, the problem is whatever we see about the population is not correct when we apply to individual. For example, when I say that breast cancer is more due to fatty diet, does everyone who develop breast cancer, they develop it due to fatty diet? No, no. Someone might have developed it from smoking, someone might have family history, someone might have some other reason. So never say anything wrong about the whole population. If you say anything wrong about the whole population, you are doing ecological fallacy. Okay. So this is ecological and cross-sectional study. Now, before moving ahead, let's do this question. We will read the upper part separately. First, read this question. One case series is an example of which type of study? Case series is which type of study? Is it interventional observational? Nothing like interventional observation. There are two categories. Is it analytic descriptive? There is no study like analytic descriptive. Under observational, it can be analytic or descriptive. So A and D is gone. It is B or C. Where is case series? Observational descriptive, observational analytic. I hope you remember. Case study and case series, they both are observational descriptive. And who are observational analytic? Observational analytic were cohort and case control. So correct answer is B. Now let's do one more question from the classification. This came, which the following is longitudinal observational analytic study. So I hope you know observational and analytic. It can be case control also, cohort also. But this longitudinal word we use for cohort. Because in cohort, we take two groups parallelly in the future. I hope you understand this point. If you are examining something about present moment, doing survey about present moment, present survey means cross-sectional. So you can say cross-sectional is Buddha study, talking about present moment, focus on present breath and all. That's cross-sectional. If you go in past and ask past history, that is case control. And if you go in future and follow up in future, it can be cohort or it can be RCT. But in RCT, we control in lab experiment environment. So cohort is the one which can tell about natural history of disease, which can tell what is going to happen in natural history. And so natural history is best told by cohort, because in cohort, we follow the group naturally in future. So I hope you will understand and you will remember this point. Now, after this classification, let me do this question to you, which is written above in a proper way. Let me do it. The question is, I have already discussed this formula in the first session also, that prevalence, which means total case, this is incidence, new case, into duration of disease. So they in PSM, NEET, MCI, INICT all have asked this question again and again. The question is, suppose you took MD medicine in your PG and then you got so much in love with the study, you become a DM cardiologist. And let's say my friend, peaceful warrior, become a peaceful cardiologist. And this peaceful warrior friend is becoming a cardiologist, and after becoming a cardiologist, he found a new drug which can control BP and sugar for lifelong. You just keep taking one medicine, you will never die. It will not be cured, but you will never die from BP sugar. So the question is that if a new drug does not cure disease, the new drug is not curing BP sugar, does not cure disease, but prevent death due to it. And like BP sugar drug, they do not cure BP sugar, but they do not let anyone die due to it. So the new drug is not curing it and preventing death. So what will be the effect on prevalence? What will happen to prevalence and incidence? That they ask again and again. What will happen to prevalence? First tell me, what will happen to total case burden or prevalence? देखो भाई, ना तो कोई इस बीपी शुगर की नई दवा के चलते कोई ठीक तो नहीं हो रहा है, कोई मर भी नहीं रहा है, तो सभी लोग लंबे समय तक सफर करेंगे, और लंबे समय तक सफर करेंगे तो किसी भी समय ड्यूरेशन बढ़ जाने से प्रिवलेंस बढ़ जाएगा। लंबे समय तक बीपी शुगर के मरीज जिंदा भी रहते हैं, सफर भी करते हैं, इसलिए किसी भी टाइम आप उनका बर्डन नापो तो एक पॉपुलेशन में बहुत सारे लोग आपको बीपी शुगर के पेशेंट मिलेंगे, है ना। तो यानी क्या है, इफ ए न्यू ड्रग डज नॉट क्योर द डिजीज बट प्रिवेंट डेथ ड्यू टू इट, प्रिवलेंस विल इंक्रीज, मेनी पीपल विल कीप सफरिंग फ्रॉम इट, प्रिवलेंस विल बी मोर। बट एक बात बताओ, बीपी शुगर की नई दवा खोजने से क्या नए केस ज्यादा होने लगेंगे या कम होने लगेंगे? नए केस हो रहे हैं लाइफ स्टाइल प्रॉब्लम के चलते ना। अभी ग्रुप में एक रायबरेली करके बंदा है, वो मुझे बोल रहा है सर यू आर मोटू, पता नहीं क्यों, है ना। सो आई एम हैविंग बीपी शुगर प्रॉब्लम, इट इज ड्यू टू लाइफ स्टाइल फैक्टर ना, इट्स नॉट ड्यू टू एनी ड्रग, है ना। सो न्यू केस इज नॉट अफेक्टेड बाय ड्रग, रिमेंबर दिस फॉर योर लाइफ लॉन्ग. In any question, if they ask about incidence, new case, and they are talking about drug, remember this thing, incidence almost remains same. New case पर दवाई का कोई असर नहीं पड़ता है, and that is why they keep asking it in PSM, because they want to tell that all you medicine surgeon people, you can affect prevalence, but you cannot affect new case from happening. New case is affected by preventive social changes. So incidence always remains same when they talk about drug, but with such drug which does not cure disease but prevent death, prevalence will increase. Okay, so prevalence increase, incidence same. Do remember this example also, cardio, and this is the thing which I explain here. Okay, chalo, now let's come to understand case control study. See, suppose you thought to do a case control study on the people who are suffering from depression in your class. तो देखो, पहली बात यह है कि इन केस कंट्रोल, केस मींस दोज पीपल हु हैव द डिजीज. आप कहते भी हो किसी किसी दोस्त को कि अबे तू तो केस है बे, यू आर ए केस डियर. केस मींस ही हैज समथिंग एबनॉर्मल. केस मींस देयर इज सम आउटकम और डिजीज, कुछ बीमारी है, कुछ कीड़ा है. एंड कंट्रोल मींस नॉन डिजीज, नॉन डिजीज, और यू कैन से आउटकम एब्सेंट. आउटकम को हम कहते हैं परिणाम. तो जब परिणाम है और नहीं है होता है दो ग्रुप, बीमारी है नहीं है तो केस कंट्रोल है. डिजीज, नॉन डिजीज, आउटकम प्रेजेंट एब्सेंट इज केस कंट्रोल. दिस इज द मोस्ट इंपॉर्टेंट कंसेप्ट टू रिमेंबर, बिकॉज व्हेन वी विल रीड अबाउट कोहॉर्ट, कोहॉर्ट का दो ग्रुप होता है, यहीं पर आपको सब कुछ क्लियर हो जाएगा. रिस्क फैक्टर प्रेजेंट, रिस्क फैक्टर एब्सेंट. तो अगर रिस्क फैक्टर प्रेजेंट और एब्सेंट है तो ये है कोहॉर्ट. रिस्क है, रिस्क नहीं है. बेसिकली कोहॉर्ट शुरू होता है कारण है और कारण नहीं है ना. एक्सपोजर प्रेजेंट, एक्सपोजर एब्सेंट, एक्सपोज्ड, नॉन एक्सपोज्ड. सो इफ यू हैव द टू ग्रुप एक्सपोज्ड एंड नॉन एक्सपोज्ड, risk factor present absent, it will become cohort study. And if the two group is disease present absent, it is case control. If you remember this point, you can do most of the question correct. Cohort start with effect. Risk factor means effect. Effect present and effect absent. No, sorry. Cohort start with cause, कारण. कारण का मतलब cause. So cause या risk factor present and cause absent. So when we talk about cohort start with cause to effect. कारण से परिणाम की ओर, that is cohort, cause to effect. And case control is disease to risk factor, outcome to exposure. Okay, so let me explain this with a very good example. Suppose you want to know the reason of depression in your FMGE exam going students friends group. So you can start with disease and non-disease. Who will be disease? Disease are those final year students who are depressed. And control, suppose you have taken non-depressed people and you have taken non-depressed people as control from first year of MBBS. Depressed final year से ले लिया, non-depressed first year से ले लिया. Is it comparable? Of course not. The reason of final year student depression will never be present in first year. So you cannot compare if they are final year and first year. If they both are from final year, only then you can compare the reason why some are depressed, why some are not. So in the case control study, they ask what are the steps of doing it. First step is you start with case and control. But second step is matching. Matching means they should be almost similar in two groups. If depressed is final year student, post final year student who are preparing for exam, non-depressed should also be post final year. They should be from the same class. Then you can compare them. So this is matching. Matching means same people. So after recruitment, we do matching. After matching, we take past history. And after taking past history, the result come in odds ratio. So in the final step, we do analysis of data. Always remember, analysis of data is the final step. In everything, analysis of data come at the last. So first recruitment, then matching, history, analysis. Recruitment, matching, history, analysis. Recruitment, matching, history, analysis. Okay? These are the 4 steps of case control study. Now similarly, they can ask, what are the steps of cohort study? And they have asked it. And what are the steps of randomized control trial? So in cohort study, what we do is, first step, we define our study population, key on which people we are going to do the study. Then after, suppose you want to do a study on students who are, let's say, smoking marijuana and preparing for exam. So there is 2 groups. One group is smoking marijuana, one group not smoking marijuana. And you want to see who will pass more, a smoker group or non-smoker group. Let's say you want to compare this. So first you will define a study population. That is, study population is exam going students who are living in Gautam Nagar. They are your study population. After knowing a study population, you will go to room and you will ask question on exposure. You will ask that, do you smoke joint? Do you smoke marijuana in any form? So you ask the question on exposure. Suppose you ask it from 100 people, 20 people said, yes, I smoke. So those 20 people who said yes, they are exposed group. And those who said no, they become control group. So when you ask question on exposure, you will automatically get non-exposed group. Because those who said no, they become non-exposed group. So because of asking question from exposed, you also get non-exposed group. When you get both the group, then you start analyzing them in future. What will happen in their future exam? So this is known as doing follow-up. And after you do follow-up, the last step is always analysis of data. In case control also analysis of data is last. Here also analysis of data we do at the last. Okay. So this is the 5 step of cohort. Now in RCT, before starting RCT, we decide some rule for RCT. And these rules are known as protocol of study. Rule like we will say ki no one will leave the study before completion, and no one will take outside treatment. These are some of the rule. So first we give the rule. After giving the rule, we decide our main population from which we have to take the experimental population. Okay, decide the study population and the population on which you apply the result of the study. For example, the study population in our city can be doctors, and the applied population is young age population of India. है ना? So decide study population and population on which you apply the result. And whenever you are taking a study population, take it from that population on which you apply the result. Okay. Now, after deciding the population, then in RCT, we do randomization and we divide them into two groups. So third thing is select them randomly, do randomization. After they are divided in two groups randomly, then we give medicine in one group and no medicine in other. That means we do intervention after randomization. And with that intervention, we will give medicine to one and not to other. Then we start doing follow-up. So in the fifth step, we do follow-up. And after follow-up, the last step is always analysis of data. So whether it's case control, cohort, or RCT, last step is always analysis of data. Second last of cohort and RCT, both is follow-up. Only thing differ is that in RCT, first protocol, then decide population, randomization, intervention, then follow-up, and then analysis of data. So these are the steps. They are asking question to arrange them in the step. Case control, they have already asked in MCI exam. Remember the 4 steps: recruitment, matching, history, and analysis of data are the 4 steps of case control study. Okay. So in case control study, we get odds ratio. And what is odds ratio? Chance of disease out of exposed, chance of disease out of non-exposed. Usually, we write odds ratio as AD by BC. Simply AD by BC we write. And we remember this formula of AD by BC directly without understanding how this concept is applied. And sometime, like in recent INICT exam, they change the table and this formula become useless. So let me show you that question, how they can trick you. In usual question, they write disease, non-disease above. If they write disease, non-disease, then the formula AD by BC is correct. But sometimes they write disease, non-disease here. Disease, non-disease. And they write exposure above. Exposed, non-exposed. This is exposed, non-exposed. Okay. Expose this part, non-expose this part. Suppose we are talking about let's say we are talking about any disease. Suppose we are talking about migraine. So the disease is migraine. No disease is no migraine. And exposure is, let's say, light or sound is the exposure. So in the disease group and non-disease group, both group you have taken 10-10 student. In the disease group, suppose exposure is there in 6 people or 8 people, 6 people. Non-exposed 4 people. In the non-disease, it is 2 and 8. Suppose this is the data came. Now, they ask you to find odds ratio. Usually, we found its odds ratio just by doing cross multiplication, A with D, B with C. And that is why the other name of odds ratio is cross product ratio. So if they ask in exam that which study give us cross product ratio, all the students reply cross sectional, because they say cross product, cross sectional. No, cross product ratio is the other name of odds ratio because of the formula ADBC. But here we don't have to do ADBC, because here disease, non-disease is written here, not on the upper part. So you have to see the table carefully. If they write disease this side, then don't apply the formula. Then go to the main concept. What is odds ratio? Odds ratio means chance of disease out of exposed. So who are exposed people? A and C, 6 and 2, these two are exposed. Exposed are 6 and 2. So Out of 6 and 2, who have disease? 6 have disease. So when I write chance of disease out of exposed, I will write disease 6 above, 2 below. Because exposed are 6 and 2, out of which disease occur in 6 people. Then in the lower part, we are writing chance of disease out of non-exposed. Who are non-exposed? Non-exposed are 4 and 8. But out of 4 and 8, who have the disease? Disease is in 4. 4 are disease. So again, disease out of non-exposed. So we write disease above and 8 below. So 6 by 2 and 4 by 8, if you will solve it, then you will get the answer of odds ratio in this table, not by doing ADBC. So if you do it, this will go above, and if it go above, it turn upside down. नीचे से ऊपर जाता है तो उल्टा पुल्टा हो जाता है. So when you turn it upside down, 6 by 2 will multiply it by 8 by 4. So if you solve it, it will be, of course, 4 will cut 8 by 2 and 2 will cut 6 by 3. So it will come 6 times. So my dear friend, odds ratio is 6 here if they change the table. Okay. So be ready to understand the concept and apply the concept correctly. If they write disease, non-disease above, then you can do AD by BC. Okay. And this is odds ratio formula. I hope you understand. What is the problem in case control study? Problem is recall bias. Actually what happen is कि जो बीमार होते हैं उनको तो याद होता है कि पीछे क्या क्या हुआ है, लेकिन जो हेल्दी लोग होते हैं, कंट्रोल होते हैं, वो दिमाग पे जोर लगाते ही नहीं है खोजने के लिए कि पीछे क्या क्या हुआ है, क्योंकि वो तो पार्टी कर रहे हैं, हेल्दी हैं, तो वो भूल जाते हैं और केसेस को याद रह जाता है क्या हुआ है. When you are suffering from disease, you exactly remember what happened in the past. If you have a breakup, you remember the reason of the breakup. If you have a proposal, good story, you remember the reason. But those students of your class who don't have breakup or makeup, they will not remember the past in so much detail because they are the control. If you are diseased or having something abnormal, you will remember the past, but control will forget about it. This leads to recall bias. Cases remember past history, control forget, leading to wrong result. This is recall bias. And due to recall bias, we don't trust on case control study much. But remember that case control study, we go backward. So we call it backward study, retrospective study. We start from disease, go to risk factor. Main thing is we call it effect to cause. Parinam se karan ki ho, effect to cause. And we can call it outcome to exposure. One more thing is case control study. Remember, it is easy to do for rare disease. If this is a question which being asked again and again, it is not done only for rare disease. We can do case control even for common disease, but it is easy to do for rare disease. Rare disease like cancer. If you are doing a case control study, why throat cancer occur? Is it due to BD smoking? You can just ask the history and within 1-2 weeks you can finish it. But if you want to do a cohort on the reason of throat cancer, you have to take a smoker, thousands of a smoker, follow them for 10 years. Then you will know why smoking lead to cancer. So cohort is very tough to do. It goes in if it is rare disease, cohort is useless. Case control is easy to do for rare disease because case control is finished very quickly and it is very low cost. So it is done quickly, less time, and it is low cost. That's why when I was working in the tribal area of Chhattisgarh, I realized all the field workers, they love case control study because it will be done quickly and then they have time to change the ground reality. But when I was in AIIMS New Delhi, I realized all the professors, they love cohort. Why? Because cohort is time taking, so they will keep getting fund for a long time. And cohort is a stronger study than case control. Case control, due to recall bias, we don't trust on it. Okay. So if you want, I can give you one example of recall bias and we can understand case control better. Suppose there are two groups of patients, one who are having corona, one who are having no corona, no COVID. And you ask the past history of contact, that did you came in contact in last 5 days? So when you ask the past history of contact in last 5 days, this 100 people who are having corona, before you ask, they themselves are thinking, who was that rascal who spread it to me? So in this group, COVID people, they 99 of them recall history. So 99 recall history here, actually all 100 remember. But one person went to such a place which he cannot tell. So 99 gave history here. But in no COVID group, how many of them will remember? They are partying since they got no COVID report. So they will not stress on their brain and remember. Suppose out of this, 50 remember the past history. So here 50 remember the past history, here 99 remember the past history. Now if you put it in 2 by 2 table, in the 2 by 2 table, usually we put disease above COVID-19 and no COVID. And here we are talking about contact history, contact, and then there is no contact. So how many had contact in corona? 99. So if you remove 99 from 100, one person is left without contact. And in the no COVID, 50 people came in contact, 50 people not in contact. So in this table, you have write disease, non-disease above. This is a correct table. So if this is correct table, this is A, B, C, D. Odds ratio we all know is equal to AD by BC. And if it is correct table, it will come by the formula ADBC. So if you apply ADBC, what will come? It will come 99 into 50 by 1 into 50. So 50 cancel out. It will 99 times. And as soon as this report came that contact, if you are having contact, then the chance of corona is 99 times more. All the world applied curfew that if contact is 99 times more spreading corona, why to have contact? But only one country, Sweden said no, this data is coming from case control study which has recall bias. We will not trust on this data because this is an over exaggerated data. Actually both came in contact, but only cases remember it, control forget about it. So that's why this wrong data came. And when they compared the number of cases in Sweden, it was 3 times less case than US, UK, who have the toughest curfew. So all this curfew can be just a useless thing which we did, and it caused so much breakup, so much it lowered down economy of many country, but it was just based on case control study recall bias. So this is case control study recall bias, and this example I hope will make it further clear. Now let's talk about cohort study. In cohort, it's very simple thing. We follow 2 groups in future and we compare what is the outcome between them. So in cohort study, one group is the exposed where risk factor present. One group is the non-exposed where risk factor is absent. Risk factor is not present. So we start with exposed, non-exposed. This is the first thing about cohort. And in the cohort, first thing we found is incidence rate. It is incidence of disease in exposed by incidence of disease in non-exposed. Let me explain it with a numerical example also, because they create numerical from this part, just last to last exam of MCI. The question is, suppose I had taken, let's get personal here. Suppose I am here 100 students who are using PW method and 100 who are using other app or not using any app is no there. So other thing they are using. Okay. And suppose, just I'm not saying it is reality, but suppose I am following them for next 3 months or next 6 months and see how much is the result in the 2 group. Okay. So you already are part of this cohort, and the coaching will compare your result after it is declared. So suppose in the PW method group, out of 100, let's say 80 people passed. And in the other group, out of 100, 60 passed. Okay. So this is 80 passed. This group is the exposed group. People who are doing it from PW method, they are doing something extra. They are exposed. And people who are not doing from PW method, they are non-exposed. So this data came 80-60 exposed, non-exposed. Now, if you keep this data in 2 by 2 table, it will be something like this. The disease we write above. Here the disease is passing. Although passing is a good disease, but it's still the outcome, not the disease here, but the outcome. So we put disease or outcome above. And what was the exposure? PW and other. These are the exposure. PW is also 100, other is also 100. So A, B, C, D, if you add, A plus B is also 100, C plus D is also 100. C plus D are non-exposed and A plus B are those who are exposed. Okay. And we just said that in PW how much passed? 80 passed. In other how much passed? 60 passed. And both are A plus B is also 100, C plus D is also 100, they are equal. So if you get this type of table in exam and they ask you relative risk, so relative risk you can simply find by doing A by C. If you do A by C, you will get relative risk. That means A by C means 80 by 60 you will do, 4 by 3, 4 by 3 means 1.33, that will be the relative risk, simple. So such numerical will become simple if you understand relative risk is A by C. How it came A by C? See, the original formula is incidence of disease in exposed by incidence of disease in non-exposed. Okay, so how many are exposed? Exposed people are A plus B. And out of A plus B, who have the disease, who have passed? A have passed. So A by A plus B we write above. And incidence of disease in non-exposed. So non-exposed are C plus D. And out of C plus D, how many passed? C passed. So the original formula of relative risk is A by A plus B by C plus D. This big formula is there. But because A plus B, C plus D both are common, both are 100, 100, they cancel out. And we got final formula A by C, and A by C means 1.33. That means there is 1.33 times more chance. It means that the risk of passing is 1.233 times more if you study from PW. Like this they will say. So this is relative risk. Remember the formula, incidence in exposed by incidence in non-exposed, and it is A by C. Simple, you can do it in the exam. And incidence exposed by non-exposed. But there is one more thing which we have to know. The second thing is attributable risk. Attributable risk is incidence of disease in exposed minus incidence in non-exposed. This minus sign has been gone from here, so let me write it correctly. And I should remove this page also. What is attributable risk? देखो, इसको मैं simple शब्दों में समझाता हूँ. If I ask you here, see, as soon as this result will come, PW will start advertising 80% student pass due to us. So does all 80 pass due to PW? Can you give credit of all 80 student pass to PW? You cannot give credit of all 80 to PW because 60 have passed by themselves also. So not all 80 passed due to PW. Only 20 people, 20 extra passed due to PW. And only 20 extra passed due to PW. And out of total 80 who passed in PW, you can give credit of only 20 to PW. Why? देखो 60 तो बिना उससे पढ़े भी पास हो रहे हैं, तो पूरे 80 के 80 PW के चलते नहीं पास हुए हैं, क्योंकि 60 बिना उससे पढ़ के भी पास हो सकते थे. तो सिर्फ 20 रिजल्ट का क्रेडिट PW ले सकता है. Only 20 out of 80 credit PW can take, because 60 can pass even if they study from other coaching. So only 20 out of 80 has passed due to PW. And how we got 20? How this 20 we got? To get this 20, we subtracted 80 and 60. Then we got this 20. So what was this 80? This 80 was passing rate in exposed. 80 was incidence in exposed. And when you subtract incidence in exposed with incidence in non-exposed, when you subtract 80 and 60, then you get 20. And you are comparing it with incidence in exposed total 80 people. So this is the formula of attributable risk. What is the formula of attributable risk? If I want to write, attributable risk is incidence in exposed minus incidence in non-exposed by incidence in exposed into 100. So if I am writing exposed minus non-exposed by exposed, This is giving us attributable risk. Attributable risk means how many pass due to this coaching, or how many disease occur due to this exposure. And we cannot blame all 80 passing on PW. Only 20 extra happened. And how 20 came? When we subtract exposed with non-exposed. So do remember this definition. Attributable risk is exposed minus non-exposed by exposed into 100. Okay, this is attributable risk. And the last thing which we use in this thing is population attributable risk. What is population attributable risk? Population attributable risk formula is incidence in population, in the whole population, how much new case occur, minus incidence in non-exposed, divided by incidence in population, multiplied by 100, same 100. So if you look in the formula of attributable risk, in place of population, there were exposed. If I use exposed, it will become attributable risk. If I use population, it will become population attributable risk. That is the difference. In attributable risk formula, what was the thing? In attributable risk, it was incidence in exposed minus incidence in non-exposed by incidence in exposed into 100. So you can see the difference between these two. In these two definition, very simple thing. If I change the word population with expose, PAR will become AR. If I change population to expose, PAR become AR. So in exam, whenever they will give you a question on PAR, they will use the word that this disease or this thing decrease by this much in population. Decrease by some percentage, let's say 30%, 40%, 60%, decrease by 33% in population. So if they use 33%, decrease by 33% in population, it is definitely population attributable risk they are talking. If they use the word decrease by, it is PAR. Let me explain all these three terms, AR, PAR, with a very simple example. And here also don't look at this definition because they forget to write the minus sign. It is my error, my typing error, kindly forgive me. Let's take a real example. The real example is, let me give you a real example. Okay. The real example is, suppose in a population, there are 100 alcoholic driver who drink and drive. And there are 100 non-alcoholic driver who never drink and drive. Now, I started following them for 1 year. And in 1 year, I found that in the alcoholic driver, 10 accident occur. In non-alcoholic, 5 accident occur. Okay? 5 accident here, 10 accident here. So let's find one by one all the three things. First thing is relative risk. What is relative risk? Incidence in exposed by incidence in non-exposed. This alcoholic driver, they are exposed, and non-alcoholic driver are non-exposed. तो आप खुद ही देख के बताओ ना, एक तरफ 10 एक्सीडेंट हो रहा है दरुओं में, एक तरफ 5, तो दरुओं में कितना गुना ज्यादा एक्सीडेंट हो रहा है? Alcoholic are doing 10, non-alcoholic are doing 5. So alcoholic are doing how many times more accident? 2 times more accident. Because exposed is 10, non-exposed is 5. So it will come 2 times. So when they use relative risk, they will use the word time. So it's 2 times more accident. This is what relative risk formula is there. Now, when I use attributable risk means I want to know that out of this 10 accident, which occur in exposed people, in alcoholic people, 10 accident occur. Out of 10, how much you can blame on alcohol? Can you blame all 10 on alcohol? No, you cannot blame all 10 on alcohol, because 5 accident will occur even if you are not alcoholic. So 5 accident is due to other reason. Only 5 out of 10 is due to alcohol. 5 out of 10 is attributable risk. And how you got that 5 out of 10? If you subtract 10 with 5, then you get 5. 5 out of 10 is due to alcohol. So that means which two you are subtracting? You are subtracting incidence in exposed with incidence in non-exposed. So if I say incidence in exposed minus incidence in non-exposed by incidence in exposed, this becomes the formula of attributable risk. And wherever they use the question attributable risk, they will talk about only exposed people. Denominator is also exposed. So exposed minus non-exposed by exposed, this is attributable risk. And in our example, how much it will come? 5 by 10, because 5 accident out of 10 is due to alcohol. तो कितना परसेंट एक्सीडेंट दारू की वजह से हो रहा है? 10 में से 5 का इल्जाम लगाया जा सकता है. 5 out of 10 is due to alcohol. So 5 out of 10 into 100, that means 50%. We can blame 50% accident is due to alcohol. 50% is accident due to alcohol. So when we use due to word, it is generally attributable risk, but sometimes they can confuse you. Remember this trick. If they use the word exposed, then it is attributable risk. But if they use the word population, always the answer is population attributable risk. And here population attributable risk will come 33%. I need not to calculate it. The calculation will become very tough. But remember, if it is 10 and 5, half, then PAR come 33%. 33% means if people stop drink and drive, then accident decrease in population by 33%. If population stop drink and drive, stop drinking and driving, accident decrease by word होना चाहिए, तब PAR मारोगे. Accident decrease by 33%. So when they say decrease by how much in population, this is PAR. And what is the formula of PAR? Incidence in population minus non-exposed by population. You just have to change exposed by population. That will become the formula of PAR. So I hope this formula and these three things is clear to you. Now, before moving ahead, let me tell you one more question from this topic. They are asking question from incidence rate, cumulative incidence question. They will create question like this. Question is that in a population of 10,000, 100 have 1,000 have hepatitis already. 1,000 have hepatitis B. Okay? 1,000 ज़्यादा नहीं होगा, ठीक है होने दो. 1,000 have hepatitis B and 2,000 are vaccinated. If suppose 500 new case of hepatitis occur this year. If 500 new case of hepatitis occur this year, find incidence. They will say find incidence. And if they say find incidence or find cumulative incidence, incidence or cumulative incidence is same thing. Incidence or cumulative incidence both means incidence or cumulative incidence have the same formula. Their formula is new case by population at risk. So, what is the new case in this story? New case is 500. You will put 500 here. And how much is population at risk? Total population was 10,000. But out of 10,000, how many were vaccinated? Vaccinated is 2,000. And 1,000 people are already suffering. So those who are old case, they cannot be at risk of new disease. So the and then you can multiply it with 100 if you want answer in percentage. Sometimes they also multiply by 1,000, but if answer is in percentage, you multiply by 100. So what will be the incidence which will come out? 500 will remain like this, divided by 10,000 minus 3,000, 7,000 multiplied by 100. So if you try to solve it, This will be the answer. है ना? On solving, something will come and that will be there. Let's do the solving anyway. 3 0 will cancel out. Finally, it will be 50 by 7. 50 by 7 means 7 times 49. So it's, you can say 7 with 50 is, you are getting 7%. And so incidence is coming 7%. So this is the way to find incidence in such question. New case by population at risk. This is incidence or cumulative incidence. But sometime they create question from incidence rate. What is incidence rate? Incidence rate is simply new cases we write, but we divide by population. Not this time, we do not write population below. This time we write patient, number of patient, and how many times they suffer. Number of patient multiplied by time in month or year. Multiplied by time. This gives us incidence rate. And we can usually multiply incidence rate by 1000. So basically only one question has came on incidence rate till now in MCA exam. The question was total new cases added over time is known as. Whenever you get the question of time added over time, then it means they are talking about incidence rate. Added over time, incidence rate. When you see the word time, then incidence rate. Because in cumulative incidence and normal incidence, it's only new case by population at risk. They are not adding time. And here also you can multiply it by 1000, but you can also multiply by 100 if you want answer in percentage. So 100 or 1000 they can use. Mostly they use 1000. If they use 1000, it will become 70. If they use 1000, it will become all 1000. If they use, then it will become 500 by 7, 70%. But then answer will not be in percentage. So remember, incidence or cumulative incidence are almost the same thing, but incidence rate is different. In incidence rate, we have new cases over time, added over time. That is incidence rate. So this is cohort study, and in cohort study, there are two problems which occur: attrition bias and Hawthorne bias. Attrition bias means cohort study is a long time taking study. So before the study complete, many people they leave the study. This is the problem. One group of participant leave, one group continue. We call it attrition. Chhod ke bhag gaye. That is attrition bias. Hawthorne bias means whenever they do the study, all the participants know that they are under researcher observation. So their behavior change and we get wrong result. For example, and that's why we call Hawthorne bias as attention bias. For example, suppose you are in a mall or in a theater or somewhere and you suddenly notice that the girl you like is looking at you. If you are a boy, you will be like, yeah. And you will be talking with your friend with more hand gesture. And similarly, if you are a girl and you know that the boy you like is giving attention to you, you will be like, huh. And you will be playing with your hair, with your eyes. Why? Because when you are under attention, your behavior change. So result never come natural. These two problems occur in cohort study: attrition and Hawthorne bias. Okay. Now, we call cohort study as prospective, forward, follow up, longitudinal, because we are going in forward direction. But main one word you have to follow here is incidence study, follow up study. Incidence means new cases. When you will have your new boyfriend or new girlfriend in future or in past. Of course, past is X and X is gone. So new girlfriend, boyfriend will only be in future. That's why cohort study only can tell about new case or incidence, because new only in future. So incidence, new cases. But main thing is cohort is cause to effect. We start with reason, go to outcome. This is the main component of cohort. Okay. Now, let's talk this cohort. Remember, at the beginning exposure is there, but outcome is not there. This is about cohort. When we start cohort, exposure present, outcome absent. When we start case control, when we start at the beginning of case control, we know nothing about exposure. Exposure not known. At beginning of case control, we only know outcome, but we don't know exposure. Let's do a question, very twisted question on this concept, which when came in exam, I was also wrong. This was the question. The question is कि यू आर वर्किंग एट ए पीएचसी, आपको अचानक से एक दिन पीएचसी पे गांव के लोग आए और बोले कि डॉक्टर साहब हमारे गांव की जो फैक्ट्री है पास वाली, वो अपना गंदा पानी हमारे पानी में मिला रहे हैं गांव के, इसके चलते हमारे गांव में बहुत कैंसर के केस हो गए हैं, तो आप केस कंट्रोल स्टडी करके इन फैक्ट्री को अपना कचरा हमारे पानी में ना मिलाएं, इससे रोक दो। तो अगर आप केस कंट्रोल स्टडी करने का इस टॉपिक पे सोच रहे हो तो किसको कंट्रोल की तरह लोगे? Villagers of nearby village came and they said ki sir, our cancer is coming more due to industrial pollution mixed in our water. Do a case control and stop this from mixing it. So if you are doing case control, who you will take as control? किसको लोगे कंट्रोल की तरह? Let's start with option D. Can you take all village children with ALL as control? Yes or no? देखो, with ALL means they are the people having disease. And disease people are case. Disease people are never control. So we can never take with ALL as control. Option D is gone. Now if you look at option A and B, in A they are writing everyone is exposed. In B they are writing everyone is non-exposed. But in a case control study, in the beginning we know nothing about exposure. शुरू में ही अगर हमें पता चल जाएगा कि सारे लोग एक्सपोज नॉन एक्सपोज हैं, तो हम पास्ट हिस्ट्री किस चीज की लेंगे, हम पूछेंगे क्या, है ना? सो रिमेंबर, इन ए इफ वी नो एट द बिगिनिंग दैट ऑल आर एक्सपोज, ऑल आर नॉन एक्सपोज, देन व्हाट पास्ट हिस्ट्री वी विल टेक, व्हाट वी विल आस्क? देयर इज नथिंग टू आस्क. So in the beginning, exposure can never be known in case control study. So the correct answer is you will take mixed population of children from nearby OPD without ALL, है ना? You will take cases of nearby OPD and all these children should be without ALL, है ना? Sorry, without ALL. Without ALL, you will take the mixed population of children from nearby OPD. So this is the concept which I was telling, what I was saying, कि if you do a case control, at beginning exposure is not known. And in option A and B, they were saying exposed, non-exposed. So at beginning, how can you know about exposure? So that's why only option C was correct. You have to take cases from nearby OPD, which has mixed type of cases, and then after history you will know how many are exposed, how many are not exposed. Okay. Now let's do some more question. But on case control and cohort, let's do some question. Then we will come back and discuss this next topic again. First thing is, this question is a PYQ of MCI exam. Online food ordering is causing obesity. So suppose you are doing a case control study on this topic. In a case control study, what you will take as two group? What is happening? You are ordering food online causing this disease obesity. Starting of the story is online food ordering. End of the study is obesity. So in this study, if you are doing case control, which two group will you take? Obese, non-obese will be two group, or online food ordering or non-food ordering is the two group. Which two group you will take? See my dear friend, obesity is the outcome, obesity is the disease. And when we talk about case control means disease or outcome present, disease or outcome absent. So if it is case control will be obesity present, obesity absent. Here ऑनलाइन फूड ऑर्डरिंग कारण था, ऑनलाइन फूड ऑर्डरिंग वाज रिस्क फैक्टर एक्सपोजर. So if I am saying exposure present absent, it is cohort. If I am saying online ordering present absent, this will be correct for cohort. And if I say obesity present absent, this will be correct for case control. Let me have one more example here. I will come to this question, but let's do some question on cohort case control first. This is a very good question here. Question is, excess use of social media is associated with depression. So a story is starting with excess social media, ending with depression. Now, in a study, participant having depression is compared with participant without depression in terms of their social media use, that how many hours you use, they have asked. But the two group is, one group participant having depression, one group without depression. So if this group is depression, non-depression, this is a case control study, option A, or this is a cohort study. And it cannot be cross-sectional ecological, because cross-sectional ecological is for one group, one population. Here we have definitely two group. So it can be case control or cohort only. Which type of study is it? Is it case control or cohort? Because we are having depression compared with without depression. So which side you will put? Case control, cohort? So how much time we have left? 15 minute more classes. Okay. So dekho, my dear friend. Anyway, we have discussed the biostat completely, health program completely, epidemiology is going to end. So we have discussed the main confusing part. Of course, some small topic are left, but we have covered the main part, three main pillar of PSM: health system, health program, then biostat and epidemiology. So here, focus first that a story is ending with depression. Depression is the disease. And one group is having depression, one group without depression. So that means one group is case, having depression is case, without depression is control. This is case control. If it is cohort, in cohort the two group will be access social media and not access social media. So if you have access social media, not access social media, it will become cohort. If you have depressed, non-depressed, डिजीज नॉट डिजीज, इट इज केस कंट्रोल. बहुत सिंपल सी बात है. अगर शुरुआत कारण का दो ग्रुप है, कोहॉर्ट है, और अगर कहानी का जहां एंड हो रहा है परिणाम उसका दो ग्रुप है तो केस कंट्रोल. इफ द एंड ऑफ द स्टोरी हैव टू ग्रुप, केस कंट्रोल. इफ द स्टार्टिंग ऑफ द स्टोरी हैव टू ग्रुप, कोहॉर्ट. लेट्स डू वन मोर क्वेश्चन हियर. वी विल कम टू द क्वेश्चन. क्वेश्चन इज दिस. क्वेश्चन इज कि अल्कोहल एडिक्शन, if it is there, it can cause divorce. Okay, now you have two group. First group, you have two group. What are the two group here? One group is people who are divorced and they are compared with participant without divorce. So there is two group, divorce without divorce. Simple thing, two group. So if divorce not divorce are the two group, which type of study is this? Two group are with divorce, without divorce. So which type of study is this? Divorce without divorce are two group. Case control or cohort, that's what is the main confusion. देखो, starting point is alcohol. If starting point has two group, alcohol addiction present, alcohol addiction absent, this will become cohort. But here alcohol addiction absent present is not the two group. End point is divorce and two group is divorce without divorce. So two group is outcome present absent, and if outcome present absent is two group, what is the answer? Case control. Okay, if we have alcohol addiction present absent, it will become cohort. If we have divorce present absent, it will become case control. So like that, you can easily identify such a study. Let's have one more question here. The question is, if you use steroid excess, it can lead to diabetes. So how you have to think? If the two group is diabetes present absent, case control. If the two group is excess steroid present absent, cohort. And now in the story they are saying that there are some people who take from quack who gave excess steroid, and some people take treatment from PHC who don't give excess steroid. So one group who is taking excess steroid, one group not taking excess steroid. So they have two group with risk factor present absent. So this is a story of, yes, you are right, cohort study. If you want to make a case control, then the two group will be diabetes present, diabetes absent. Diabetic, non-diabetic. If this is the two group, then it will become case control. Okay, so this is a cohort study. Very good, you know it. Now this cohort study can be of two more type. The cohort can be retrospective cohort, which is also known as historical cohort or mixed cohort. So let me explain this point to you. What is retrospective historical cohort? They have asked this question also in the past. And that if in any question, they give you this word past written record or work record data, then it is historical or retrospective cohort. Let me explain with an example. Suppose in your batch, Dr. Let's say Dr. Harun, he got a very top rank and he found radiology branch and he is giving a big party after taking radiology. And in that party, we have the Nand Hiren came in the party of Harun, and Dr. Nand Hiren said, Ki, why are you giving party? Don't you know that based on 10-year work record data, radiology staff have 1.2 times more risk of testicular cancer. So what Dr. Hiren said to Dr. Harun, कि तेरे टट्टे खतरे में है और तू पार्टी दे रहा है. There is 1.2 times more risk of testicular cancer in radiology staff as compared to other staff. Okay, so this example which I created here, in this example, Dr. Hiren is not taking any personal history. If you ask personal history of past, it become case control study. We are not asking personal history here. We are using written record of 10 year. We are only going in history. Hello. Sir. Okay, so this is one more question which has came from this topic, that aniline dye factory worker have 9 times more risk of bladder cancer as compared to office staff based on 20-year work record data. So now which study is done here? Which study is done here? In this question, you cannot see any follow-up written. There is no follow-up. So mixed cohort, normal cohort is gone. You are only getting work record data. And if only work record data is there, then this type of study is retrospective cohort. So do remember, my friend, if you got only work record data, retrospective cohort. But in such question where you got future follow-up plus written record data, it is nested case control or mixed cohort. Okay, so here we finished cohort, case control, cross-sectional, ecological study, and I hope you will be able to identify these two study, and those question also you can do. Of course, some part is left, but revising the whole PSM is very tough, and I was not able to do it completely due to in between some technical power cut error from my side. So I try to do my best, and I have only one suggestion for you people. Before going to exam, my request to all of you is do 5 to 7 year of NEET PG. If you do NEET PG 5 to 7 year with explanation in this last 5 days, if you did it, then you will find many questions coming directly from them. You have done 2-3 year, no, that's not sufficient. Do 5-7 year. You have 5-7 days, you can do it. Plus try to do it at the same time when you give real exam, and do it year wise. Don't do it subject wise. Same time as real exam. Your real exam start with 9 to 11:30, and then second session 1 to 3:30. In the same time, do 150 question, because at your home in last 5 days, if you are doing 300 question, in exam without anxiety you will attend 300 question, and you will also revise this last 5-7 year of NEET PG question. So do it year wise and do it at same time as exam, and it will remove all your anxiety also, and many questions come from these questions directly also and from their explanation also. So this is one and only request. It can, if now your GT score are coming 120, 130, with last 5 days, if you do 5 to 7 year of NEET PG, your score can jump to 170, 80 easily. This one activity can make your GT score jump by 40-50 marks if you have done it year wise with explanation. Okay, so this is one request which can actually make you rock the exam. If you have anything you want to say, feel free and say it. Sound was gone, but I have given the example and you have understood the example. So very good, like smooth. Okay, thank you so much. And if you still have some doubt or anything you want to say or complain or anything you want to ask, any support, anything, feel free to call me directly on my number. You can also connect me on PW Medic Telegram group, but this is my personal number, only one number, you can use that. Love you all, keep rocking, and don't be worried, no one go in exam with perfect preparation. Everyone preparation is incomplete. So enjoy the journey, do this PYQ and your score will be rocking. And in this PYQ explanation, you will cover all the minor subject, all the subject which you have not revised. Even those important topics you can cover through this PYQ. Okay, so thank you so much. Bye bye. Tasvidania. Bye bye. Thank you.
Yes, good evening. Good evening, everyone. Sharma. So as you know, forensic medicine is one of the scoring subject, one of the most interesting subject among the 19 subjects. Around 10 to 12 questions in any exam. Last INSCT exam, they asked around 12 questions from forensic medicine. Most of them are one-liners and from the standard concepts. Yes, Shashikant, I'm audible. Audio, video, is it clear? Is it clear? Just say hi. Good evening all. Good evening. Sharma, Shashikant, Himalayan. Are you there? Shall we start? Yeah. So as you know, forensic medicine is application of medical knowledge in administration of justice. That is forensic medicine. So in this session, we are going to discuss about the most expected, repeatedly asked questions in your FMGE exam, especially PYQs and PYT, previous year topics. So we discussed many important topics in FMGE Predicta series. In this session, we are discussing some new topics basically in around 90 to 120 minutes. Yes, chalo, Shashikant, let's start. So as you know, the forensic workbook is given to you, and I'm going to discuss all the topics in the manner of MCQ. Let's make it interactive. So whenever the question is shown on the slide, you try to answer. Okay. So which of the following define offenses and punishment? So offenses can be anything. So it can be a rape, murder, criminal abortion, assault, gang rape, anything. And the punishment, as you know, punishment can be death sentence, life imprisonment, rigorous imprisonment, fine, simple imprisonment and all. So options are BNS, BNSS, BSA and TOTA. So what would be the best answer? Can you try? Can you try, guys? Yes. So the TOTA is not the answer, because TOTA is basically Transplantation of Human Organ and Tissues Act, that is organ transplantation. BSA is Bharatiya Saksha Adhiniyama, basically related to evidence, like 26A BSA, that is dying declaration. BNSS, that is Bharatiya Nagarika Suraksha Samhita, that is basically related to the criminal investigation and the trial. So the best answer is BNS. So BNS is Bharatiya Nyaya Samhita, which define offenses and also gives the punishment. Like example 63 BNS, definition of rape. 64 BNS, punishment for rape. So this can be your FMGE question. Yes, fine. Chalo. Now let's discuss all important sections in one slide. Like example 63, very commonly asked. What is 63? 64, 66, 7, 8, 70 and 71. 63 is definition of rape. The rape definition includes penetration, insertion, manipulation and application. The statutory rape means when victim age is less than 18 years. 64, that is punishment. '66, rape and murder. '67, related to husband and wife. The husband having intercourse with wife without her consent during separation, during legal separation, when court case is pending in the court of law. So 67 basically that is related to husband. Okay. Then 68, that is sexual intercourse by person in authority. 68, that is in authority. Authority, you can remember. It is sexual intercourse or sexual offense. 70, that is basically gang rape. The gang means more than one person. Like example, Nirbhaya gang rape case. 71 repeat offenders. Repeat offenders, one who is doing the same crime repeatedly. So that is basically 71 BNS. So all these are commonly asked in the exam. Then 88, 90. Can anyone answer what is 88 and 90 BNS? Can anyone try? What is 88, 89 and 90 BNS? They are related to childbirth. They are related to pregnancy, childbirth, fetus and all. Yes, can anyone try? What is that? Gaurav? So 88, 89, 90, that is related to criminal abortion. Criminal abortion with consent, that is 88. Without consent, 89. When there is a death of the pregnant, that is 90 BNS. So very commonly asked in FMG exam. Okay. Yes. Then 22 BNS. The 22 BNS is McNaughton's rule. That is criminal responsibility of insane person. That is 22 BNS. Previously it was 84 IPC. Now it is 24 BNS. Very commonly asked. Shashikant, very good. 227. 227 very commonly asked in FMGE. Something related to courtroom proceeding. Telling lie in court of law under oath. So 227 is definition of perjury. 229 punishment for perjury. So both are very important. Perjury means telling lie, giving false evidence in court of law under oath. Okay? Yes. 103, that is definition of murder. Definition and punishment. So what are the components of murder? What is the punishment? Punishment can be death sentence. It can be life imprisonment. That is 103 BNS. 116, grievous hurt. Very commonly asked. Grievous hurt. That is serious injury. Gor agat karna. That is 116 BNS. 106, criminal medical negligence or criminal negligence. Okay. So what is the punishment? Punishment is 2 years of imprisonment. 108, abatement. Abatement for suicide. So helping someone to commit suicide or torturing someone to commit suicide is abatement. So the punishment can be 10 years of imprisonment. Abatement. 114, it can be asked in exam, that is definition of hurt. So what is hurt? That is given in section 114. 124, try to remember vitriolage. So also known as acid attack. So that is punishable under 124. 72, this can be an MCQ. The 72 is revealing identity. Revealing identity of rape victim. The punishment can be 2 years of imprisonment. So 72 can be asked in your upcoming exam because this topic is favorite of FMG. The examination of victim of rape. Every year there will be a question. Okay, 72 BNS, the punishment is 2 years of imprisonment. Revealing identity, the name, address to the media or any person without her consent, without the consent of the police or magistrate is known as 72 BNS. Okay, very good, Pavitra. Then we have some more section, 194. Can anyone try what is 194 BNSs? So Pavitra, can you try? Shashikant, 194. 194 is basically police inquest. (196) magistrate inquest. Then 84, the examination of victim of rape. 52, that is examination of accused of rape. Commonly asked. Then one more, 26 BSA, that is dying declaration. Dying declaration. BSc. So this is very, very important slide. You need to remember. Okay. Yes, Pavitra, Shashikant, very good. So peaceful warrior. Yeah. Again, the question asked, what is inquest? Inquest means the inquiry towards cause of death. As you know, cause of death in case of hanging is asphyxia. Cause of death in case of strangulation can be asphyxia, drowning asphyxia, burn injury septic shock. So inquest means inquiry, and it is the most common inquest in India. So magistrate inquest is the best inquest in India. There are certain indications. Can anyone try? What are the indications for magistrate inquest? Magistrate inquest, try. Let's discuss a few more important points here only. Magistrate inquest indications are 3 indications. So try to memorize. One is dying, that is dowry death. Remember dowry. The second one, exhumation. Death in custody. It can be police custody. It can be in psychiatric hospital. Okay, so death in custody. So this can be asked in your exam. Very, very important funda. Yes, Pavitra, very good. Now try to memorize. 116 is favorite of examiner, FMG exam. So it has 8 clauses, 8 sub clauses, and in the 8th clause, it is severe bodily pain for about 15 days. So this can be question asked. 15 days. So previously it was 20. Now in BNS it is decreased to 15. So try to memorize 15 days. That is the 116 BNS grievous hurt. Yes, chalo. Smooth specialist. That's okay. Okay, fine. All of you okay? Any doubt in this slide? Any doubt in this slide? You can ask me. All these are important section and most favorite of FMGE. So in one slide we're discussing all important questions. Yes, smooth specialist, Shashikant, Pavitra, Akhil. हाँ 15 days hospital. ठीक है, बढ़िया, बहुत बढ़िया. ठीक है, आपको memorize करना पड़ेगा 63 to 64 to all this. You can take the screenshot also and you can memorize. Okay, once or twice before the exam. चलो आगे देखते हैं. Now look at this question. This is a very interesting question. Husband having intercourse with wife. The wife age less than 18 years. Amounts to rape if case is filed within 1 year of sexual intercourse. Is it true or false? True or false? Shashikant. So the age of the wife is 18. Anyway, the marriage is invalid. As you know, the minimum age for marriage is 18 years. That is basically in girls. Boys it is 21. The legal age for giving consent for sexual intercourse is 18. Here wife is minor wife as per the birth certificate, as per the other card. My question, is it a POXO case or what it is? Is it rape or what? Yeah, okay, chalo, okay, no problem. True, yes, answer is true. So answer is true. Try to memorize juvenile. So FMGE favorite. Let me discuss here. FMGE favorite. Juvenile. So juvenile means male or female less than 18. Point number 1. Statutory rape. That is basically less than 18. Here one more question asked, very commonly asked. Medico-legal examination. Examination of victim of rape. The minimum age is 12 years. So answer, remember, 12 years. So any girl of more than 12 years can give valid consent for medical examination, including medical examination in case of rape. 12 years is the correct answer. Okay, so this you need to memorize. Yes, POXO. Yes, very good. So it can be POXO also under the penetrative sexual assault also. That's fine. चलो आगे देखते हैं. Now this is very interesting question. The question from Dhurandhar movie. You must have seen Dhurandhar 2. The poison shown in the movie, that is basically slow neurotoxic agent which affect the basal ganglia, which causes tremor, which causes Pink's disease, it causes acrodynia, minimata disease. What is that basically? Is it arsenic, thallium, diethyl mercury and cyanide? Chalo, can anyone try? This is something very interesting question, guys. Arsenic is known as king of all poison. It resembles like cholera. Drug of choice, ball. MCQ and FMGE. So thallium is known as king of all poison. He is also king, and thallium causes Aldrich-Meesline. Aldrich-Meesline, MCQ asked in FMGE. Neuropathy, alopecia, Aldrich-Meesline, classical of thallium poison. Cyanide poison, so one of the ideal suicidal, ideal homicidal, and death occurs immediately because of inhibition of complex 4 of electron transport chain. So what are the drugs used in cyanide poison? FMGE favorite. Remember amyl nitrate, sodium nitrate and sodium thiosulfate. So what is the best answer for this question then? So the best answer for this question is diethyl mercury. Yes, very good. So this is one of the very toxic agent. It is a neurotoxic. It affects all the system, and the very interesting part of this is very small amount can lead to death, and it affects all the system. And diethyl mercury is lipid soluble. So it can get absorbed into the circulation through the skin. Mercury poisoning very commonly asked in FMG. It is known as Pink's disease, acrodynia, minimata disease. The most common feature is the tremor, mercurial lentis, erythism and all. Commonly asked in exam. Try to memorize after the class. Yes, good. Chalo, ho gaya. Then next question from asphyxia. As we discussed in predictor series, following is a surest sign of antemortem hanging. Say hanging can be complete hanging or it can be partial hanging. So it can be autoerotic hanging. The cause of death is asphyxia. Surest sign of antemortem. The antemortem means the person was alive at the time of hanging. Dribbling of saliva. Yes, ligature mark is very important feature but not the surest sign. Lay face is sympathetic, one eye is open, other eye is closed because of the compression of the cervical sympathetic chain, not the answer. Head-bone fracture, outward compression fracture very common in case of hanging. So that can be seen in case of hanging but not the surest sign. So the answer is not the head-bone fracture. Dribbling of saliva is the correct answer. The dribbling of saliva opposite to the site of knot. So that is the classical feature very commonly asked. If dribbling of saliva is there, that means it is antemortem. Usually it is suicidal hanging. Okay, so this is what you need to remember. Chalo, ho gaya. Now look at this question. This question, look at this. This is a very interesting picture. Again, one eye is open, other eye is closed, and this is basically knot. What is this finding? Image based question. So this is known as lay faces sympathetic. It is because of compression of cervical sympathetic chain. It is seen in around 20 to 40% of the cases. It is usually antemortem. Okay, antemortem. And try to memorize, in case of hanging, the ligature mark is oblique. In case of strangulation, the ligature mark is horizontal or it can be transverse and complete. Very, very important FMGE question. So try to memorize this. So this is the ligature. Okay. Can anyone tell me what is the common fracture of hyoid bone in hanging? Hanging, what is the type of fracture? What is the fracture in case of strangulation, especially manual strangulation? Can anyone try? What type of hyoid bone fracture is common in hanging? What type of hyoid bone fracture is common in case of manual strangulation? We call it as throttling. Yes, try. Good. Akhil Reddy, Amit, Peaceful Warrior, Pavitra. So all answering, that's great. Great, great. Chalo. So in case of hanging, it is outward compression fracture. Outward compression fracture. In strangulation, it is inward compression fracture. So very, very commonly asked. Akhil Reddy answered very well. So extraversion, intro, that's okay, inward and that. And in case of judicial hanging, so C2 fracture is very common. We call it as hangman fracture. So what is hangman fracture? That is fracture of the C2. And one more very commonly asked NEET PG question that can be asked in your exam, Amsuth sign. Amsuth sign. The Amsuth sign is transverse tear in carotid artery. So tear in carotid artery is known as Amsuth sign. The Simmons sign is hemorrhages at the vertebra. And in case of partial hanging, the ligature mark can be horizontal. The cause of death is asphyxia and venous congestion. Sometimes it can be cerebral anoxia, vasovagal inhibition also. So hanging is favorite of all examiners. Good, good answer. Bahut badhiya, Akhil Reddy, that's great. Next. Now look at this, try to answer. It's a case of hanging and there is a fracture. My question is, what is this? Is it outward fracture, inward fracture? You can see here, this is the fracture site. This is outward compression fracture. Outward compression fracture commonly seen in case of hanging. Chalo, theek hai. Then the manner, very commonly asked. The manner is one more favorite of examiner. Manner of death in autoerotic hanging. Autoerotic hanging means sexual hanging. The death during masturbation. So especially in case of males, it can be seen in females also. It is known as quadsvarism. It is commonly associated with transvestism and petichism. The manner is suicidal, homicidal, accidental, judicial. So can you try, guys? Can you try this? Swajit Kumar, Amit Sam. Suicidal is the most common in India. Suicidal hanging. In fact, it is the most common method of suicide, that is hanging, most common. In suicidal hanging, the common features are depression and psychological autopsy, no injuries on the body, dribbling of saliva. So usually partial hanging or sometimes complete hanging. So suicidal, commonest one. Homicidal, that means that is the murder. It is known as lynching. It is named after William Lynch, an American captain. Accidental, especially in case of autoerotic hanging, so or sexual hanging. So judicial, so as you know, judicial is legal. legal execution, the most common fracture is hangman fracture. So C2 fracture is very, very common. So this is frequently asked in the exam. So the answer is accidental. Good answer. Try. So good, Swajit Kumar, peaceful warrior. That's great. Okay. Now the question can be asked, what is the classical feature in autoerotic hanging? Can anyone answer? What is the classical feature in this? Look at this image. What is the classical feature or one of the surest feature of autoerotic hanging? So this can be asked in your upcoming exam. Remember, the answer is safety mechanism. In this picture, what we can see, there is some sharp object, knife in the hand. That is basically for removal of the ligature in case of accident. That is known as safety mechanism. The presence of safety mechanism, one of the classical feature of autoerotic hanging. So this can be asked in your exam. And try to memorize. This can be seen in females also, but it is very common in males. Okay. Fine. So why mirror? Basically, it is to see his act. So it is commonly associated with autoerotic hanging. In my experience, I've seen maybe 5 or 6 cases. In all the 6 cases, we found mirror, we found partial hanging, safety mechanism, and sexual material at the crime scene. Autoerotic hanging, something accidental death. Okay? Yes. Camera 2. That's okay. Chalo. Ho gaya. Next question. Injuries caused by blunt force except. Blunt force. Like example here, the blunt force. So this is sharp force, knife. So what are injuries caused by blunt force and sharp force? Very simple. So abrasion, bruise and laceration caused by the blunt force. The stab wound is the correct answer. Very simple. Very, very simple. Now, very commonly asked question is abrasion. Abrasion is the most common mechanical injury. It is of 4 types. Scratch abrasion, graze abrasion, pressure abrasion, imprint abrasion. So scratch abrasion commonly seen in case of rape, strangulation. Graze abrasion commonly seen in road traffic accident. Pressure abrasion in case of hanging and strangulation. Imprint abrasion, like example tire mark. So imprint and pressure are type of pattern abrasion. So bruise basically known as contusion. So very commonly asked question is examples for contusion, like example raccoon eye. Raccoon eye, very commonly asked. Battle sign, sixpenny bruise, sixpenny bruise. Then the question can be delayed bruise. So there are many types are there. So the bruise heals within 2 weeks. Abrasion heals within 1 week. Color changes, very commonly asked in the exam. Bruise, remember the mnemonic RBBGY. RBBGY. So we discussed in predictor series. R for that is red color, B for blue, B for brown, then become green color, yellow color, completely heals within 2 weeks. So laceration. So I'm not sad. Okay, smooth laceration. I'm not sad. I'm happy. I'm totally happy. Don't worry. So laceration, there are 4 types: split laceration, stretch laceration, avulse laceration, split, stretch and avulsed, and one more is tear laceration. So there are basically 4 types are there. Okay, thank you smooth specialist. So making me happy. I'm not sad actually. Anyway, you identified. That's great. Chalo ho gaya. Stab wound can be of 3 types again. One is penetrating, perforating, and one more is punctured. So there are 3 types. 3 types. Yes, बहुत बढ़िया. चलो आगे देखते हैं. Now look at this. Now let's do a demonstration. What is the greatest dimension in stab wound? Look at this. So we have apple and we have knife here. What is the greatest dimension in case of stab wound? Can anyone try? What is this answer? What is the answer for that? Look at this. So as you know, stab wound has length, breadth and the depth. So the greatest dimension is basically depth. So the depth depends on the length of the blade. So the length of the blade corresponds to the depth. This can be MCQ in your exam. Depth is the maximum dimension. So again depends on the knife. If it is single edge knife, the appearance will be triangular. If it is double edge knife, dagger, then it can be diamond shaped, or both the angles are acute. We discussed in predictor series that you can go through. So the answer is depth. Very good. So many answered. That's really nice. Now look at this. Very important question, very commonly asked. Try to memorize what are these two abrasions. So the first case, a case of road traffic accident. The second case is basically again road traffic accident. What are these two? 1 and 2. Can anyone try? In one, what you can see, multiple parallel markings are there and denuded epithelium at one end that shows the direction. In 2, you can see the pattern of weapon, that pattern of tire mark. What are these two abrasions? Try yourself. So yes, Akhil Reddy is telling length. Okay, that's great. Swajit Kumar, that's great. That's great abrasion. Yeah. Good answer. Many answers. So this is Gray's abrasion. बहुत बढ़िया. Gray's abrasion known as brush bone. Okay, very commonly asked. It looks like a bone injury, that's why. The second one is, that is patterned abrasion or imprint abrasion. Imprint of the weapon you can see. Okay. So when pressure is applied for short time, but the pressure applied is huge pressure, like example weight of the body or the weight of the vehicle. So that is basically good answer. Smooth specialist, Akhil Reddy, Swajit Kumar, Amit, many answered. Great, really great answer. Fine. चलो आगे देखते हैं incised wound. All are the features of incised wound except incised wound caused by sharp weapon. Incised wound, as you know, it can be homicidal, it can be suicidal. In suicidal, hesitation cuts are common. In homicidal, basically there are defense wounds are there. Defense wounds can be active defense wound, passive defense wound. So margins are clean cut and everted. This can be MCQ in FMGE. True. Caused by sharp object, that is also true. Spindle shape, that is also true. Tissue bridges. Tissue bridges is a classical feature of laceration. So try to memorize laceration caused by blunt weapon. There will be classical muscle bridges, tissue bridges, bone bridges, skin bridges, especially in laceration. Laceration, there are 4 types. Split laceration known as inside looking laceration. Stretch laceration because of the overstretching. Owl's laceration, there will be classical feature known as flaying. And tear laceration, again it is caused by semi-sharp object, like example a beer bottle and all. So laceration, tissue bridging frequently asked. बहुत बढ़िया, ठीक है, very good answer. So now look at this. This is the image. This can be asked in your exam. What is this basically finding here? You can see the irregular margin here. Irregular margin है. It's a case of road traffic accident. During postmortem examination, so there are some tissues are trying to bridge between the 2 ends. So some tissues are trying to bridge between them. So what is this basically known as? So this is tissue bridge. So try to memorize. This is tissue bridge, classical of split laceration. Split laceration or incised looking laceration. So what is the common site? Bony prominences. Again FMGE, what are the common sites? Example skull, scalp, ilia crest, So usually medial malleolus, lateral malleolus, all bony prominences. Frequently asked. Very good. Amit, Swajit, so many answered. That's great of you. That's great. Chalo, आगे देखते हैं next question. Now this is very interesting. This is the case of murder. This is the case of murder during post-mortem examination. So there was a fight between the two parties. So some issue, some maybe issue of finance or some love issue, whatever it is. So but during post-mortem examination, there are two wounds are there. So there are two wounds on the back of the hand. Back of the hand. What is this basically? Is it active defense wound or passive defense wound? So frequently asked. Is it active or passive? Active defense wound, very common site is palm and space between the fingers, web space, or over the ventral aspect, front aspect of the hand, not the back. The passive defense wound commonly seen over the back of the hand or back of the forearm. So this is classical passive defense wound. So go in favor of murder. And look at the one more important feature here. So you can make out one more feature in this. Look at the here, it is deep here and it is shallow and deep. So my question is, what is this known as? So at one end it is deep and other end it is shallow. So example, this is from left side, left to right. So very interesting question. Try to memorize. Deep at one end, shallow at other end. This is known as tailing. Tailing. The tailing is a feature of incised wound. So the direction here is left to right. Left to right. Again, this can be asked in your exam. One more MCQ, FMG question. Fish tailing. Fish tailing, that is stab wound. Okay, stab wound. Good direction of the wound. That is great answer. That's really nice. Now try to memorize. Definition of murder is given by 101 BNS. The punishment is given by 103 BNS. याद रखना पड़ेगा. So all of you write murder is equal to 103 BNS. So write this in chat box. Please write this in chat box. So murder has two components, mens rea and actus reus. Mens rea is guilty mind, actus reus is guilty act. Okay, so there are well-known cases basically, like example Uttara murder case in Kerala. A wife was murdered by the husband with the help of snake. Two times basically, once Russell viper and once that is common cobra. So it's well planned. When it is well planned, we call it as murder. So mens rea, actus reus, that is 103 BNS, the punishment is death sentence or minimum life imprisonment. In Uttara murder case, the session court awarded double, that is double life imprisonment. Uttara murder case in Kerala. Good. Swajit Kumar, that's great. That's great. All are answering. All are answering. That's great. चलो आगे देखते हैं. बहुत बढ़िया. Now, cutthroat injury. One more favorite of FMG. Repeat question. All are features of suicidal cutthroat. For example, this is suicidal cutthroat. So I am right-handed person. This is suicidal cutthroat. Okay. Presence of tentative cuts. Only one wound is deep. Presence of cadaveric spasm. Presence of defense wound. So what would be the best answer? So the answer is presence of defense wounds. It's basically the feature of murder. So the answer is D is the correct answer. Good, great. Both बढ़िया. So in books we are suicidal cutthroat, homicidal cutthroat, you can just go through that. So this is again active defense wound. Now very important topic, all are the features of firearm entry wound except abrasion collar, everted margin, presence of blackening, presence of tattooing. So what is the best answer? Entry wound. Entry wound characterized by abrasion collar. Abrasion collar is caused by spinning movement. Everted margin, no, it is inverted margin. The blackening is because of the soot particle. Tattooing is because of gunpowder. So the best answer is everted margin. So very easy. Yes. So B is the correct answer. So differences between entry exit wound, very commonly asked. Entry wound is small, inverted margin, abrasion collar present, grease collar present, bruising is there, blackening present, tattooing present, fat protrusion is not seen. The fat protrusion is very common in case of exit wound. So cherry red color tissues because of the carbon monoxide. Fibers of clothing may be turned in, lead ring on the radiological examination. So all these are features of entry wound, very important. Exit wound, larger, everted edges, abrasion collar absent, tattooing is absent, fat protrusion is present, no color change, turned out, and lead ring is also absent. Favorite of FMGE exam. So very frequently asked. So चलो ठीक है, आगे देखते हैं. So secondary blast injury. See, blast injuries are classified into primary, secondary, tertiary, quaternary, and quinary. The quinary, that is basically radiation. Secondary blast injury caused by, options are multidirectional blast wave, flying missiles, victim displacement, structural damage. The structural damage basically give rise to quaternary. Victim displacement can give rise to tertiary. Blast wave give rise to primary. So flying missile characterized by Marshall triad. Marshall triad. So characterized by multiple punctate bruises, abrasions, and lacerations. Okay, this image try to memorize. Very important image. Sujit Kumar and Amit. So blast wave can affect the lung. It can affect the tympanic membrane and intestine. If they ask you an exam, most common organ affected, that is tympanic membrane. The most common organ affected giving rise to mortality and death, your answer must be that is lung. In lung, the classical feature is blast lung, multiple hematomas, lung lacerations, lung tear and all. The flying projectiles, you can see a flying projectile here, so they give rise to secondary injury. Secondary injury. So flying projectiles give rise to punctate abrasion, bruise and laceration, known as Marshall triad. Very important. Secondary blast injury is the most common blast injury, the most common cause for morbidity. Victim displacement, that give rise to tertiary. The structural damage like bones can give rise to quaternary injury. Quaternary. Yes, very good. Now, Swajit Kumar, what is the most common organ affected in solid blast? Solid blast. What is the most common organ affected? Chalo, try yourself, guys. Come on, try. Solid blast, answer is skeletal injury. If it is underwater blast, either it can be lung or intestine. So again, this is frequently asked in the exam. Skeletal injury, solid blast. Water blast injury, lung or intestine. Most common, secondary blast injury. Most common organ leading to death, lung. Most common organ, tympanic membrane. So is it clear? Amit, smooth specialist. Can I go ahead? Okay. Okay. Akhil Reddy. Akhil Reddy, is it okay? Solid bones. Good. That's great. Shall we go ahead? Chalo. The next heading, that is basically, now look at this image based question now. This is the case of blast injury during postmortem examination. So there are multiple injuries are there. So what are these injuries? Can anyone try identify these? With irregular margins, punctate shape. So punctate, abrasion, bruise and laceration. Case of blast injury, base of tire blast. Okay, it is not the bomb blast, tire blast injury. So tire blast, Larry tire blast. So what is this? So this is peaceful barrier is telling sir secondary blast injury. Very good. It is secondary blast injury, and this is what Marshall triad. And try to memorize a Waddell triad. The Waddell triad is basically seen in pedestrian injury. Waddell triad. Sparrow foot mark, that is also seen in case of road traffic accident, especially in the front seat passenger. Okay, Marshall triad, that's great, that's great. Identify the torture method. Torture, very commonly asked in the exam. Now here is the torture method. Remember torture, Tokyo Declaration, important question. T for torture, Tokyo Declaration by World Medical Association, FMG question. Istanbul Protocol, torture basically. NHRC, National Human Rights Commission, State Human Rights Commission related to torture. All these are important question. So what is this torture method? The answer is Falanga. So Falanga is the correct answer. It is not Gotna, it is not parrot perch, dry submarine. So the answer is yes. Now look at this, all this in one image. Yeah, now try all of you, what are these 5 methods? A, B, C, D and E. If you answer, you'll get 5D chocolate from me, 3D chocolate from me in the chat box. Come on, try guys, try. लाश एक मूक गवाह है जो कभी झूठ नहीं बोलती. Dead body is a silent witness that never lies. Yes, come on guys, I'm giving you around 20-second time. You try and identify image based question commonly asked in the exam. Hawk tie method is commonly asked, many methods. Okay, so dry submarine, wet submarine, black slave, cattle prod, very commonly asked. The first one, body suspended, both the hands and legs are tied. What is that? So this is parrot perch. Cause of death is basically nerve injuries or asphyxial death. Second one, Falanga, most common torture method. Third one, La Bandera, when body is suspended at the level of wrist, La Bandera, at the level of ankle known as D Murcielago, and D, that is dry submarine. E, that is wet submarine. Okay, so after the class, just go through different other torture methods, like example hawk tie method, hawk tie, Palestinian hanging commonly asked, black slave, cattle prod. So all is a repeat question, FMGE. Go through this, L plankton and all. Yeah, the first two, I think many answered. I think Amit, very good. Amit, good answer. Swajit Kumar, Sagar Sharma, Akil Reddy, Nikki, Rehna. I think many answered. That's great. Peaceful warrior also. That's really nice. बहुत बढ़िया. चलो ठीक है. So this is basically known as parrot perch. Very beautiful image. A very beautiful slide. Just to explain you, parrot perch can lead to positional asphyxia and death. Abnormal position. Okay, so all the intestine contents when enter into the thorax, when pushes the diaphragm, So there will be respiratory difficulty. Respiratory difficulty can lead to hypoxia and hypercapnia, can lead to congestion, cyanosis, petechial hemorrhages and death. So this is classical positional asphyxia. Okay, good. So after the class, go through this table: Falanga, Telephono, wet submarine, dry submarine, cattle product. Chepua is also very commonly asked. Gotna is asked once. Sham execution, dunking, FMG favorite. Is it okay? Shall we go ahead? Move ahead, guys. So if you want, you can take the screenshot and you can revise. So that is the best way. Take the screenshot and save it for the end discussion or end revision at the end. बहुत बढ़िया. ठीक है, चलो. Now comes is heat stroke. The heat stroke, heat syncope and heat cramps, very commonly asked. True about heat stroke. Heat stroke, remember, affect the higher centers, especially hypothalamus. Hypothalamus controls the body temperature. Options are impaired consciousness, presence of sweating, cerebral dysfunction, core temperature more than 41. Yes, when core temperature more than 41, it can affect your hypothalamus. That is true. As you know, anterior hypothalamus controls the heat, posterior hypothalamus controls the cold. It leads to cerebral dysfunction. Yes, that is true. Impaired consciousness, that is the common feature. Answer is presence of sweating. So the sweating is not the feature of heat stroke. Sweating is present in case of heat syncope as well as the heat cramps. So this is one very, very important question. FMGE question. And one more FMGE question. What are the clinical features in hypothermia? Can anyone answer? In hypothermia, there are two conditions when there is a generalized hypothermia. When body temperature is less than 30 degrees Celsius, or when severe hypothermia is there, it leads to certain disorders. Basically, psychosis is very common in this. What are these two conditions occurs in hypothermia? Come on, guys, try. Try. Sweating is absent. बहुत बढ़िया. चलो चलो अमित. Hypothermia, remember, one is hide and die syndrome. Hide and die. So here dead body will be under the wardrobe in the some closed spaces. Second one syndrome is paradoxical undressing. Paradoxical undressing. Both are very important FMG question. ठीक है? Hypothermia. ठीक है? हाँ, very good. Hypothermia, the postmortem hypostasis is pink color. Very good. One more important question. In the examination of stomach, you will see some spots. They are known as Vishnekyu spots. Vishnewsky spots. MCQ again. So example, this is the stomach. So this is the stomach. So inside the stomach, you will see dark color spots. They are spots of the hypothermia. This is very important in postmortem examination. So when you see pink postmortem hypostasis and the hypothermia spots inside the stomach, then it is classical of severe hypothermia and death. Very important, because sometimes paradoxical undressing resemble like sexual assault, rape, and hide and die syndrome resemble like strangulation. So as a clinician, as a forensic expert, you must know how to differentiate between generalized hypothermia and as well as the some sexual assault. Okay, good answer, good, that's great. So after the class, go through this. Heat stroke, feeling confused, no sweating, temperature more than 40, hot dry skin, nausea, vomiting, loss of consciousness, sometimes convulsion, sometimes seizures also. So heat exhaustion, basically electrolyte imbalance, sweating is usually present. Okay, so next heading. Next is very important question, guys. Rule of 9. Rule of 9 is a favorite of examiner. A 30-year-old married female presented with a burn injury. Married, that means it's a dowry death under the section 80 BNS. It's 80 BNS, dowry death. So all of you, please write 80 BNS is equal to dowry death. This can be FMGE question. 80, याद रखना 80 लाख, 80 dowry, 80 BNS, life imprisonment. ठीक है? Bone injuries over entire abdomen. Entire abdomen. Remember, abdomen is 9 and 9, that is 18. Both lower limb, that is 18 plus 18. Then what is the percentage? Percentage is very simple. Answer is 54. 54 is the correct answer. Okay, frequently asked in the exam. Try to memorize this, guys. Try to memorize. Head and neck area 9%. The trunk front is 18%, back is 18%, genital area 1%, leg is 18%, arm is 9%. Remember, front of arm is 4.5, back of arm is 4.5. This is very, very important FMG confusion. So this creates the confusion in exam. Okay, arm is 9%, including front and back. So yes, good answer. Akhil Reddy, Rahana, great answer. हाँ, entire abdomen लिखा है, entire trunk नहीं है. Trunk means that is basically abdomen and thorax. So abdomen doesn't include thorax as such. Abdomen means front of abdomen, back of abdomen, 18. So both lower limb 18 है. So answer है तो 54 ही आएगा, ना 54. Yes, most specialist. Yes. No. Entire abdomen लिखा है ना. Front देखो भाई. Front 9 है ना. Front 9 और back 9. मतलब 18 होगा ना. 18%. 18 होगी. चलो ठीक है. Now in the children, what is the formula used? So what are formula related to burn injury? One is LB formula, Browder formula, very commonly asked in infants and in children's. Palmer rule, that is rule of 1%, commonly asked. Parkland formula, very commonly asked, or basically for IV fluids. So estimation of IV fluids. What is the cause of death? The most common cause of death is either neurogenic shock or it is hypovolemic shock. That is the immediate cause. Delayed cause. So delayed cause basically that is septic shock. So commonly asked, very, very commonly asked question in exam. Okay, चलो अमीसा and all, that's great. चलो आगे देखते हैं. Specific finding in antemortem burn. See, 3 important questions in exam. Antemortem hanging, dribbling of saliva. Antemortem drowning, cadaveric spasm. Antemortem bone injury, your answer should be soothe particles. So the best answer is soothe particle. If soothe particles are not given, it can be line of redness. Line of redness, or blisters consist of albumin. Okay, so the answer is line of redness. Heat hematoma can be antemortem or it can be postmortem. Remember, heat hematoma is bilateral. It looks like Swiss cheese appearance. Swiss cheese, MCQ. Honeycomb appearance. Honeycomb. Heat hematoma looks like a extradural hematoma, frequently asked. Heat fracture. Heat fracture, again antemortem, postmortem. The common fracture is bilateral fracture. Bilateral heat fracture over the temporal area. Pugilistic attitude known as boxer attitude. So that is not the classical feature of antemortem burn. It can be antemortem, it can be postmortem. Pugilistic attitude because of the coagulation of protein when the temperature is more than 70 degrees Celsius. So the best answer is basically D is the correct answer. Many answer, that's great. Smooth specialist, Rehana, very good, all answered. So now look at this. So this is the classical pugilistic attitude. You can see here, so arm is abducted and flexed, elbow is flexed, wrist is flexed, claw-like hand, protruded tongue, and hip is abducted and flexed, knee is flexed. So this is classical boxing attitude, also known as pugilistic attitude. Boxing. Boxing attitude. It can be antemortem or it can be postmortem. So it has no medico-legal significance. It's one of the differential diagnosis of rigor mortis. So it resembles like rigor mortis. Okay, chalo, बहुत बढ़िया, ठीक है ना? Now look at this image. Now you are in the postmortem room. Now you are a forensic expert. During postmortem examination, there are certain findings are there. Now can identify what are the findings over the image. Very beautiful image, one of the best image of my class. What you can see, the postmortem dead body, a case of dowry death, and you can see one or three findings are there. What are these three findings? Yes, let's see now who is going to answer. बहुत चलो ठीक है, Amit, smooth specialist. Yes, it is a scald injury. Okay, someone is telling it's a scald injury. That's great, very good answer. It's a scald injury because of the soddening. Very good. Soddening is there. Watery appearance is there. Soddening is there. Trickling is there. Okay, that's fine. Look at this. So this is the blister. So blister consists of albumin, is a feature of antemortem bone, and this is the line of redness. Line of redness. And this is tattoo. So tattoo is a favorite of examiner, especially asked in your NEET PG recently and INS-80 also. So tattoo we use many times, especially by indigo and others. So it goes to the superficial dermis. So it can be permanent tattoo or sometimes temporary tattoo. It can be medical tattoo. It can be tattoo of the homosexuality, bluebird sign and all. So when tattoo is not visible, you need to dissect the lymph node. Very important question. Lymph node dissection, very important. And when we just go through shark arm case of tattoo, very interesting shark arm case. Okay, so it looks like deglowing also. Deglowing is there. Moist heat, blister, hair, Rehana, very good. Good answer. So that's great. Fine. Now look at the again same picture, the same same bone injury. Now it is not the moist heat, dry heat. This is lung basically, and all these are alveoli. And inside the alveoli, what you can see here, multiple black spots are there. What are these? What are these spots? Shark arm case, Sydney shark case, very good answer. So this is basically soot particle. So when soot particles are there, it is antemortem bone injury, antemortem flame bone injury. One of the classical feature. Okay, yes. आगे देखते हैं next question. Yes. Now very important topic, guys. Favorite of examiner. Cause of death in the postmortem staining. You know, postmortem staining is the collection of blood in the dependent area. So normal postmortem staining color is bluish purple or purplish red. Here the color is cherry red. You can see here cherry red. And this is contact pallor. And you can see the well-defined edges. Okay, over the dependent area. So probably in the supine position. So body was kept in supine position. What is the best answer? So antemortem bone, okay, many answered. Carbon monoxide, yes. So the answer is carbon monoxide. Good answer. So carbon monoxide inhibits electron transport chain complex 4. The postmortem staining is cherry red. Hydrogen sulfide, green color. Yellow phosphorus, yellow color or brown color. Opium, black color. So frequently asked in the exam. So after the class, go through this, very important. The phosphorus and copper, yellow. Carbon monoxide, cherry red. Nitrate, aniline, chlorates, chocolate or copper brown. Hydrogen cyanide, pink or bright red. Hypothermia, pink color. Opium, black color. Hydrogen sulfide, green color. Clostridium perfumans, basically bronze or greenish bronze. So this is favorite of FMGE. Is it clear? Okay. Ayushi and others? Okay. Ayushi is telling, I love FMT sir, wish I become. Why not? You know, you can become forensic expert. You can become anything in your life. Okay, don't worry. We are there to help you. Yes, Ayushi, good. Next question. Is it over? Is it okay, guys? Shall we move ahead? Smooth specialist, peaceful warrior, Swajit Kumar. बेटा सब ठीक है ना? Yes, okay. चलो. Rape is defined under section. So simple question. Rape is a legal definition. So rape is defined under 63. 64 punishment. 80 BNS dowry death. Dowry means that is 80. 64 punishment hai. So punishment can be minimum 10 years to life imprisonment or sometimes death also. Okay, when victim is less than 12 years, repeat offenders, rape and murder, the punishment is death sentence, like in Nirbhaya case. 116 basically grievous hurt. So the answer is 63 BNS. Simple it is. 63, 72 smooth specialist, that's okay. Okay, chalo. Now yaad rakhna, this is frequently asked question, guys. Gore agat karna. That is causing serious injury, causing severe bodily pain. Now, when person is unable to do ordinary pursuit for about 15 days, or the act endangers life. Like example here, head injury. So head injury is there. So this head injury can lead to extradural hematoma. It can lead to cranial contusions, brain contusions and death. So anything gore agat karna, serious injury, then your answer must be 116, that is grievous hurt. Grievous hurt, pakka question in any exam, frequently asked. Okay? Okay. Chalo. Then there are 8 sub clauses are there. Emasculation, loss of masculine vigor, okay? Permanent privation of sight of either eye, ear, loss of member or joint, power of member or joint, disfiguration of head or face, bone or tooth, endangers life, severe bodily pain for 15 days, ordinary pursuit. So this is favorite of FMGE. Like example, stab injury over abdomen. So it is the act endangers life, it can be grievous hurt. Head injury is a grievous hurt. Okay? Yes, 21 days is now removed as a 15 days. रहना याद रखना, it is now 15. पहले क्या था 21 days, 21 days, now it is 15 days. ठीक है अमित? चलो बहुत बढ़िया. आगे देखते हैं next question. Sexual perversion, sexual paraphilia, abnormal sexual behavior, frequently asked in the exam. Identify the sexual perversion. Sadism, masochism, transvestism, fetichism. So fetichism basically inanimate object. Inanimate object. Not the answer. Transvestism known as eonism. Sadism is giving pain. Giving pain. Sometimes it can be necrophilia, necrophagia, sometimes lust murder also. The lust murder. So the best answer is masochism. So taking pain, self-defeating condition that gives rise to sexual gratification, sexual pleasure. So B is the best answer. So consider husband or the male and female. Male and female. So male getting pain to get sexual, that is known as masochism. Sometimes it occurs together, that is known as bondage. Bondage, sometimes it can be BDSM also. A BDSM, that is a subtype of sadism and masochism combination basically. Okay, that's great, Nikki and all, fine. Now there are two images. Can anyone identify what are these two images? Sexual paraphilia. Here male acts like a female and wearing female dress. What is that? And in B, collection of some inanimate objects, like example sari, petticoat, so innerwear of the female. So what is that basically? So this is classical eonism. Yaad rakhna, eonism. Sometimes it can be cisvestism also. Cisvestism, transvestism. This is pettichism. Okay. So both can lead to autoerotic asphyxia. Autoerotic asphyxia and death in some condition. So this can be MCQ in your exam. Good. Good. Bondage, eonism. ठीक है, बहुत बढ़िया. So after the class, go through this sadism, masochism, bondage, pettichism, proteurism. Proteurism is very important FMGE question. It is punishable under 296 BNS. Exhibitionism, recently asked, FMGE question. Uranism, basically fingering. Fellatio, cunnilingus, anilingus, buccal coitus. Voyeurism, that is basically scoptophilia, again FMG question. Triolism, so it's the extreme degree of voyeurism. Perverted husband enjoy watching his wife having sexual intercourse with other male. So all these are frequently asked in the exam. Okay, चलो ठीक है, आगे देखते हैं next question. हाँ, now this is very interesting question from the movie Drishyam. Why secretly installed hidden camera? Hidden camera, bathroom of female tenant without her knowledge, captured images and shared these images with his friends through the messaging app. So forwarding the same message. So what is this known as? So this is basically known as peeping Tom. Peeping Tom or voyeurism, and it is punishable under 77 BNS. And 301 basically necrophilia, necrophagia. So याद रखना, necrophilia, necrophagia 301 है. 63 definition of rape है, 64 punishment for rape है. So धारा 63 definition है, धारा 64 punishment है. So answer is 77. So many answer. That's great. Now this is one more interesting question. So 29-year-old female brings her boyfriend to couple therapist because she is uncomfortable with his behavior. She is uncomfortable because he is having abnormal sexual behavior. She found him looking at her feet all the time during intercourse. Notice that he insists on being able to see her feet while they engage in sexual act. This is known as option transvestism, pettichism, masochism, exhibitionism. Exhibitionism is basically of three types. So it can be mooning, streaking, running naked. It can be anarisma. Okay, mooning, streaking. So there are different types are there. Exhibitionism. Transvestism is not the answer. Masochism not the answer. Pettichism is the correct answer. The most common pettichism is foot fetish. Foot fetish, the most common pettichism. Mooning, streaking, you said, yeah, that's great. Good, good. 301, indignity with the human cups. That's great. Next comes is very important topic. Teichmann test, Takayama test, Barberio test and Florence test. So all of you try to remember, FMGE student, it's a favorite of examiner. FMGE favorite. Teichmann test. The Teichmann test is basically Hemin crystal test. The finding is brown rhombic crystals. You can remember Teekman. So Teekman is brown man. Brown man. So brown rhombic crystal. Takayama hemochromogen crystal. Pink feathery crystals. You can remember pink feathery, Takayama, Taka Mama and pink. Pink Mama. You know, Mama is a very important character in everyone's life. Mama, you know, Mama, Mawa and all. So pink feathery crystals are formed in Takayama test. Brown rhombic crystals in case of blood stain. So that is in Teekman test. Now remember Barberio test. In Barberio, yellow needle shaped crystals because of spermine picrate. Spermine picrate. In Florence, choline added crystals. There will be dark brown rhombic crystals. So all are very, very important question, very commonly asked in the exam. Brown man teach forensic. Okay. Pink takatak. Okay. Takatak pink. That's also okay. So favorite of examiner, go through that. Very, very important topic. Okay. So I hope you are getting my point, guys. Shall we go ahead? Shall we continue for next half an hour? Is it okay, guys? Next half an hour. So this is very important. You can revise many times. Barberio, spermine picrate, Florence, choline iodide, both of a seminal stain. But remember, confirmatory test for seminal stain is presence of spermatozoa by using Christmas staining. So Christmas staining is the confirmatory test. The confirmatory test for blood stain is either Teekman test or Takayama test or spectroscopic examination. If a blood stain is very old, can anyone tell me old blood stain? So what is the best answer? Old blood stain. What is the test done? Old washed blood stain. Come on, guys. Old washed blood stain. Try. No, it is not benzidine. Benzidine nahi hai beta. Not benzidine. It is something else. Like example in Nirbhaya case, the entire bus was washed with the help of water. So there were no blood stain visibly. So but by using some test during dark light or during dark examination, you will able to see the blood stain very clearly. What is the test? So what is the test? That is a fluorescence that comes out from the blood. Can anyone? Not benzidine beta. It is luminol test. Luminol test. So dark bluish glow that comes out from the blood stain. So when you examine in a dark room by using luminol reagent. So this can be examined in our upcoming exam. So benzidine, tetramethylbenzidine, orthotolidine, all these are screening test basically based on the peroxidase activity of the hemoglobin. Okay? So Castle-Meyer is basically commonly used test, but in visible blood stain. When blood stain is visible, you can use Castle-Meyer. Otherwise, you can use luminol test. Okay? Okay, chalo, ho gaya. Next. Ossification center appears at 7 months. So I think we discussed many times in our exams, smooth specialist. So 7 months, 9 months, 10 months, very important. So 7 months is basically, that is, talus is the correct answer. If it is 5th month, that is calcaneum. If it is 10th month, that is tibia. Lower end of femur, that is 9 month. So this is again frequently asked question. Viability means 28 weeks. 28 weeks. So in 28 weeks, 7 months, the weight becomes 1 kg. The pupillary membrane disappears. The nail appear, but not towards the tip of the fingers. So viability 28 weeks. Okay, Gautam, thank you, Gautam. Good. That's great. चलो बहुत बढ़िया. ठीक है. Now comes is insanity. Insanity मतलब insight is present. Okay. All are features of insanity except one classical case is schizophrenia. Schizophrenia, you know, there will be delusions, hallucinations, disorganized speech, disorganized behavior, blunt affect and all. So all are features except gradual onset, signs of delusion, hallucination, fear of detection, insight is impaired. Insight means awareness. Awareness is usually absent in case of psychosis. Psychosis example, schizophrenia. Schizophrenia. And remember 22 BNS. McNaughton's rule, Durham's rule, Curran's rule, very commonly asked. So A can be answered, that is a true statement. Signs of delusion, yes, the most common delusion is delusion of persecution. MCQ. Hallucination, that is third person hallucination. Third person hallucination. Gradual onset, that is also true. So what is the best answer? Fear of detection. So the fear of detection is very common in false insanity. False insanity. Okay? Now look at this image and tell me, all of you guys, is it true insanity, false insanity? So look at this guy. This guy is having delusions. He's having abnormal thought. He thinks that the Prime Minister of US, the President of US is behind him. He's trying to kill him, and he also thinks that he's going to be killed by someone like police officer. Also, he's talking to someone who is dead already. Third person hallucination. So people are talking about him. Delusion of reference. So and look at the cloth. The cloth is totally disturbed cloth. Dirty habits. But there is a fear of delusion is there. The fear of delusion, but not the fear of detection. So is it a true insanity, feigned insanity? What do you think? Smooth specialist, maybe good actor. So maybe good actor, okay, other than acting. So look at the person, so wearing multiple clothes, jackets, multiple clothes, multiple shirts, dirty habits. So walking near the roadside street. So wandering with the multiple delusion, hallucinations. So this is classical true insanity where insight is present. This is the classical case of schizophrenia, disorganized speech, disorganized behavior, delusion, hallucination. So all are present in this case, at least since 6 months. Okay? Yeah. True insanity, correct answer. Smooth specialist, that's great. Now remember, when he commits some crime, it is not a punishable offense as per section 22 BNS, McNaughton's rule. So what are rules of insanity? Can anyone tell me? What are rules of insanity? Yes, come on guys. So there are many rules are there. What are rules in general? So one common rule asked is 22 BNS, 84 IPC in India. In UK it is McNaughton's rule, McNaughton, Durham, Curran's, okay, American Law Institute test, irresistible impulse test, irresistible impulse test. So there are 6 rules are there. So this can be MCQ in your exam. Very commonly asked guys. Okay? Good. बहुत बढ़िया. चलो. So after the class, just go through difference between true insanity and feigned insanity, frequently asked in the exam. Feigned matlab false insanity. The person is trying to behave like as if he is having mental illness. He is trying to escape from the law. Probably case of murder, attempt to murder or rape, whatever it is. Okay? Yes. बहुत बढ़िया. Next, all are examples for psychosis except. Psychosis मतलब insight absent है. Insight मतलब awareness नहीं होता इसमें. Example है bipolar disease है, schizophrenia है, mania है. So answer is all except obsessive compulsive disorder. Obsessive compulsive disorder is a neurosis. So it's a very simple question. So what is the answer? Try. Browner rule also there. Yes. Yeah. Browner rule. Yeah. You are right. Smooth specialist. Great answer. So I forgot one more rule. Browner rule. Browner rule. Yes. Great. Good. Thank you. Yeah. Okay. So psychosis, judgment, insight, personality, contact with reality absent or lacking, neurosis present, delusion, hallucination common here, usually not present. Example: schizophrenia, delusional disorder, mood disorder, phobia, dissociative disorder, conversion disorder, OCD, anxiety, all is a neurosis. Can anyone tell me what is agoraphobia? Agoraphobia, frequently asked. Claustrophobia. So both are very important question. Agoraphobia and claustrophobia. Try. And one more asked is impulse disorder. Impulse disorder. Okay. One asked is oniomania. Oniomania means impulse of shopping. In impulse disorder also insight is present. Then other run amok. Run amok is commonly seen in case of cannabis poison. Okay. Kleptomania, that is basically stealing. Then others as well, pyromania and all, so many types are there. So impulse is also neurosis. Agoraphobia matlab, agoraphobia is basically crowded places. Crowded. Claustrophobia, closed spaces. Closed spaces. So this is FMGE favorite. Okay, favorite of examiner. Mesophobia, contamination, ठीक है, oniophobia, shopping है, pyromania, ठीक है, all these are commonly asked. Chalo, now I have a question for you just to make you happy. Deepika Padukone is in love with me. So a male thinks that Deepika Padukone is in love with him, though he never met her. दीपिका पादुकोणे मुझसे बहुत प्यार करती है, हालांकि मैं उनसे कभी नहीं मिला. ये किस प्रकार का भ्रम है? Anyone tell me what is this? What is this, guys? Ailurophobia, that is basically cats. Cynophobia, that is dogs. That's great. What about this question? Deepika Padukone question. So when I think about Deepika Padukone, I remember 124 BNS. That is basically movie, Chapak movie, acid attack. Okay, acid attack. Yeah, delusion of love. So this is known as delusion of love, also known as erotomania. So and remember, in erotomania is common in females. Okay, yes, Malaria, erotomania, Malaria. Very good. Good answer. Good. Chalo, बहुत बढ़िया. Then cephalic index is skull used to estimate. Cephalic index. So there are many indexes, many indices basically in forensic, like Washburn index. Washburn index, very commonly asked. Let's discuss about Washburn later. Cephalic index basically to estimate race. So the answer is race. For age estimation, remember Gustafson method. Gustafson method. For determination of stature, we use Pearson formula. Pearson formula. MCQ. Age, Gustafson method. Boyd's method. So Washburn basically for the determination of the sex. So by using pelvis. So by using pelvic bone. Washburn index. Sciatic notch index. Okay. So race basically cephalic index is the correct answer. So try to memorize. So dolichocephalic 70, 74. Example Aryans and blacks. mesenterocephalic 75 to 79, Europeans, brachycephalic 80, Mongolians, that is basically 80. Okay, frequently asked in the exam. Okay, आगे देखते हैं. All are features of male skull except one more favorite of examiner. Male skull, rectangular orbits, prominent supraorbital margin, forehead is steeper, prominent parietal eminence. Try, come on guys. Try. Rectangular orbit, that is basically male only. Forehead is steeper, that is also male. Supraorbital midges are prominent, that is male. Prominent parietal eminence, that is a feature of female. Female is the correct answer. So D is the best answer. Now let's see discussion with the skull. Yes guys, now look at this. This is the skull. Now identify male or female which has rectangular orbit. So rectangular orbit is there. Okay, rectangular orbit, steeper forehead. So muzzle markings are prominent, pony markings are prominent. Frontal eminence, parietal eminence is small. So this is parietal eminence, that is small. Frontal eminence is also small. My question, this is found in the crime scene. Is it male or female? Male or female? Yes, Purush. Okay. So smooth specialist telling, sir, it is Mard. Okay, Purush hai. Good answer. Nikki is telling it's male. That's great. Okay. Now, can anyone tell me what is the best suture for estimation of age? We have different sutures. We have coronal suture, sagittal suture, lambda suture. What is the best suture for estimation of age? So again, can anyone try? So in skull, the question can be asked about cephalic index, that is maximum length of the skull, and breadth divided by length, that is the cephalic index. Depends upon that, there are three: dolichocephaly, mesenterocephaly, brachiocephaly. Now age also you can estimate by looking at the skull, by looking at the sagittal suture. The best suture is sagittal suture. This is again commonly asked in the exam. Okay? Okay. Sagittal guess. Okay. Now we have pelvic bone. So we have pelvic bone. So this is the pelvic bone. You can see here. In this pelvic bone, bony markings are clearly visible. You can see here clearly visible bony markings. Okay. And obturator foramina. So this is obturator foramina, that is basically round. So round obturator foramina. So this is acetabulum, which is large. So acetabulum is large. Obturator foramina is oval. So bone is very heavy. Bony markings are heavy. So what is this? Is it male or female? Look at the sciatic notch. So this is the sciatic notch. You can see here sciatic notch. So sciatic notch is broad, basically deep and narrow. So deep and narrow. This is one of the very important feature in case of male or female child. So in exam question asked best feature for differentiation between male or female child, your answer should be greater sciatic notch. So greater sciatic notch here is deep and narrow. A deep hai, narrow hai. So male or female. So many features, once again repeat. So bony markings are heavy. Second thing, greater sciatic notch is deep and narrow. Obturator foramina, that is basically oval in shape. Subpubic angle is 70 degree. Then ischial tuberosity is less averted. So this is ischial tuberosity. This is less averted. It needs entire pelvis for the determination. Say it is less averted. My question is it male or female again? So good answer. Lambdoid, preacher sulcus in females. Good. Again, this answer is basically that is male. So answer is male. So this can be asked in your exam. Now we have sternum. So here is the sternum. Okay, look at the sternum. So the sternum is straight. The sternum is straight, and there is no forward at the lower part. And you can see here, this is the sacral vertebra. First sacral vertebra is large. The body of the first sacral vertebra, that is large. Ala are small. So body is large, ala are small. That is around 2:1:1 or 1:2:1. So what is the best answer? Is it male or female? Look at this now, guys. And sacroiliac joint is more than around 2.5 vertebra, up to 3 vertebra. So look at this, male or female. Sacrum, है ना, male or female. Remember, when there is when it is a forward curve is there in the lower part, it is female. When it is straight, it is male sacrum. When the body of the sacrum is large than the ala, then it is male sacrum. The ratio is 1:2:1. When sacroiliac joint is more than 2.5 or 3 vertebra, then it is male. So this is about the sacrum. So it is basically sacrum. Sternum nahi hai, this is sacrum. Sternum nahi hai, sacrum beta. Okay. Chalo. Now look at this image and try to answer. Male or female? A and B. So this is A and this is B. So what you can see here, steeper forehead, rectangular orbit. Okay. Here a round orbit, V mandible. So here mandible is V mandible. Here U mandible. So rectangular orbit, steeper forehead. बताओ क्या है? So answer is male. So this is male. Nikki is telling sir ये male है and a female है. ठीक है, बहुत बढ़िया. ठीक है, मेल एंड फीमेल. दैट्स ग्रेट. ठीक है, बढ़िया. ओके, चलो आगे देखते हैं. सो मेल स्कल, फीमेल स्कल differences are given. You can go through after the class. All are features of female pelvis except, again FMG repeat, everted ischial tuberosity. Everted ischial tuberosity, female. Inlet is round, female. Subpubic angle 90, 110, female. Greater sciatic nerve deep and narrow, male. So the answer is D is the correct answer. D. Very good. Smooth specialist, peaceful warrior, Nikki, Amit Sam. So great answer. Okay. So after the class, go through the difference between male and female pelvis. So general feature, periauricular sulcus is prominent. This is important. Periauricular sulcus, more frequent, broad and deep. Obturator foramina, that is triangular. Very important question. Greater sciatic knots, large, wide and shallow. Iliopectineal, round and smooth. Ischial tuberosity everted. U-shaped subpubic angle. Circular pelvic brim. Pelvic cavity broad. Sacrum is short, wide, upper half almost straight, lower half is curved. So lower half is curved. So this is frequently asked question. Okay. Now look at this now. Now identify, guys. Now it is easy. So look at this sacrum. Sacrum totally straight. This totally straight. Is it male or female? So glabella is prominent in males. Glabella, that is in skull, is prominent in male. Now look at this, almost straight sacrum. Male or female? Now try, smooth specialist. मेल, गुड। चलो आगे देखते हैं। प्रोफेशनल डेथ सेंटेंस गिवन बाय, so professional death sentence means removal of name of the doctor from the medical register, especially in case of infamous conduct. So infamous conduct can be 6 A's, so adultery, association, advertisement, and others, criminal abortion and others, dichotomy. Given by, as per criminal code, no, it is not mentioned in criminal code. It is not mentioned Central Health Ministry, NMC or SMC. So the better answer is State Medical Council. So professional death sentence is given by State Medical Council. In that case, the doctor should appeal to EMRB. EMRB is nothing but NMC. It's a division of NMC. So Ethics and Medical Registration Board for appeal. So this can be MCQ in your exam. EMRB. Okay. Yes, answer is A. So what is professional misconduct? So there are 6 A's. So association with unqualified person, advertisement, adultery, abortion, addiction, alcohol. So advertisement can be repeated advertisement, large signboard, advertisement about manufacturing firm, misconduct with the female patients, illegal abortion, doctor is treating under the influence of ganja, heroin, alcohol. So all this comes under professional misconduct. So the answer is warning. So there will be warning in the beginning. Later it can be temporary suspension, or finally it can be professional death sentence, that is permanent removal of name of the doctor from the medical register. So this can be asked in your exam. So try to memorize. So 6 is all are true about civil negligence except about except So all are true about except. So what is the best answer? Can you try, guys? This is a bit tricky. So if multiple options are there, say example multiple options, so what is the best answer? So multiple options which are true. Try. Except is not there. Say multiple options are there. Multiple options. Civil negligence, simple absence of care and skill, that is true. Simple absence. It is not the gross negligence. So absence of reasonable care and skill leading to death of the patient. Like example, not giving rabies vaccine in case of dog bite, not giving tetanus toxoid in case of road traffic accident, not giving polyvalent anti-snake venom in case of snake bite. So patient consent is a good defense. Yes, it's a true statement. So consent is very important. Consent form can help you in the civil negligence. Contributory negligence, yes, that is also true. Punishment is compensation, that is also true. So the answer is A, B, C, D. Answer is A, B, C, D. So multiple options are there. I'll go with the A, B, C, D. Chalo. The fact speaks for themselves. So the fact speaks for themselves is basically res ipsa loquitur. Like example, leaving swab or some sharp weapon or some instrument inside the abdomen. Novus actus interveniens is because it's a new action between the two original actions. Gross negligence, that is the criminal negligence. So negligence contributed by doctor and the patient is known as contributory negligence. So the answer is A is the correct answer. A. So very simple question. Good. Chalo, then medical negligence punishable under. Very simple, guys. Can you try this question? Can you try? Peaceful warrior. Medical negligence. The punishment is 2 years of imprisonment. like in case of res ipsa loquitur, okay, gross negligence. Like example, operation on wrong limb, operation on wrong patient, so can be criminal negligence, right? So answer is 106 BNS. So very good. So the first answer by Nikki and Rahana, both very good. Great. Chalo. Now look at this image. Doctor accidentally amputate wrong leg on elderly patient in tragic mistake. Is it a civil negligence or criminal negligence? Okay. So what is the answer? Smooth specialist, Gaurav. What is the best answer? Is it civil or criminal, or is it contributory, or is it novus actus interveniens? So what is the best answer? So it's a classical case of criminal negligence. 106 BNS. The punishment is 2 years of imprisonment. Yes, crime it is, basically criminal negligence. That's okay. Fine. Okay, there are many. Most common inquest in India. So as you know, inquest means inquiry towards the cause of death. So manner of death. There are two types of inquest in India: police inquest, magistrate inquest. Most common is not coroner. So coroner abolished in 1999. Medical examiner is the best inquest, that is in USA. So medical examiner is a dual expert, both forensic and pathology expert. Magistrate is best in India under 196 BNSS. So there are three indications we discussed already. One is exhumation, 80 BNS, and custodial death. So the answer is police inquest, 194 BNSS. Okay? So good answers. Good answer. That's okay. Many answered. That's great. So magistrate inquest and all we discussed. Now 5 questions in relation with the toxicology. True about ideal homicidal agent. Homicide, that means murder. That is 103 BNS. So as you know, one ideal homicidal is cyanide. So best is arsenic, because it resembles like cholera. Thallium. There are many agents. Some books use insulin also. Insulin. True about ideal homicidal. Less toxic. So the answer is it's very toxic. Like example, 200 milligram arsenic can lead to death. Diethyl mercury, dimethyl mercury, 1 drop can lead to death. Like example, Durandar movie. Okay, dimethyl mercury, very, very poisonous, neurotoxic. Unpleasant taste, no, it's pleasant taste. Like example, aconite. It is a sweet poison. Sweet in taste. Pleasant taste is important. Strychnine is a spinal poison. It has bitter taste. It is not an ideal homicidal agent. Signs and symptoms mimics like natural disease. That is true. Costly by price? No. So the answer is C is the correct answer. C is the correct answer. Signs and symptoms mimic like natural disease. सबका गलत है, ठीक है, very good. C is the correct answer. Fine. So remember, aconite is a sweet poison. It's a cardiac poison. So it can be mixed with the any food and drink, especially milk or curd. It can lead to cardiac arrhythmia. It inhibits sodium potassium ATPase enzyme, cardiac arrhythmia, cardiac arrest, cardiac block, and death. So aconite is a cardiac poison. This can be asked in your exam. It's known as Mita Jahar. So that is also true. So after the class, go through ideal homicidal and ideal suicidal and examples. Following is an example for organochlorines. Organochlorines, like example, malathion, HETP, TPP, DDT. So we have organophosphorus compounds. Organophosphorus. We have organochlorines. We have carbamates. So organophosphorus compounds, they are classified into alkyl phosphate and aryl phosphate. They inhibit acetylcholine esterase enzyme. So they cause increased acetylcholine. There will be overactivity of the parasympathetic system. So the mnemonic is sludge MTF. Sludge MTF. The drug of choice is atropine. As you know, atropine is a drug of choice. Organochlorine. Okay. Organochlorine basically inhibits neurotransmission. Like example DDT. So carbamates, example carbofuran. So what is the best answer for this? The answer is D. Okay, D is the correct answer. Chalo, bahut badhiya. Now can anyone tell me what is the contraindication, or the atropine is not given in? Atropine is not given in. So not atropine. Atropine is the drug of choice. Oximes are not given in. Oximes are contraindicated in. Very, very important question. Can anyone try? Oximes. As you know, oximes are polydioxime and diacetyl monoxime. They are given in case of OP poison. They are contraindicated in case of carbamate poison. So oximes are contraindicated in carbamate poison. Okay, this is FMGE question. Chalo, theek hai. One more important question. The muscle weakness reversed by, what is the best answer? Muscle weakness reversed by FMGE repeat. You know, muscle weakness is very common in case of organophosphorus compound. The drug of choice is atropine. We also give oximes. Diazepam basically for the seizures. So muscle weakness reversed by, what would be the correct answer? Yes, anyone? Come on, try. Smooth specialist, peace warrior. Muscle weakness reversed by oximes, especially in case of OP poison. OP poison. So atropine does not treat or does not reverse the muscle weakness. Good answer. So try to remember alkyl phosphates, HETP, TEPP, OMPA, malathion, tricloferon, aryl phosphate, parathion, methyl parathion, chlorothion, paraxone, TIC20. Organochlorines DDT, BHC, aldrin, dialdrin, endosulfan, endrin, which is known as plant penicillin, and paraquat. Paraquat. Remember paraquat, there will be white tongue. This can be MCQ in your exam. White tongue is a feature of, the white tongue, a whitish layer over the tongue is a feature of paraquat. The black tongue is a feature of, that is sulfuric acid poisoning. So both are very important questions. So black tongue, sulfuric acid poison, The paraquat tongue is nothing but white tongue. Okay, yes, good. Peacefully arrive. That's okay. That's great. Alkyl phosphates. Try to remember this image. Aryl phosphates, methyl parathion, diazinon, paroxone. You can notice here, parathion, one drop can lead to death. There is something known as one drop syndrome in forensic medicine, or 1 or 2 drop syndrome. One very famous case of one drop syndrome, that is basically parathion poisoning. So one drop over the skin can lead to death of the person because it can enter into the systemic circulation through the skin. It is lipid soluble, that's why. Okay, yes, one drop syndrome, that's okay. So OP poison frequently asked, guys, so this you need to remember for sure. Very commonly asked: splurge, MTF, salivation, lacrimation, urination, diarrhea, gastric upset, emesis, meiosis, tachycardia, fasciculation. So meiosis, remember, this is very important. Can anyone tell me mydriasis seen in? Mydriasis seen in? Can anyone try? Mydriasis means pupil dilation. Meiosis means constriction of the pupil. Yes, good. Good, try. Mydriasis, come on guys, FMGE students. Come on. Mydriasis seen in? Mydriasis seen in case of Datura poison. Okay. Datura is a favorite of examiner. Cocaine poison. So 2 conditions, Datura and cocaine. Meiosis seen in case of opium poison. Barbiturate poison. Okay, many conditions. So this is one very important question. Okay. Morphine, that is basically opium. In morphine also that gives to pinpoint pupil meiosis. So treatment. So treatment of OP poison. So drug of choice is basically atropine. Very simple. 2 to 4 milligram given IV till atropinization. Can anyone tell me what is the earliest response? What is the earliest response in case of atropine IV dosage? What is the earliest response? What is the therapeutic endpoint? Okay, once atropine, then you can start prolidoxine, diacetyl monoxide up to 48 hours. So till aging. Once aging is done, once aging is there, then palm and dam does not help you much. Then you can start diazepam as well. So basically for the seizure. So this is again very commonly asked in the exam. Remember, atropine earliest response is the pupil response. So there will be pupil dilation. The therapeutic endpoint is dry mouth or dry secretions. So that is the therapeutic endpoint. Okay, good. So good answer. Decrease salivation and all. That is a feature. That's great. Okay. Chalo. All are features of poisonous snakes except snakes. One more very commonly asked. So big 4 snakes very commonly asked. Big 4. What is the drug of choice? Anti-snake venom. Okay. Scientific name can be asked in your exam. Difference between poisonous snake and non-poisonous snake frequently asked in the exam. Okay. Okay. Clear chest. Okay. Clear chest is also basically a therapeutic endpoint. That you are right. Pointed tail. Okay. Large belly scale. Say example. This is the snake. When snake has large belly scale like this, cover entire breadth, then it is poisonous snake. If it is like this, then it is non-poisonous. So this is non-poisonous. So this is poisonous. Triangular head, that is classically seen in case of viper. So in viper, So triangular head like this. All vipers. Saw-scaled viper, Russell viper, pit viper, hump-nosed viper, all vipers triangular head. Nocturnal habit, so basically it is poisonous. So the answer is always rounded tail. So most of the poisonous snake, the tail is pointed. Tail is pointed. So it can be round, especially in case of common cobra. Common cobra tail is round, it is not pointed. So the answer is basically D is the answer. Now look at this, there are 4 snakes are there. You need to identify this. Identify this, A, B, C, D. So A, B, C, D. So commonly asked, very commonly asked, guys. Okay, so A is basically common cobra, Naza. Okay, because spectacle mark is there. Spectacle mark is there. So B is Russell's viper, Dubai Russelli. Okay. C is saw-scaled viper. And the scientific name is Achis carinatus. The D is common crate. The scientific name is Bungarus ceruleus. So now again very commonly asked question is neurotoxic snake. Can anyone tell me what are neurotoxic snake? Neurotoxic, hemotoxic, myotoxic. So 3 very commonly asked question. Okay, try. What are neurotoxic snake? Try guys, very commonly asked. So neurotoxic basically Elapidae. Hemotoxic Viperidae. Myotoxic basically sea snake. Okay, sea snakes is the correct answer. Good answer, good, many answered. So very commonly asked. Now look at this video and tell me what is the best answer for this. Usual lethal dose of common cobra venom. Here is the patient suffering from common cobra bite, showing ptosis. You can see here ptosis is the one of the very important feature. Earliest manifestation in case of common cobra bite or common crate bite, which produces alpha bungara toxin, beta bungara toxin. So the answer is 15 milligram. So the fatal dosage 15 milligram. So drug of choice is ASV. ASV. The most common side effect, the question can be asked, that is anaphylaxis. And one more very commonly asked, the approach in case of snake bite, that is known as right approach. Right approach. 15 milligram is the correct answer. That's okay. Okay. बहुत बढ़िया. Then now identify the snake. The venom of below snake is, options are myotoxic, neurotoxic, cardiotoxic, hemotoxic. What we can see here, triangular head, constricted neck, broad body, pointed tail. It has a white wavy line. Bird foot mark is there. So bird foot mark, what is the classical snake is this? Come on, try. So the answer is basically viper. It is hemotoxic. It is a hemotoxic snake. It is saw-scaled viper. Hemotoxic. Chalo, quick. Then, burnt rope smell is felt in the poisoning with. Smell is again a common feature, very commonly asked question in exam. Cannabis, what is the smell? Hydrogen sulfide, cyanide. Cyanide, I remember, it is a bitter almond smell. Arsenic, garlic smell. So the answer is cannabis. The cannabis is the one where burnt rope smell is commonly seen. So you can remember here, cannabis, burnt rope, alcohol, fruity, cyanide, bitter almond, hydrogen sulfide, rotten egg, chloral hydrate, acrid, naphthalene, mothball smell, salicylate, menthol smell, zinc phosphide, fishy smell. The favorite of examiner, FMGE exam, very commonly asked, frequently asked in the exam. ठीक है, चलो आगे देखते हैं. Now try to remember. Okay. Rotten egg, this is hydrogen sulfide. Garlic smell in case of arsenic, in case of phosphorus. So remember, arsenic, Aldrich-Mees line, commonly asked. Aldrich-Mees line. Phosphorus, smoking stool syndrome. Smoking stool syndrome is seen in case of yellow phosphorus poisoning because of the fumes coming out from the stool of the patient. Smoking stool syndrome, brown color, postmortem hypostasis. Okay, yes. And the last question, speedball is speedball. So what is the best answer? Speedball. MDMA, it is a ecstasy is the name given to that. Ecstasy. It is basically party drug. It is basically amphetamine. Chloral hydrate, it's basically known as dry wine. Phencyclidine, angel dust. Answer is heroin plus cocaine. So remember, cocaine, very commonly asked. So cocaine causes release of norepinephrine, high levels of norepinephrine that leads to sweating, hyperthermia, tremors, sometimes myocardial infarction, stroke and other features. So in cocaine, remember, cocaine bugs, very commonly asked. Cocaine bugs. Formication, that is tactile hallucination in case of cocaine bugs, commonly asked. ठीक है, okay, बहुत बढ़िया. Then try to memorize this. Date rape drugs, rohyphenol, that is the flunitrozepam. Ketamine is known as special K. Liquid ecstasy, that is basically gamma hydroxybutyrate. Ecstasy, MDMA. Angel dust, phencyclidine. Speedball, heroin plus cocaine. Mickeyfin, chloral hydrate plus alcohol. Rave drug, MDMA, amphetamine. Magic mushroom, that is the psilocybin mushroom. So this is again FMGE question. Okay, so this completes your most expected questions, very commonly asked in your exam. Okay, if you have any doubt, you can ask me for next 5 minutes. I'm there for 5 minutes. ठीक है. Yes, Gaurav. Yeah, I'm little tired today probably. ठीक है, smooth specialist. So thank you all. So wish you all the best for upcoming FMGE exam. Do very well. Okay. All the best.